this portion of my presentation. Does anybody have any questions?
I have a question, Carla.
Yes, ma'am.
Okay, so going back to your slide where the restaurants are now open at 50%, my question is on that slide, I know that beauty salons had also already opened. Are they now going to be open? They don't have a specific capacity level. So what's the capacity level on those?
They are, sorry, I didn't mean to cut you off. Go ahead.
And then, well, my other part of the question is, are bars also going to be open at full capacity, or is it a limited capacity? Because that wasn't specified either.
So in order to assist the public in knowing specifics regarding the directives, I encourage you again to go to elpasostrong.org and see, we post along with, if you have specific questions, we post the protocols that the governor posted. I don't have that answer in front of me. However, I believe that they are
it's 25%.
They are limited until further notice, and they are, according to the mayor, I don't have that information in front of me, they are at 25%.
Yeah, they're at 25%.
So what I would encourage the public to do is, again, visit El Paso Strong, epstrong.org, and we attach specifics as to bars and restaurants under health orders, and the public can see the specifics as to those establishments for those specific businesses and business owners.
Hey, Carla, can I just interject one point, just so that there's no confusion also with some of the openings? There's also business decisions that are being made in regards to whether they want to open at that capacity. So in some cases, you'll see that, as an example, even though you may have barbershops and beauty salons that are open, you have this specific business that's looking to see if it financially makes sense for them to open up their business with limited capacity. So in some cases, you'll see some inconsistency in regards to some being open, some being closed. The directive allows them to open, but the businesses are making choices on when they want to open.
Correct. The governor was very...
Carla,
go ahead.
Carla, I was just going to say, Carrie makes a very good point, and that same can be said about the city of El Paso offerings. Right. And opening something up at 25% after we've let all these lifeguards go, and when we had to come up with the difference on that 33 million on the existing budget, you just don't magically come up with those dollars again until the businesses get back up and running again. And we don't see the dollars coming back in the current fiscal year. If anything, we hope that next year's numbers come back more aggressively than what we're prognosticating.
Correct. And Representative Rodriguez, specifically based on his revised protocol, the governor has stated that bars or similar establishments can operate in-person service up to 25% of the listed occupancy inside the bar. So that is correct.
Also clarify that outside, if you have a restaurant with outside seating capacity, it doesn't count towards the 50% or the 25% today until Friday. The
Correct.
Issue is you still have no more than 6 at a table and 6-foot separations.
That's correct. Yes, sir.
But the outside doesn't count towards that, nor does council. I get questions, does staff count towards the percentages? And the answer is no.
No.
So clarify that. We have Representative Anello and then Mayor Pro Tem have questions.
Thanks. I'm actually, I'm going to hold off a little bit, Carla. Thank you for the information.
Okay. Mayor Pro Tem?
Yeah, I was just curious, Mayor. You mentioned the numbers that we have. Today is a really sad day because of the people that have passed and our numbers that keep on increasing. I'm curious, you had spoken with the governor a few weeks back. There was a letter that was written by the county judge and other elected officials, excluding our city representatives. I'm curious, have you had any further conversations with the governor and advocating, again, for a more phased reopening? I understand, with our numbers that we're going, and the city manager talks about where our numbers are going and being prudent towards our healthcare concerns, but our community is really, we're fastly approaching the number of confirmed positive cases that San Antonio has. which has a population that's
Mayor
double of
Pro
ours.
Tem, could you repeat that? Mayor Pro Tem, could you repeat yourself? You cut off.
Which I basically am wondering now if the mayor has spoken to the governor since a few weeks ago to advocate for a more sensible and slower reopening, similar to what has occurred, again because of this explosion of numbers. I mean, we are neck and neck with San Antonio, who has a population that's double ours.
Well, Peter, there were some conversations this weekend. The key is the more we test, the more positive we're going to have. And I want to defer to Dr. Ocaranza when he's coming up in the next presentation, which I think you need to wait to hear as we talk about that. But the numbers we look at are hospitalizations, ICU capacity, and ventilators. Those are the issues that you look at. And thus far, as a matter of fact, this weekend, there was another check by Austin with our hospitals to verify that they had the capacity where we were. But so I'd rather defer to the experts when we get to Dr. Ocaranza to give you specifics on that. The governor knows that if we have issues that need to be addressed, that I will make sure we address those with him. And but there was some follow-up this weekend to verify where we were on hospitalizations, ICUs, and ventilators, which are the keys. Unfortunately, with these deaths and these underlying causes, which are a real tragedy, you need to understand that these didn't necessarily occur overnight. What I've learned in discussions with Dr. Ocaranza and Chief DiAgostino and others is we don't get the numbers or the verification on the deaths for reporting purposes until after they've been verified by the county study by the I don't know which word I'm looking for. It's
the coroner's office, Mayor.
Coroner's office, yeah. Thanks, Mario. Coroner's office. So that's it's not like it hit all at once necessarily. Unfortunately, it's still there. But let's defer those types of questions until we get through the reports from Dr. Ocaranza, so you'll understand what's being measured and looked at.
Mayor, if I may. We have an extensive presentation that I think will answer. I don't know that it's going to answer every single question the council has, but the whole purpose of putting this presentation together is to attempt to do that, to answer any and every question that we thought might come up about this issue. That's the reason it's 171 pages. We're not playing around, as y'all can probably already tell. So the questions may be answered through other presentations that will show y'all the level and the depth of the analysis and the work that's been done, that's being done throughout this entire process. The other thing I would say is that there's questions that where council members want to compare us to other cities. We welcome that, in terms of best practices, in terms of the actual numbers. And I'm already asked staff to check that number with SA to figure out if that was just the city and the county, because our numbers include the county. So our numbers with the county are over 1 million people. So we want to make sure that we get the data right. And when anyone asks a question, that we answer it in a prolific manner that addresses the issue, but then also talks about the second, third, and fourth order of effect in terms of how we're attacking the problem. We're not just reacting to things. And I think that we have an incredibly talented staff that takes directions extremely well. And as I said before about the regression analysis and predictive analysis, we're doing some things differently that others aren't doing, but then there's others are doing things that we need to learn from as well. So we understand that. So if there's things like that that are out there, we'd love to hear it. And we've gotten emails. I've gotten several emails from folks that are on the dais and other people in the community. And we've reacted to all of that. And we've shown that we've either been addressing it, or if it's something new, we then include it and integrate it into what we're talking about.
Okay, so I'd ask council, please just save your questions until we finish all the presentations. Thank you.
Very quickly, the next item on the agenda is item 1B, which is an update on the eviction orders. I wanted to notify council, as you all may have heard, the Texas Supreme Court did lift its moratorium on evictions as of May 18th. However, our local Justice of the Peace issued additional orders that will keep eviction hearings from taking place until June 15th of 2020. What I wanted to remind council is you all will recall that in March 17th, and then you have been updating or extending that emergency order every 30 days, provides for protections to our tenants in the event that they are going to be evicted. We request that landlords work with their tenants to establish payment plans. In conjunction with the county attorney's office, as you all know, the county issues similar orders as we do. They attach the JP order that affords additional protections to our tenants through June 15th to avoid evictions from taking place. So that is still going to be in place and allow for additional time. I wanted to just notify the council that had taken place locally, and your ordinance is still in effect until you keep extending it every 30 days. And then there will be an additional presentation later on through Nicole Farini and the work that she's doing with the stakeholders regarding funding for rental assistance that will provide additional assistance to avoid evictions from taking place. That is the extent of my presentation. Thank you.
Good morning. This is Chief DiAugustino. Can you go to the next slide, please? So our COVID-19 response cross-functional team. This team was created by our city manager, Tommy Gonzalez, and it's to expand and enhance the communication and coordination with stakeholders while executing the plan as we attack COVID-19. The health and safety of our community is our priority, and as the task force reports out today, they will be briefing you on everything COVID. Mitigating and responding to COVID-19 in our region. Testing. As the cross-functional team will report out today, our testing efforts has multiplied during the month of May. 98% increase, as City Manager Gonzalez said. While we have been testing since the onset of this pandemic, we were under strict guidance or limitations through FDA and CDC. With the expansion of supply chain for testing, we are now able to offer testing to even asymptomatic patients through partnerships with the Texas military. We have other public-private partnerships to include Walmart, CVS, Urgent Care, and local testing laboratories to thank for this expansion that we've seen in the past few weeks. And the expansion is going to be broadened even more as we go into the next couple of weeks. I want to make sure that we recognize Border RAC for their efforts with the federal lane. They've been there since day one when we first set up the testing site, and we've seen extreme numbers of patients go through that area for testing. We also have the EPFD task force that's now coordinating with Border RAC, and they're going out to hotspots or potential clusters you may have. And so last week they started in going out to all the nursing and the senior living facilities to do testing on site of not only all residents, but also the staff that work in those locations. We also have to look at epidemiology. This division is usually a program of 10, which is more than enough to handle the daily needs of our community. But in the midst of a pandemic, it's hardly enough to provide the needed case investigations due to the increasing numbers of COVID patients in our community. From early on, we started the expansion, and we currently have just above 140 in the program, with a phased approach to get us to upwards of 300. This is far above the national standards and what everyone else is looking at. Education and prevention. This task force has been instrumental since the onset, when we were providing educational materials in public places, such as in front of malls or big box stores, to their more focused approach on targeting nursing or elderly care facilities to ensure the most vulnerable populations are protected. When we look at maintaining our communication with all stakeholders, the CFT team will work to ensure that we are maintaining constant communication with our stakeholders, from the input that is gathered from our community and business partners to include the academic institutions and medical providers. We continue to provide up-to-date information, and later on you'll hear about the enhanced dashboards that will be coming on live soon on El Paso Strong. Looking at how we develop our strategies to ensure the health and safety of our community. The creation of this task force to ensure the collaboration with all stakeholders, to ensure the community's health and safety is at the forefront as we look towards the future and the possibility of a second wave coming. The creation of the COVID Advisory Committee under Dr. Ocaranza That's going to bring medical professionals from around the community in different functions of medical society to give it a phased approach in how we look and how we evaluate the data we have and how we move forward in protecting our community. Keeping the health of our community in mind as we plan for the future. As we've seen, COVID has a deeper impact on those with underlying conditions. Hypertension, obesity, diabetes, all prevalent in our community. These are what we need to focus on. This is the future of El Paso and how we attack this pandemic. Developing strategies to ensure economic vitality of our community. The city manager stated in previous city council meetings that this impact of economic crisis created by COVID-19 may be felt for 30 months. To ensure the El Paso businesses are able to recover, economic development has been working with various stakeholders to provide the assistance businesses need. We're also looking at coordinating with stakeholders to ensure that we are meeting the needs of our community. Nicole and her team with community development are working with numerous stakeholders to ensure we're able to respond to the community's vulnerabilities, focusing on human services such as rental assistance, homeless assistance, and food security. Preparing for the long-term response. Included in the presentation today is not only what we're doing to respond to COVID-19 emergency and the response to assist our community today, but what are we doing to prepare El Paso for the future. The coordinated efforts of this cross-functional team will be able to ensure that we are responding to the needs of our community during COVID-19 emergency and into the new normal as we face economic uncertainty and a new awareness of how pandemics change our lives. Looking at the org chart here before you, we have several topics we're going to cover, from our financial focus to our community vulnerabilities, how we've been handling logistics and the distribution of PPE and supplies to the community. We're going to start today's presentation going into the health focus. The health focus is going to be covered by Dr. Hector Ocaranza. He's our health authority for the city county of El Paso. Dr. Ocaranza is a medical board certified pediatrician. He's been with the Department of Public Health for over 12 years, and in that time, he also gained his master's in public health. He has vast experience over the BioWatch program. He was a member during the Ebola preparedness of 2014, the TB outbreaks that we saw when we had over 700 infants exposed in 2014, and he was part of the 2009 H1N1 influenza pandemic team. He brings great knowledge to our city, to our county, and we'll move on to his presentation. Thank you. Doc, you there?
Hello, can you hear me? Can you hear me?
Yes, sir. Yes, sir.
All right. I'm sorry. Good morning, Mayor and Council. And as I said, thank you very much for giving me the opportunity to present and give an overview of what COVID-19 has been in our city. It has been very challenging times, and definitely we've seen a lot of COVID-19 ever since December, January 2020, where COVID-19 made its global presence, starting in Wuhan, China, and making its way all the way to the 5 continents. And next slide, please. So for everybody's knowledge, COVID-19 is the name of the disease that is caused by the SARS-CoV-2 virus. What is SARS-CoV-2 virus? It's named because it was named as severe acute respiratory syndrome coronavirus 2. There is a group of 3 viruses that are of public health importance, and the first virus of importance that was named SARS, it was way back in the 2000s, where we named the severe acute respiratory syndrome. Started also in the Far East, and it made its way. We were able to prepare for some of that because of the possibility of become a pandemic, but fortunately it didn't. The Middle East later on, we saw the MERS-CoV, the Middle Eastern Respiratory Syndrome coronavirus, which also had the possibility of becoming a pandemic, but fortunately it was contained in the Middle East. And now that we see that the SARS-CoV-2, the causative organism of COVID-19, made its way all throughout the 5 continents, causing mortality, causing morbidity, and it has made us adapt and change the way that we live up to now. We know that these coronaviruses, there's many strains of the coronaviruses. We see them in the winter season because it's the causative agent of many colds during the winter season. So initially, when people started listening about the coronavirus, it was very important to differentiate that there was just the coronavirus that was circulating in our community causing colds, and it was not the novel coronavirus SARS-CoV-2. There were some testing that was being done around the city that can detect many of these coronaviruses, at least 2 of the strains that can cause colds and flu-like symptoms in the community, but we didn't have the testing available to identify the SARS-CoV-2. CDC released the testing, and it was released to very limited number of laboratories. Fortunately, El Paso was one of those laboratories because we belong to the LRN network, which is a very specialized network of labs that can handle those kind of viruses and bacteria that are of public health importance. One thing to note and of importance is that the origins of the coronavirus, we believe that it was coming from some animals because we know that some of the coronaviruses, the SARS, jumped from an animal species to the human. The MERS-CoV, it is believed that it jumped also from camels to the humans. And we have now the SARS-CoV-2 that we have found in bats, and unfortunately it transferred to the humans. That's how we have seen that after it jumped from species from the animal to the human and having the human to human transmission, that can make the possibility of becoming an epidemic and ultimately a pandemic. Signs and symptoms of this disease, as we have seen over and over. The initial symptoms we saw, especially for the experience that we had in Wuhan, China, that most of the patients, over 80% of the patients, would present with fever, and then it would present also with cough and difficulty breathing. It was of particular importance that a lot of the patients that were affected by this virus would develop severe respiratory distress, needing ventilatory support and supplemental oxygen, and unfortunately the mortality due to this virus was extremely high. Over 50% of the people that would get infected would die. So that was worrisome to the World Health Organization, to the Chinese Centers for Disease Control, and to the world in general. We monitored closely how the virus was affecting individuals, but we were learning at the same time because we didn't have any experience as how the virus affects the body and why so many people was dying from this disease. This disease was affecting mainly the respiratory tract, but as we got to know the virus a little bit more, we can see that the virus affects many organs. It creates multi-organ failure, and ultimately people passes away from the complications of the virus. Very important to know that the complications from the virus can happen to anybody, but it's of particular importance that there's at-risk groups that are most vulnerable, which we have heard and we mention over and over, people with high blood pressure, people with diabetes, obesity, kidney problems. Those are the people that may suffer the consequences and the complications and ultimately dying from the coronavirus. How does the virus invades the respiratory tract, or how does the virus attacks the body? It is fascinating. As you see in the picture that we have put there on the slide, the virus has some expressions from the surface, which are proteins that attaches to the respiratory tract cells. it is very particular receptors that are found in the lungs called the ACE2 receptors, and the virus from there attaches and starts invading the cells and ultimately the body. The body becomes viremic and starts replicating, causing the body to shed the virus, new virus, and that's the way that one person can infect the other person. As the body tries to fight the infection in the body, it creates a lot of inflammatory markers, which in turn are the ones responsible for many of the pathologic features that we see in COVID-19. We see that all that inflammation and migration of white blood cells to those organs causes inflammation. A lot more inflammation can cause a lot more destruction of those organs, and also causes a cascade of events that can lead to extensive clotting, and all these clots can happen anywhere in the body. That is one of the reasons why we see a lot of reports nowadays in the media that the clotting that happens in patients with severe COVID-19 infection develop, and is one of also the main reasons why the patients end up in the ventilator and can die or succumb to the complications of this. We have heard also in the media, and many of us in the medical community are very concerned because many of the patients, once they develop the infection with the SARS-CoV virus, develop what we call inflammatory response storm, which it tries in the body, tries to fight the infection, but in the contrary, causes a lot of damage by releasing a lot of those inflammatory mediators. We know that once many of the organs get affected, we start having many other symptoms, like the vomiting, like the diarrhea, like the body aches. And one of the features that is quite interesting that we haven't been able to understand very well is that a lot of these patients develop problems with smelling and tasting. Even though many of the patients cannot develop any fever, but it has seen that probably 1 out of 5 develop only the lack of smelling or tasting. Next slide, please. How do we make the diagnosis of the COVID-19? Well, we have 2 ways of the diagnosis, but the most accurate way to diagnose an acute infection is by the PCR. PCR stands for polymerase chain reaction, where we try to find pieces of the virus and express the genetic material from the virus through this testing. The other way that we can test for the response of the body against the virus is doing antibody testing. There's 2 kinds of antibodies that we look for. One is the immunoglobulin M, and the other one is immunoglobulin G. Immunoglobulin M also is an acute phase antibody that is produced right after the body becomes infected. It rises sharply, and then it goes down and disappears within a couple weeks. It helps us fight the acute infection. But then at the same time, the immunoglobulin G starts rising, and that's what gives the memory and the immunity against future infections of the virus. On the PCR testing, or the molecular type of testing, where we look at pieces of the virus, we have the very complex testing that is done in laboratories like the Health Department lab or many other big laboratories, or the labs from academic institutions such as the one at UTEP or Texas Tech. But there's some other rapid testing that looks at the molecular parts of the virus, and there's 2 of them that have been approved by the FDA. One of them is the Abbott machine, and the other one is Cephalid. Both of them give us a great information when we're dealing with patients and trying to preserve our personal protective equipment. The antibody testing, it has its place, but not just to diagnose acute infection. It's mainly to see the prevalence of the disease in the community, since we know that many of the community members may get affected by the virus and never develop symptoms, or their symptoms might be very mild. And by doing that, if we test the community with antibody, then we're going to be looking at mainly immunoglobulin G and see how prevalent the virus has been in the community, while doing at the same time PCR testing in all those people that are symptomatic, people that are considered to be at risk because they live in congregate facilities, or maybe because they belong to at-risk groups or they've been exposed. The treatment, as we know, there is no treatment available to cure COVID-19. There are some medications that are being under investigation, and one of the most popular ones that we have seen is the remdesivir, which is an antiviral medication that interacts in the way that the virus replicates in the body, and it blocks that replication by inserting into the genetic material and information of the virus and not letting the body express the virus and subsequently replicating. Another modality of the treatment is by convalescent serum or plasma. As we know that the people get infected, the people develop immunoglobulins, as we mentioned before, and those immunoglobulins are protective. And by having people recover from COVID-19, we can extract the plasma or serum and administer to those patients that are in critical condition, and we have seen some positive effects. That treatment modality has been followed and has been done here locally by many of our great physicians and experts that we have caring for our members of our community. The way that we've been doing testing, and we put a picture there so we can see and get a more clear picture of how the testing is, because we know that we have that swab, and at the beginning of this pandemic, those swabs were in very short supply. So we needed to take very good care and aim and start testing those that are considered mostly at risk. The way that we see the disease is in several ways, and disease severity is in how we have patients in the hospital, how the characteristics of every patient in the hospital, but also we see how the people in the community are getting affected. This kind of testing is not very comfortable. It's done by health professionals, and we have a wonderful team at the drive-through setting and also through the mobile testing sites. They're taking a sample from the nasopharynx or in the middle of the nose, trying to get as much virus as we can. We put in a viral transport media and we send it to the laboratory for processing. As we develop new testing, we can take samples from saliva, but also in critical ill patients, we can do testing on bronchial alveolar lavage specimens that are done when the patients have a bronchoscopy, or from tracheal aspirates when the patients are intubated and on mechanical ventilation. Going back to the treatment, one of the treatments that, or one of the armaments that we have to stop a virus is through a vaccine. We had no vaccine available because we have never seen coronavirus affecting so much people and causing so much morbidity and mortality. There are several vaccines that are being developed at this time, and unfortunately, we're not going to have it within a few months, but they're working tirelessly to produce and find an effective vaccine that can help around the world stop those complications and modify mortality around the world as well. There are several ways that vaccines are produced and created, and mainly the way the vaccine works in the system is by having pieces of the virus presented to our immune system, and our immune system, by having to recognize that small piece of the virus, creates immunity and memory against that virus. So for future exposure, once the body is exposed to the fully strong virus, it will mount an immune response, and it will bring out all those memory antibodies and fight the infection, and it's not going to let the virus attack our body and continue causing damage within the body. Next slide, please. So what do we have to attack this pandemic and attack the virus? Well, the best tools that we have is prevention. Prevention is what we have been telling everybody to practice, because that's the way that we're going to be able to be victorious against this pandemic. But it takes everybody to do the prevention. One of the main things that we have against these respiratory viruses is going to be social distancing. Social distancing is extremely important because we know that the virus is transmitted through infected droplets coming from infected patients. When we're in communication with other people, the closer we are, the more likely it is that we're going to be exposing other people through our respiratory secretions that might be infected. And virus can be found in many of us, even before we exhibit symptoms. We know that the most infectious period for these patients are a few days before they exhibit symptoms and a few days after they start exhibiting symptoms. So the social distancing is extremely important. We have said that we need to keep a distance of at least 6 feet, and we need to modify the way that we interact with each other. We've said that we are a community based on many family values, and we like to be close to each other. We used to do handshakes to greet people. We used to give hugs when we meet or say goodbye to any of our loved ones. But now we cannot do that because we know that we're going to be putting them at risk. The hygiene education is extremely important. We practice a lot of this hygiene education in the area of the H1N1. And one thing to remember is that schools did a wonderful job with all of our kids, because before the H1N1, nobody would cough in the internal part of the elbow until we started teaching the teachers, teaching those school nurses that we need to tell our kids to cover their cough, to wash their hands, don't touch your face, because the face is the main door of entrance of any respiratory virus to the body. So by practicing all this, by having your hand sanitizer, that's the way that we're going to be also putting a barrier, and we're going to be preventing us getting infected with all these viruses. And lastly, as we heard, initially we said, well, face coverings. We need to reserve face coverings for all the healthcare workers. The face mask and respirators such as N95s definitely are reserved for healthcare workers, because those are the ones that are in very close contact with patients. They're caring for them. They're working tireless hours caring for all those that are infected with the virus. So also, initially, a lot of the personal protective equipment, or PPEs, were in short supply, and we needed to save those for those that are caring for those most vulnerable patients and that are admitted to the hospitals. But as infection spread throughout the community and we saw community spread, then we started recommending everybody from wearing their face covering. Why? Because that's the only way that we're going to be preventing those infected secretions from infecting other people around them. But also, the same way as social distancing, we need the participation of everybody. Our community has been very responsive and has been doing wonderful in following all the recommendations that we have done, because unfortunately, we have seen some families being shattered by complications of COVID-19 or death within our households. And it is extremely sad to know when somebody dies of COVID-19, and it's something that we could have done to prevent some of this. So the three pieces of prevention, the social distancing, the hygiene education, the face covering, and the participation of everybody is what's going to help us now, but it will continue helping us in the long-term approach to this pandemic. Next slide, please. Looking a little closer and deeper into the COVID-19, we know that it affects equally males and females, but we're seeing a disproportionate amount of males dying from COVID-19 compared to females. Some researchers postulate that that can be related to the protective effects of estrogen that also intervene with those ACE2 receptors, and it doesn't let the virus attach to the cells and start replicating. There's still a lot more research that needs to be done and a lot more learning that we need to gather in regards to the COVID-19, that we will continue seeing new improvements and new research coming out, and we will have a little better understanding of how COVID-19 affects the body and how we're going to be able to attack it in a better way. We know that the complications come in those that are considered at high risk. And who are those at-risk groups? Well, those groups are people that are older than 65, people that have complications from other chronic conditions like kidney disease, from diabetes, all the people that have diabetes, especially those that are poorly controlled, people that have high blood pressure or hypertension, obesity is another one, people that have pulmonary problems, COPD, asthma, people that smoke, those are considered that are vulnerable and develop more complications from COVID-19. But also we cannot forget those people that live in congregate settings, such as nursing homes, assisted living facilities, correctional facilities, any other setting that has many people in the same place that are considered congregate settings. We have learned that young people generally have very mild symptoms, and that's what we see, that we have a very, very low hospitalization rates for those that are young, and minors have very low hospitalization rate compared to their older adults. And many of these children develop very, very mild respiratory symptoms, may not have any fever, and then they resolve and they get a lot better. But these children and these young people can be the ones that can bring the virus to other households and other that are considered to be at risk. So therefore, we need to be very careful with everybody who's in our household so we don't bring the virus to some other loved ones that are considered to be in the at-risk group. The incubation period for the virus is between 2 to 14 days. And people that are considered immunocompromised might not develop the same symptoms and might exhibit and shed the virus a lot sooner than other people that have an intact immune system. We start seeing symptoms developing in a median time of about 5 to 6 days, and also getting admitted to the hospital within 10 days of being infected with the virus. As we mentioned before, it spreads from person to person most effectively through the infected droplets, and those infected droplets can remain suspended in the air depending on the environmental conditions. And the patients that are mostly contagious are the pre-symptomatic, which are the ones that are going to exhibit symptoms, but it's a few days before, and also that are symptomatic. So we cannot let our guard down if we don't feel the symptoms, but if we were exposed to the COVID-19 and we were infected, we might be infecting other people by going outside, by sharing space with other people and gathering. That is the reason why we have send so many messages as far as the gathering, so many messages of social distancing, messages about caring for our loved ones. Next slide, please. So the three most important steps to stop epidemics, pandemics, is going to be by detecting the virus, identifying those that have been in contact, and isolating those that are infected and those that have been in contact. Those are the three most important pieces, and we're going to be hearing a lot more with the rest of the cross-functional team, how all the particular information about each one of these very important pieces for the epidemic control. We know that for somebody to get infected, we have a paradigm between the host, we have the infection or the infectious agent, and the environment. And the interaction between the three of them is what's going to make somebody a little more susceptible than others. How do we do the testing? Well, as we mentioned before, we need to start testing people to find those that have the virus or that are infected. And at the beginning, we need to be focusing our efforts in doing more targeted testing. As the disease progresses throughout the community, we do a more widespread testing of the community, and we look at different places so we can take representative samples of the whole. Once we identify those that are infected, then we need to identify those that have been in contact with that. And that is the key element of contact tracing. We need to notify them that they were exposed. We need to let them know that they need to be in quarantine. And if they exhibit any symptoms, they also need to be tested. People that have been exposed, depending on the setting, also are going to be tested so we can find more infected individuals after the first exposure. And by isolating everybody that is symptomatic, by isolating those that are infected, we're going to be able to control the way that the pandemic spreads, because if we have one infectious person out in the community and gathering, it's going to be exposing a lot of people, and the pandemic is going to grow exponentially. We have a way to stop it by having the participation of everybody. Next slide, please. Next slide, please. Thank you. And in a timeline that we have, we know that December 2019, that's when we started hearing about Wuhan, China, and how all these cases were coming about, a severe acute respiratory syndrome with high mortality. The world has seen how it spread from China to Asia, to Europe, to the Americas. And with the global traveling, it is extremely easy for infectious agents to disseminate a lot quicker than before. Our first case in El Paso was in March 13, and since then, it has been an abundance of activities to protect our community and aim specifically at protecting our most vulnerable ones as well. With the declaration of local disaster on March 13, it opened a lot of doors for funding. It opened a lot of doors for many of the other activities that needed to be taking place. And I'm very grateful from the City Council and Mayor from approaching this pandemic in that way. Also the cooperation with the County of El Paso and the City Attorney's Office, how they were able to work together to have similar declarations and similar orders in place aimed, again, at protect our community. Also, the Governor Abbott declared a disaster around the same time on March 13. And we submitted some health authority orders initially for the schools. And the schools, because our children they needed to be also protected, but in the same way, it's a way to protect the older loved ones that are considered at risk. Unfortunately, we had our first death on April 8, 2020, and since then we have seen an increased number of people dying from complications of COVID-19. COVID-19 is still going to be in our community, and unfortunately, many of our loved ones are going to be suffering those complications and ultimately are going to succumb to that. But hopefully we can continue doubling our efforts in trying to prevent this from happening. We started reopening Texas with the governor's orders, as Ms. Neiman said, and since then at midnight, April 30 or May 1st, we will continue opening some of the businesses in Texas. It will continue balancing public health with economics and how we can continue to recover from this pandemic. Next slide, please. Looking a little bit more in the demographics of our community, we know that people within 18 and 64 years of age is the largest group in our county. And by looking at that, we know that we are a very young community. We have a lot of families, and unfortunately, we have multi-generational households, especially in the outskirts of the city and in the county areas. 35% of our population are considered minors, younger than 18. And we have many times our extended family caring for those children because people that are able to work are out there working and trying to support the families. Next slide, please. With this graphic, we're trying to depict how the population and demographics of our county and city compared to how we're seeing on the positive cases within our city and county. As we see, the 18 to 64 years of age is the age bracket that is mostly affected by positive cases. And also in the minors, younger than 18 years of age, it's a very small representation of positive cases. This might be due either because of not exhibiting symptoms and we haven't tested those minors, or also because a lot of us have been caring for our young ones and have been keeping them home. They're not gathering, they're not having their birthday parties, they're not having other kind of gatherings, and therefore they're not being exposed to the virus and they're not getting sick. We have been very fortunate as not having many admissions to the hospital because of COVID-19. And there is a very severe syndrome that is being described in children, the multi-syndrome inflammatory syndrome of childhood, which is causing a great concern within our pediatric medical community. We're very vigilant about those, and hopefully we don't see cases of that in our community. We're seeing that people that are older than 65 are also being affected by the virus, and about 15% of the positive cases have been that. And unfortunately, in few slides, we're going to see the mortality, how it compares that the older the age group, the higher the risk of dying from complications of COVID-19. Next slide, please. As we break down by ethnicity and race, we know that El Paso has the highest ethnicities, the Hispanics, with over 80%, followed by white non-Hispanic races. And we have very small representation of other races and ethnicities here in El Paso. Next slide, please. And again, here making a comparison in how the positive cases, race and ethnicity is being compared to the demographics of the city and the county. We see that Hispanics are mostly affected, and followed by whites, non-Hispanics, and also African Americans. We need to mention that what we see as demographics and how the disparities of the virus in the country, we know that African Americans and Hispanics are being disproportionately affected. But here in El Paso is no different, but also because we have a disproportionate share of Hispanic, and we're predominantly a Hispanic community. Next slide, please. But we cannot forget about the other ethnicities and other races, and we all need to protect each other. We all need to be watching out for our neighbors, our loved ones, and everybody that is around us. Gender breakdown within the community, we are equally males and females. Next slide, please. And the way that the virus has been affected also in positive cases in our community has been very representative of what we have in the community as far as the gender breakdown. We see that the virus doesn't have any predominance of male or female, but we will see as far as the mortality, how we're seeing a disproportionate affection of males compared to females. Next slide, please. What are the health indicators within the El Paso County? Well, mainly we have people with high blood pressure and diabetes. We know that also looking at the country as a whole, we have diabetes and high blood pressure being very prevalent within our minorities, especially African American and Hispanics. And one thing that we need to battle here in the border city and here in our town is that we have a very high proportion of patients with no health insurance. Next slide, please. And overall, 1 out of 4 might not have insurance. But here when we see the positive cases, we see that 1 out of 3 of the positive cases don't have any insurance. And unfortunately, if those people have any health conditions, they're going to be disproportionately affected. And they're going to be the ones that are going to be developing complications because they are not able to go seek medical attention to control their chronic conditions. And therefore, they might not be able to go and seek medical attention when they start feeling sick from COVID-19. We see that high blood pressure in our county is a number 1, followed by diabetes, but it's very similar the way that the positive cases affect the people with high blood pressure and diabetes, or the way that we have found them. We know that cardiovascular disease is another big one, and the way that we eat and the way that we exercise or not exercise have a lot to do with developing heart disease or coronary artery disease, diabetes, high blood pressure. High blood pressure may be also a complication of the diabetes as well. Next slide, please. And the number of comorbidities, even though many people have one, but you can have many of these comorbidities. And we see that almost half of the population here in the county, in the city, have more than one comorbidities. So we need to be extra careful with all of those. Message that we have sent and education we have done in regards to keeping our most vulnerable ones safe by bringing them the medication, by being able to take them to see their medical provider and control those chronic conditions so we can get them in shape and being able to fight an infection in case they become infected. Next slide, please. Touching a little bit about the testing, we've done quite a bit of testing. From the beginning, we were doing little because of the limitations that we have by the FDA, CDC restrictions, because we needed to have very strict criteria and how we were going to be able to test those people in our laboratory that was initially approved to be doing the very complex testing. And in the next graph, we're going to be seeing how the testing has increased by week. and the tests that have been done per 100,000 of population. Next slide, please. If we see a nice increase by weeks, and we're following up on the CDC weeks, and it's a very well-established way to keep track of many of the conditions and indicators if we follow the CDC weeks. But if we see how we have dramatically increased the way that we've been testing our community, and we're reaching our goals that we have set, and setting up those mobile testing, setting up and increasing the capacity of our laboratory and our testing sites have helped us tremendously continue looking at the community and how many of these members of our community are being infected with the virus by doing the PCR testing. Some of the cross-functional team are going to be touching a lot more and describe many more of the details as far as the testing in later presentations. Next slide, please. By standardizing the testing and how we're finding the positives in the testing that we've been doing, we can see very sharply how during these weeks, the number of testing that have been done has reached over 100 tests per day per 100,000 population. One indicator that we're also looking at is the positivity rate. If the positivity rate continues climbing, then we will be having a lot of problems. Experts have mentioned that when positivity rate reaches over 20%, we will be considered a hotspot, but fortunately, we have remained for the most part below 10%. We want to continue seeing this positivity rate below the 10%, and as more testing continues and more people we found positive, hopefully we don't find that positivity rate going up higher than 10%. We will continue doing widespread testing, but also targeted testing, the same way that we've been doing with correctional facilities and nursing homes, assisted living facilities. We have given priority to testing in patients that have been admitted to the hospital because we're very interested in seeing how severe the disease is in our community. Next slide, please. In the next slide, we're going to be seeing some of the total cases that we have seen and how it has increased through time since the first patient that we found positive. And we're going to be looking at the doubling rate and the infectivity or the transmission rate. Next slide. Since case number 1, we've seen how the curve has been going with an upward trend, and it's quite difficult to predict what is going to happen with the number of positives, and we have a wide range. As the time goes by, the numbers on the left has been the positive cases, but the shadow area on the right is how it can be predicted that it can go. Can we bring it down lower? Yes, we can, but it's, again, a work for everybody and a work in the collaboration between all the stakeholders. And all the stakeholders is everybody in the community, from government to private entities to education facilities, either higher education or K-12. Every single member of the community can help decrease the spread and help decrease the number of cases that we have in our community. Next slide, please. The way that we've seen our doubling rate of cases, if we see that it was having a small area of not increasing, but what we want to see on the doubling rate is that as we control the way that the pandemic spreads, our doubling rate starts rising because we have a lot more days from doubling from one number to the next one. So this upward trend is what we want to see and continue seeing as the days go by, and we continue looking for more cases, but we see that we don't have that many positive cases in our community. Next slide. That has an inverse relationship with the transmission rate, that instead of going up, is going down. It has remained stable as we see here in this table. Next slide, please. We're going to look a little bit more as far as the positive cases and divided by age and gender. And even though the 60% of the cases are in people younger than 40 years of age, females are equally affected than males in all ages. And unfortunately, even though the cases are in small proportion in older people, but we're going to see the higher proportion of deaths are in the older age group, older age bracket. Next slide, please. This demographic pyramid can show us how, because of our community is built between people from 18 to 64 years of age, and we see that they're the mostly being affected. Males and females being almost equally affected in the positivities or in the positive cases, and how we divide it by male and female. Next slide, please. We look at the hospital admissions. And here, that's when we start seeing that the hospital admissions are more common in males. We have seen a steady increase, and we have seen increases in hospitalization rates that happen after certain events such as holidays. We've seen how after holidays, we see an increase in hospitalization rates, we see an increase in positive cases. And in the overall admissions to the hospital, 50% are on people older than 60 years of age. Next slide, please. This graphic also shows very well how we have seen an increase in hospitalizations and admissions by week, and it has been increasing steadily since. And we see some sharp increases, and those might be due to some of the holidays that we have mentioned before. Next slide. In the admissions by age, as mentioned before, about 60% of the admissions are in people 60 and older, even though we have some admissions on younger people, but they're not very common. Next slide, please. In forecasting the hospital admissions, even though we see an upward trend, it's extremely hard to predict what's going to be happening in regards to the hospital admissions. The line that looks like a jagged line, it has been all the spikes and all the hospitalizations that we've seen it throughout these weeks, and the shaded areas is from predicted models, and if we see that it has a very wide variability in how we can see it in the future. Next slide. Our cumulative hospitalization rate also has continued to increase, but hopefully we can see that it continues in a not so upward trend. Next slide, please. Now going to the deaths and mortality rates, we're going to see how the older we are, the more likely it is that somebody's going to die, especially if they have any underlying health conditions. Next slide, please. The COVID-related deaths, we see that it happens very disproportionately between males and females, and we have a lot more males than females dying from complications of COVID-19 here in our city. The older we are, the more likely it is that people can die from complications. And we can see it very clearly. Fortunately, we have not seen any pediatric mortality due to COVID-19 or younger people. The youngest members of our community that have passed away due to COVID-19 complications have had underlying conditions. So we need to be extremely careful with all those. Next slide. the mortality rate by age group, we can see what has happened across the country. The older we are, the more likely it is that we're going to die. And we have a very high proportion of people dying when they're older than 70 years of age. And it has the vast majority of the cases in those three age brackets. Next slide, please. Here in this pie, we see how the age group separated by the deaths by age group, and 3/4 of those deaths have been about older than 50 years of age. So we need to be extremely cautious. This is just a very good representation on how we need to be caring for our elders. Next slide, please. We see a disproportionate share of males and females as far as the deaths, and we have a ratio of 2-to-1 in the deaths, males to females. Next slide, please. The underlying health conditions at the time of death, 65%, close to 65% of the people had high blood pressure as an underlying condition. Half of the people that have died have had diabetes. Others have had heart conditions, lung conditions, kidney, and some other kinds of cancer. Next slide, please. And if we see the line in green, the case fatality rate, even though it has an upward trend, hopefully we continue seeing a decrease. And this last week we saw that our case fatality rate has dropped to 2.4 approximately. Our mortality rate, standardized to 100,000 of population, also continue rising. But hopefully we will be able to control this by all the measures that have been instituted. We need to continue our planning, and we need to continue without letting our guard down. Next slide, please. The doubling rate for deaths also has had an upward trend, which is favorable, and that's what we want to see, that we don't want to see double the number of deaths in a very short period of time. So we want to see that it spreads and continues being longer and longer the time it takes to double the rate of deaths. Next slide, please. So what is next for El Paso in regards to COVID-19? We know that we're going to be living with the virus for quite a bit of time. We don't know how we're going to be able to tackle the virus, if there's going to be medications available. We're hoping that we should have the vaccine available at a later time, hopefully soon. And with the vaccine, that can be a game changer, because the vaccine is going to be giving us the opportunity to protect the most vulnerable ones, but also having a widespread immunization program throughout the community, so we'll be able to protect all age groups and all members of our community with this important tool. We need to continue the planning for returning to school and returning to work. How can we do it to make it in a safe environment? How can we do it to continue monitoring the situation? And we will look very closely at influenza-like illness rates in our schools, because that's an indicator how our kids and our households are getting infected by not just the COVID-19, but many of the other respiratory viruses that we're going to be encountering this coming winter season. We need to plan for a second wave. The second wave is coming once we have people bring down their guards and they don't practice much of the social distancing by not following those hygiene recommendations that we have given. If vaccine is available and people don't get vaccinated, that's when we're going to see a spike in cases of the COVID-19 in our community. The next flu season is going to pose a great challenge to us. but with the community efforts and involvement of all the stakeholders, we will be able to get through this. Next slide, please. We need to continue observing fiscal responsibility with the resources that we have. We need to apply them in the correct way, and we need to put them to work so we can continue showing that fiscal responsibility. And as always, the balance between public health and the economy, how we can reestablish the economy in the most secure and the safe way, so we will continue protecting the health and well-being of our community. And that has been one of the missions that we need to do by the cross-functional team, and how we can approach this problem in a local way with many local talent that we have throughout all our stakeholders. And with that, I thank you very much, and we will continue the presentation.
Mayor, I would just like to say that when Dr. O talks about the local talent, he's one of those people that are very talented here in our region. He actually grew up in Juarez. He's a Juarezeño, and he did his residency here in El Paso, opened up his practice in Anthony because they had no services in the area. So Dr. O is an extremely talented and educated and highly experienced individual who really cares deeply about our region, and has demonstrated that not only in his word, but in his deeds as well. So we've not done a very good job of showcasing him, but he's done an incredible job leading this entire public health effort for our community. Next will be Robert Cortines.
Thank you, sir. IT, if you can go to the next slide, please. Next slide. So this section of the presentation, I'm going to talk about the federal grants that we've been awarded. We spent some time at the last council meeting talking about the Coronavirus Relief Fund in particular, which is awarded as part of the CARES Act. But in addition to that, there's other federal funding that we've received as well, which is going to be beneficial in not only helping us from the response perspective of dealing with this health crisis, but also helping some operational challenges as well, in particular with our mass transit and our international airport. So I'm going to go through some of those, and then I'm going to talk a little bit about the HEROES Act, which you all took an action on yesterday in regards to that letter of support for that piece of legislation, which is currently being reviewed and discussed. IT, can you go to the next slide? So this is a summary of the 6 different federal agencies of which we've received federal funding from, totaling over $182.5 million that we've received. So the largest, of course, which we've talked about pretty extensively, that $119 million from the U.S. Department of Treasury, but not to be overshadowed by the FTA, that almost $41 million that's going to go towards our Sun Metro. Also additional money from the FAA for the international airport, money from the Housing and Urban Development, also from the Health and Human Services, and then also even the Department of Justice. Next slide. So on the FTA side, there was a total of $25 billion that was included in the CARES Act. Sun Metro's piece of that was just under $41 million, so $40.8 million. One of the good things about that is that there's no city match. It's a 100% federal share. And these funds are going to be able to be used to support not only the operating, but also capital and other expenses which are eligible under their current programs. Next slide. One of the big things with this, and I've mentioned this during some of the updates that I've done over the last several weeks, is that not only can it be used for expenses to maintain their transit services, but it can also be used for administrative leave for employees that have been impacted due to reductions in service levels. And so I wanted to spend a little bit of time here because there's been questions about using the coronavirus relief funds to help employees that have been furloughed or terminated those contract positions. However, those coronavirus relief funds, remember, have completely different guidance. And so the FTA, again, each agency is different, the way that these funds have been allocated. These funds in particular, the guidance that's been provided for the use of these funds states that it can be used for those employees that have been impacted as a result of the reduced operations. And so next slide, please. So Sun Metro's plan is that they're going to utilize these funds for not only the current fiscal year to offset the impact that they're seeing I showed you some of the ridership numbers that we're seeing as far as decreases yesterday during the presentation and that budget update. So those funds are going to be used to offset the impact from this year, and then also will help with the expected budget challenge for next year as well. So some of the grants, as it mentions there, going to be used for some capital items, some additional bus shelters, also some shop equipment, and then also some related supplies and materials. Next slide. On the Federal Aviation Administration funding that we received, in the CARES Act, there was $10 billion allocated to eligible U.S. airports, again, to respond to the coronavirus impacts. The El Paso International Airport's piece of that was $15.4 million, and again, similar to the FTA, 100% federal share, which means no city match. So it was really, really good to see not only the allocation of these funds, but then also not having to put up a city match was very, very beneficial. Next slide. Again, the expenditure for these funds, of course, needs to follow the FAA revenue use policy. One of the stipulations tied to this funding is that the airport must continue to employ 90% of the employees that they had as of March 27th, and they must maintain that 90% through the end of the calendar year. And so similar to the FTA, it's, there's different requirements, different guidance for each of these pots of money, and this is one that was included in the FAA allocation of funds. Next slide. So the International Airport is going to be using these funds similar to the Sun Metro for not only this current fiscal year, but also for next year as well. They're going to be able to use these funds to help pay some of their debt service for this current year, some additional security, custodial and parking lot expenses, some of the firefighting and police employees that they have that are assigned to the airport, and then some of the things that have happened which may not necessarily be reimbursable, but the temporary abatements and some deferrals as well that have taken place. Next slide. During the coronavirus relief funds, we did talk about that $119 million, and in addition to that, we talked about the additional funding received for the CDBG and the ESG, the Emergency Solutions Grant. So the Housing and Urban Development, the City of El Paso's allocation, just under $5.8 million. Nicole Farini outlined how those funds are planned to be used, and she'll cover that here in her section coming up again, but additional funds again to go towards rental assistance, utility assistance that we can use for those important programs for our community. Next slide. Again, that $5.8 million, you see the list here. Nicole Farini went into detail on those different areas. Her section will be following mine, and she'll go into more detail in regards to these particular programs and the outreach that have been done with all of the stakeholders involved. Next slide. For the Department of Health and Human Services, the City of El Paso received $1.6 million. Again, this is funding that, again, is primarily intended to respond to the COVID crisis. The eligible expenses are going to go towards staffing, equipment, and supplies, and the Public Health Department has already spent these funds, and they've used it for PPE, some surveillance lab testing, and some other preparedness and mitigation efforts. Next slide. The Police Department received approximately $600,000 from the Department of Justice, and they're going to utilize this for personal protective equipment and for some administrative and overtime hours. So all of these different pots of money really, really helped go towards the response efforts. I mean, you saw a very, very thorough presentation from Dr. Ocaranza outlining all of the different challenges and issues we're facing, not only from the health crisis that we're addressing, but also the financial challenges now that we're going to continue to experience for an extended period of time. So all of this additional funding, this $183 million, although there's limitations and restrictions on how these funds can be used, the funds are going to be very, very beneficial in helping us address this long-term recovery. So whether it's the additional testing, contact tracing, education, prevention, compliance that Chief D'Agostino talked about, all of the community programs for the recovery that we have in place that are going to be discussed here pretty thoroughly. And then on the economic development side to help our small businesses get back up and running. So all of these different pots of money are critical in getting us back to where we need to be to continue to build and recover from what we're facing. Next slide. We've also received some miscellaneous grants as well. So a couple $100,000 total for National Endowment of the Humanities. Again, these are for our museum departments. $50,000 from the National Endowment of the Arts, and then $1,200 from the Texas Commission on Arts. Next slide. One of the things we talked about in the last update was the use of FEMA funding. So in the CARES Act, there's $45 billion total allocated. One of the things that is typically required when you're using FEMA funds is that there's a 25% city match. So we've currently spent about $3.6 million, and those costs continue to increase as we're charging more and more to the coronavirus response. But as of last week, we have spent about $3.6 million total. We haven't submitted a response yet to FEMA because of that city match. So if we're looking at close to $4 million, 25% of that, we're looking at $1 million that we would need to eat essentially in those additional costs. And so what we had done is we had built in all of these costs into the Coronavirus Relief Fund response, that $119 million. But we did, it hasn't been official yet, but we did receive word early last week that the White House is potentially going to ease that 25% match. Although we have not seen that guidance come out in publication yet, we continue to monitor for that release of that. If that's the case, then we'd be able to charge that to FEMA, that $3.6 million to FEMA, and then that would free up some of the funds within the Coronavirus Relief Fund, that $119 million. Next slide. Again, we spent a lot of time at the last meeting talking about the $119 million, the requirements, the restrictions that we have on the use of these funds, that the recommendations are really centered around the long-term response and recovery, so increasing testing, the contact tracing efforts, the education, prevention, and the compliance efforts, and then the community and economic development response and recovery efforts. Next slide. So this was the breakout, just over $84 million for the public health and safety response, $16.4 million for the community response, and then $18.4 million for the economic response. And just to point out again, that $16.4 million for the community response does not include the additional $5.7 that I just referenced from the housing and urban development funding we received. So when you take those two combined, that's over $21 million total for the community response and recovery programs. Next slide. So there was a little bit of discussion yesterday about the HEROES Act. These are just some of the very, very high level points from that legislation that was passed in the House on May the 15th. One of the important items in there is the $375 billion for local governments, which really help offset the revenue impacts that we're facing. Also included in there $75 billion for testing and contact tracing. Again, additional funding, which would really help towards the response of this health crisis. There's really not been any formal dialogue yet at the Senate level. We expect now that the holiday just passed, the discussions will start to heat up. We'll see what continues to come about from this. We'll continue to monitor as we have with all of the other federal funding that's available to us and that we've taken advantage of, not only at the federal level, but the state level as well. Next slide. And so with that, I want to turn it over to Nicole Farini, who's going to talk about the community vulnerabilities and the human services.
Thank you so much, Robert. Good morning, Mayor and Council. I think we're speeding through the slides. If we can go back, please, to the first one. Even further back, just one more, please. Thank you. So I have been charged as the Chief Resilience Officer to participate in the cross-functional team and oversee the community vulnerabilities and human services activities that are going on in light of COVID-19. I want to be very clear about what that means and what the things our part of the team are working on. We are focused on supporting the most vulnerable El Pasoans as we navigate through the impacts of the COVID-19 crisis. I want to be clear, and I think Dr. Carranza touched on this as well as City Manager when he did the overview, is that a lot of the challenges that we're seeing, the deep challenges that we're trying to address, are not necessarily challenges that were created by the COVID-19 virus or the crisis. Rather, the COVID-19 crisis has exacerbated those deep challenges that already existed within our community. And that's especially true when we talk about community vulnerability and human services. The challenges that our team is focused primarily on addressing are things like housing affordability, which you all have heard me speak to many times in council chambers, utility cost burden, access to food and food security, and individual financial stability of El Pasoans. This is about the ability of El Pasoans and El Paso families to continue to enjoy a quality of life afforded to them by a level of financial stability and an access to the basic needs that we all enjoy. We're charged with equitably deploying relief programs and support to ensure that we have an inclusive and resilient recovery. It's important that we know that all of the investments that we are making today, while we are responding to the crisis, we are also looking towards the future and making sure that our community ultimately comes out of this crisis stronger and more prepared than ever before. Next slide, please. We've already started to do quite a bit. This work began immediately upon the sort of activation of our emergency response and the start of this crisis, dating back all the way to March, looking at, first off, how do we shelter the most vulnerable in our community? You all will remember, and I've spoken to it several times already, the investment we made in an alternate emergency shelter for our community's homeless. This is something that we did very quickly, in short order, and in some cases more quickly than even some other communities. We've invested a lot of time and funds into this. This is made possible, and I'm going to speak a little more to what it's doing. It's been made possible by the partnership across a lot of community stakeholders, but as well the strength of the collaboration within this organization and the partnerships that we've established. And I'm going to recognize those folks in just a moment. But it's important to note that we have, in large part, contained the spread of the virus amongst the homeless population. Since I last spoke with you all, there have been a few positive cases within the homeless community. But again, compared to other cities, which we've heard that on a number of occasions, we are really doing well to protect this vulnerable population. We immediately activated emergency funding related to food security. We've all been witness to the length of the lines at the food bank and the miraculous work that Susan Goodell and her team at El Pasoans Fighting Hunger have been doing since day one. And the way that the community has come out in support of them. We did that immediately. You did that immediately as a body. We deployed that emergency funding in the amount of $100,000 for the food bank to support their needs. And I'll speak to the additional needs as we go forward in this presentation. We then took a moment and a deep breath, and we knew that as we always do in this organization, we proceed based on data. We proceed pragmatically. We analyze the best move forward. We look at best practice, and we make sure that we have an understanding of why we are investing and what we are investing in and how that's going to have a long-term impact in our community. So we deployed a comprehensive needs assessment, which I spoke to last time, and I'll speak to a little bit later in my presentation as to what the output of that was. But it was very important, and I have to emphasize that while speed and agility was very important in getting the support out, which we did in the first two items that I mentioned, it was also important that we be diligent and we do our due diligence and we make sure that not only we are addressing our moral duty, but also our fiscal responsibility and address the needs of the community in a comprehensive way. We additionally convened a vulnerable population support task force that included stakeholders from service providers across this community, primarily serving the vulnerable population. And we provided access to PPE for those social service providers. And when I say we provided access, I mean we, in the context of this entire organization and this team. We convened the task force. We created a streamlined communication process for service providers to request that PPE, and we then forwarded that through to the EOC logistics team, whom very diligently provided that for those folks. But it was important that we streamline that process so that we make sure that the folks that needed it got it. And that was a very successful effort, and it continues to be. In addition, we began immediately communicating with our loan program borrowers. There's an item on the agenda following this presentation where I'll discuss that in more depth in terms of what we'd like to do going forward to provide that relief. But when I speak to that, I'm speaking to individual El Pasoans that participate in programs like the First Time Homebuyer Program. And so really working with our client list, because we do view them as clients, and working with them to make sure that we were providing that relief right away. In addition to that, we activated our network of volunteers and our neighborhood associations, and I'm going to speak to that in more depth in a moment, but we created a network where El Pasoans are helping El Pasoans. That's what we do best. That's what our community is known for. I've said many times as I've spoken in our community, at the state level and nationally, that El Paso's greatest asset has always been and always will be her people and the family that we've established in this community. And so the El Pasoans Helping El Pasoans program was something that was sorely needed, not only for the mental health of our community, but for the well-being of the most vulnerable. We convened community partnerships, like I mentioned. We activated the social service providers that we work with regularly via the federal entitlement. We have those networks in place. We were well positioned to be able to catalyze and coalesce those groups to have the greatest impact in our community as quickly as possible. But we also reached out to our philanthropic partners. Our two community foundations here in El Paso have been stellar, absolutely stellar in terms of really getting in front of the need and supporting both service providers and the community. Next slide, please. There we go. Thank you. So as I mentioned, we stood up an alternate emergency shelter in the immediate aftermath of the crisis in order to protect our homeless population and relieve the pressure on our local emergency shelters. What was happening is that while those shelters were not necessarily at full capacity under normal conditions, they were at a capacity that did not allow them to adhere to the CDC guidelines for social distancing. And we knew we needed to get in front of that right away, as I already mentioned. We also knew that we could provide a single point of entry for the homeless in our community and make sure that there was an opportunity for us to be able to provide screening for the homeless as they enter this facility. What we have done is we have deployed that process. You come in through the Delta site, temperature is taken, symptoms are assessed. If someone is symptomatic, they are immediately isolated there at the facility. It was one of the reasons why we selected this site, because we had smaller rooms that we could utilize to provide that temporary isolation and keep these symptomatic individuals away from the broader homeless population. We immediately coordinate and contact the EOC, and we get those folks transported and tested. They are isolated within a hotel environment until we can confirm whether they are positive or not. If they are positive, they stay in that hotel environment, isolated and quarantined. If they are not, they are returned to this facility. We are also now moving on coordinating transportation for homeless to and from the Delta site and to and from testing and quarantine facilities. This is something that we have worked with a network of partners, but it has been spearheaded by Endeavors, whom you all received a presentation from yesterday. Justin Roddy gave the presentation about what Endeavors is doing for our veterans. But Endeavors has really been a key partner in being able to provide the services and hold up this facility. They are doing that in partnership with the operator of one of our largest emergency shelters, whom you all are also familiar with, the Opportunity Center for the Homeless. This partnership has been an absolute godsend for this community, and it has allowed us to protect this most vulnerable of populations. I will also take a moment to thank one of our private sector partners, Cisco Systems. Ms. Barbara Walker has from day one been a fantastic partner in donating the technology that we needed to provide a digital interface to allow for coordinated entry, which is in essence how we process and do intake for homeless individuals, and make sure that as they're processed into the Welcome Center, that we are also able to move them upward and onward, either to another shelter facility that is more appropriate for them, for instance, in the case of families, but also potentially connecting them with permanent housing if that's possible. And I'm going to speak a little bit more to that later in terms of the kinds of programs we hope to be funding in order to keep this effort going forward. But I would be remiss also if I didn't harken back to the partnership with the Parks and Recreation Department. I know that Interim Director Ben Fife spoke briefly to it yesterday, but Ben and his team have been remarkable in terms of really working with us to set this shelter up in short order. I want to take a special moment to recognize Joe Rodriguez and Hawk Scott. These two gentlemen in the Parks Department are superstars. These are rock stars within our organization, and they deserve the recognition because without them, this could not have been possible. And so I feel it's just so important to take a moment and recognize those individuals that might not otherwise have the opportunity to speak to this body and recognize them. We have committed just over or just about $1.3 million to date in support of the shelter, and I will get into detail about what that's going to later. That's coming out of the Emergency Solutions Grant. Next slide, please. I mentioned already El Pasoans caring for El Pasoans. Immediately when this crisis began, we activated our senior corps staff, our city staff who coordinate senior volunteers across the city. They do this on a regular basis. I've reported to you all on several occasions. We oversee 700 to 800 senior volunteers at any given time. The staff came together and recreated a program that we used to do all the time called Calling All Seniors. It was where kind of a senior to senior phone tree network where we just did wellness checks on our vulnerable seniors in our community. Our staff jumped right in front of this and reactivated that program. To date, we have made over 1,100 calls to seniors in our community, checking on them, making sure that they're doing okay, assessing if they need anything. If they are needing resources or referrals, we're able to do that, refer them to the food bank, refer them to the Catholic Diocese, refer them to testing if that is what they are in need of. But at the end of the day, it's not just access to resources, it's about calling our neighbors, calling seniors, and just talking to them, making a birthday call, making sure that as they are isolated during this very difficult time, that they don't feel isolated and that they know that they are not alone. Our staff has done a tremendous job activating that. I also need to take a moment to recognize our neighborhood coalition. The neighborhood associations have always been an extraordinary component of our community. And they have always done amazing activities, but during this time they have really stepped up. And I want to take a moment to especially recognize Fabiola Campos Lopez. She is the president of the Neighborhood Coalition, and many of you know her. Fabi, you are a superstar. She has really taken the time to make sure that the coalition and the associations are still meeting regularly. They are doing Google Hangouts and Zoom calls. They are staying connected. Again, the isolation, I think we all take for granted what kind of an impact that can have on the mental health of our community. And so by our neighbors, checking on neighbors, we are really getting in front of that and reminding folks that we are a family. But we are also making sure that people have access to the information, the local directives, the social distancing, the news about how we are moving towards a reopening. It's just so important that folks get that information from a reliable source, and our neighborhood coalition has been fabulous for that. Over 90 neighbor to neighbor checks have been conducted so far. So thank you to that team for doing such an amazing job. I will close this slide by just saying that we are working now both with our Human Resources Department and Workforce Solutions Borderplex. We're looking at how we may have an opportunity to expand this program if we're able to either bring on staff that they have that they can pay for. We're working with them. That program is not set in stone yet. We're still working the details of that. But if there's an opportunity to expand welfare checks and expand our capacity to do this, we are going to do that, and we'll be bringing that back to council as we have more details. Next slide, please. Digital access has been a primary challenge, I think, amongst our most vulnerable community. Not everyone enjoys the access to the internet and this connectivity that we're sharing now as easily as we do. And so we have really been working and trying to communicate with our IT department to see not only what facilities exist and what opportunities exist to provide that access in our community, but also how can we look towards potentially expanding that as a result of COVID, because we know that that digital connection and that access is more important than ever. I know that Araceli is on the line. If there's any questions at the end of all of this presentation, I think she and I can kind of tag team and answer those. But to date, you know, there's expanded access to 26 city facilities. They are sharing information about where location and coverage exists on epstrong.com. So again, we're trying to communicate that. We're also leveraging the networks I previously mentioned with our neighbors and our seniors to make sure that those folks understand how they can get access, working with our educational partners, and just trying to keep everyone connected. The MiFi program, the program where you can check out mobile internet is something that was a great success, has been a great success. And as I go through the presentation, I'm going to share with you some plans that we have that we think we can support expansion of that program as a result of this crisis. And so we're very, very excited to work with IT. They've also been a tremendous partner in this. You know, the community development team identified the need, and we have some of the funding, but we're at a loss when it comes to how to deploy this program. And so being able to lean on such a tremendous bank of subject matter experts in our IT department has been really valuable, and I think it's going to help our community. Next slide, please. So the council has been very clear about how important stakeholder outreach is during this time, how important it is for us to coordinate with our stakeholder partners, with the community. And frankly, we could not agree with you more. We could not have our arms around how to best deploy the stimulus funding that we're getting, the support and relief funding that we're getting, if we did not lean on these stakeholder partners. And so we spent a lot of time doing that, and I want to walk you through how we've done that and where we are and where we intend on going. We have, in the last 2 weeks alone, so this does not even include what we've been doing since March, but in the last 2 weeks alone, since we've last seen you all, we have had 109 stakeholder touch points. We conducted just over 40 calls with stakeholder partners in 3 days. That was a matter of our team really getting in front of it and working overtime and getting in touch with folks. And I want to also be clear that when we have those calls and we have those stakeholder touch points, this is not about a simple check the box kind of survey and saying, okay, you're validating what we thought we already knew. No, this is a conversation that's based on the community needs assessment that we did when we first started. So phase one of our outreach was the needs assessment. As we start to prioritize the funding and we have these conversations with the over 50 agency partners that we've engaged with, we are really pushing and pulling and really having an intense dialogue about how can we prioritize the funding that we have to address the needs in the community, knowing how wildly mismatched those two things are. And I cannot emphasize that enough. There will never be enough money to do what we know we need to do but we are doing our absolute best in partnership with our entire community to make sure that we prioritize and address the needs of those most vulnerable first. So moving into phase 3, which is the policy framework and sort of feasibility feedback. So it's like, okay, we know where we want to put the dollars, we understand what the needs are, but how do we build a policy framework that makes it feasible to deploy these dollars in a way that is quick, accessible to the general public, making sure that this is not a difficult process for them and that it doesn't take forever. I know that in some circles there has been discussion about, why is this taking so long? I want to remind the council that typically when we're dealing with much fewer dollars and much less need, this process takes over a year to conduct. And we've done it in a matter of weeks. And so working through that policy framework has been critically important, understanding what are the capacities of our stakeholder partners to deploy the programs and the funding that we are recommending to you. We have received over 300 data points that have informed all of that work. And I shared that with you all previously, and I'll show it on a subsequent slide and walk you through it a little once again to remind you. But to date, we have committed just over $1.7 million, $1.8 million. Primarily, that has gone into what you saw with the food bank, as well as with the alternate emergency shelter. As we deploy these funds and we move forward, our stakeholder outreach is not done. It's so important that as we deploy these funds and these programs, that we understand the results and the measures, the performance measures in terms of how successful these programs are going to be. Are they moving the needle where we want them to? Are they having the impact in the community where we need to have the impact and how that impact needs to occur? If it's not, we need to know that, right? We need to be able to course correct as wave 2. Nobody knows what wave 2 is going to look like. We know that there's additional funding potentially coming down from the federal government. There may be other grant sources that we can use to continue this work. But if we're not measuring how successful the initial deployment of the funds is, we will have no idea how to course correct. And that's just really, really important as we move forward. Next slide, please. So this is a slide that you all have seen before. It's been altered a little bit. What you're seeing on the right is the analysis of the need that we initially conducted. The 300 plus data points that I mentioned is what is informing the emphasis here. And so what you're seeing in red, the sort of red blocks that are under meeting basic needs and supporting livelihood and employment, that is where we heard not only the most comments regarding these categories, that they are the most important, it is the most urgent need, but also that there are fewer resources currently deployed to these categories. And so that creates a formula for urgency that says we need to prioritize the basic needs of El Pasoans, which means shelter, food, warmth, and water. And we also need to support livelihood and employment. We need to help El Pasoans get back on their feet. And that means getting back to business and getting back to work. And so a lot of emphasis is placed in those areas. I do want to say, though, that as we move forward with the feedback, we started to receive more and more comments in the green here that you see in this sort of teal color about how extensive the outreach we are doing is and how effective and thankful the stakeholders have been that we are committed to not just reaching out to them, but hearing them and listening to them and having their voices reflected in the recommendations that we make to this body. And that's why you see this teal green as an area of strength in terms of empowering a broad range of stakeholders, promoting effective leadership and management. The city and our entire organization has really taken a leadership role in this community. And that doesn't mean dictating to others. It means collaborating with others and making sure that we're having an impact where we need to. And so in terms of the dollars and what all of that feedback means, in the housing and basic needs category that we've mentioned as primary, we've allocated just over $19 million in the categories of rental assistance, utility assistance, mortgage assistance, homeless assistance, rapid rehousing, addressing and preventing domestic violence and abuse, addressing food security and making sure folks have access to food, as well as prioritizing a community assistance fund that can and will address the gaps that households are facing in terms of the basic needs that they need to provide for their families. In livelihood and employment, which is the second category I mentioned, we are prioritizing that with just over $1.6 million. That includes credit counseling and bankability. You all will recall at the last council meeting, we discussed alongside economic development the need for folks in our community, both individuals and small businesses, to be able to have access to credit counseling and increase their capacity and ability to pursue the funding sources that are available to them and stay stable after the crisis. And God willing, come out stronger than they went into that crisis. We are including childcare. We know how important it is that folks have access to childcare. I think Dr. Sylvia Acosta spoke at the last meeting very eloquently in terms of the importance of childcare and the role of women during this crisis. And so we have prioritized that as part of our funding. I mentioned already expansion of digital access, particularly for vulnerable populations, as well as support for independent contractors. Independent contractors are those hairstylists, nail techs, landscapers, construction workers, painters, folks like that fall between the cracks of some of the small business assistance that is out there. I do want to take a moment now to credit our economic development team because they have been amazing. We have really spent a lot of time merging the discussion in terms of community and economic response and recovery. And I know you're seeing it as two presentations today, but I want you all to know that our teams have been tied at the hip, and we understand that community recovery is inextricably tied to economic recovery and vice versa. And so we've been partnering with economic development to help them as well as they can help us understand what the needs of businesses are, and we can understand what the linkage between those two categories can be so that we can, in fact, come out stronger. The total investment, including relief funds and entitlement out of the CARES Act, is just over $20 million. Next slide, please. So I want to walk you through here the different categories in a little bit more detail. What we have understood in terms of rental assistance as the primary need, keeping El Pasoans sheltered, making sure that folks can stay in their homes, moving into mortgage assistance, making sure that those homes have warmth and water, as I mentioned, shelter, food, warmth, and water. These are the basic needs. Warmth and water, that's utilities. That's making sure that your gas stays on. That's making sure that your electricity is functioning. That makes sure that your water is still running. You have running water in your home. These things that some of us take for granted, folks need assistance with. We know that residents of El Paso are just struggling to make ends meet, and they are making choices that no one should have to make. And so we have prioritized a tremendous amount of our funding to go towards this category, rental, mortgage, and utility assistance. We know that the assistance will help both tenants and landlords, because landlords, you heard from the Apartment Association, I think at the last meeting, where as tenants don't pay rent, obviously landlords are hurting as well. They have payments and commitments as well. And so there is an inextricable relationship between the tenant and the landlord. And so rental assistance helps on both of those fronts. Mortgage assistance is intended to help our homeowners because we can't leave them out. Folks that are struggling to make their mortgage payments, we want to make sure that the El Pasoans don't get behind, that El Pasoans don't come out of the crisis weakened, rather we come out stronger. The second category is homeless assistance and rapid rehousing. These are tied together. When we talk about rental assistance under normal conditions, we typically categorize that as homeless prevention because that's exactly what it is. Keeping El Pasoans in their home is keeping them from being homeless. And so as we move to another category of support, those folks that we were not able to keep sheltered, those folks that have been displaced, still require assistance. And so obviously we've invested in emergency shelter for both adults and youth. We've worked extensively with the El Paso Center for Children And we continue to work with them to provide solutions for our community's homeless youth. And they do a tremendous job on a daily basis. So they've been a pleasure to work with. We're working on the transportation that I already mentioned, making sure that those homeless in our community have access to the Delta site, which is the welcome center, the door, if you will, to all of the services that we know that they need. But rapid rehousing is the key to homeless assistance. I want to be very clear. What is rapid rehousing? Rapid rehousing means someone has been displaced. They are currently experiencing homelessness, and we want to place them in an environment that is a permanent home for them. The rapid rehousing funding provides rental assistance as well as case management for those individuals, making sure that we're not just putting them in a home and putting a roof over their head and saying we're going to pay the rent for a couple of months. No, this is about making sure that those folks have access to the other services that they need, the other support, the wraparound services that they need in order to stay housed. Rapid rehousing is not temporary shelter. It is permanent housing. Go ahead. Next slide, please. Thank you. Food security is something I've mentioned on a number of occasions, and I know that some of you all have had the opportunity to visit the food bank, and you have seen, or maybe you've seen the images online of the cars, 3 lines of cars 3 miles long. There is a tremendous need in the food security area in our community, but there's a couple of things that we can do. Obviously, we stepped up right off the bat and offered that assistance to the food bank. I have been in constant contact with the food bank, trying to understand what their daily needs are. And as a result of those conversations, we know that we want to allocate funding to the provision of food to El Paso families. That is funding that can go directly to the purchase of food, the provision of food to those families, bringing on folks at the food bank or other pantries, making sure that the food is getting where it needs to go. But we also understand that there's other equipment and infrastructure needs that can help stabilize the food bank and other pantries for the long haul. And that is extremely important to understand as we have so much uncertainty about how long this is going to go, as well as what wave 2 or 3 might look like. Finally, number 4, the Community Assistance Fund. This is something that I believe several folks spoke to at the last council meeting. We have spent countless hours in conference and consultation with our community stakeholders, trying to understand how once we address rental assistance, how once we address shelter and food and utilities, there are still so many needs out there. So the Community Assistance Fund is really about providing gap assistance for those household needs that are not otherwise covered. These are sometimes referred to as wraparound, but I want to be very, very clear. We're talking about being able to partner with local philanthropy, which in this case will be the El Paso Community Foundation, to provide funding so that El Pasoans can get the things they need, such as medicine that's not covered by rental assistance, obviously. We want to make sure that they can access the needs that they have if their water heater breaks, or if, for instance, they need to get to their job because they are still employed, but their car breaks down. These are household needs that a lot of us take for granted that prevent other folks from getting back into the workforce and not necessarily having to depend so heavily on these other programs. So the gap assistance could not be more important. And we're working very closely with our partners to make sure that we're able to provide that. Next slide, please. Childcare and respite care, I already mentioned briefly, but I want to mention the difference. Respite care is intended to provide relief for parents and reduce the potential for child abuse during the shelter-in-place order. So you've got a lot of families who are experiencing a tremendous amount of financial pressure, the mental health pressure of being in isolation. And so the ability to offer respite care for those parents and for those kids is something that I think the YWCA has already started doing. And we know that there's an extended need for that. And so we've included respite care as part of our funding recommendations, but that's different from regular child care services that help support essential workers. And again, I think that Dr. Acosta did a great job at the last meeting explaining that. Credit counseling and bankability. Again, I'm not going to reiterate too much here, but we know that we have a need to strengthen financial stability for El Paso businesses and families. This is something that was a tremendous issue prior to COVID, and it is being exponentially exacerbated by the COVID crisis with folks that have lost their livelihood. And then the expanded digital access supports not only homeschooling and folks that are sheltering in place and helps mitigate that isolation, but in addition, it also supports El Pasoans who may not currently have the ability to telework. If we can expand that access, we may be able to provide telework opportunities for folks that may not have already had it. Next slide, please. So all of that being said, these are the categories that I've just gone through in detail, and these are the dollars that we are proposing to allocate to those categories. They are separated on this slide based on the funding source from which they're coming. So for CDBG, the Phase 1 CARES Act allocation, we're proposing $1.5 million for rental assistance. $250,000 for credit counseling and bankability, $250,000 towards childcare, $700,000 towards food security, and $205,000 and change for prevention of domestic violence and abuse. The respite care component that I mentioned would fall into that category for a total of $2.9 million. The Emergency Solutions Grant Phase 1 CARES dollars have been allocated to address the needs of the homeless during this time. Those funding categories are italicized, and you'll see there in the note that items listed in italics are pre-committed. These are funds that we have already committed and will not be going out through a notice of funding availability. But as I mentioned earlier, it supports the emergency shelter for adults as well as youth, the transportation component, and it also pays for the quarantine in the hotel motel environment for COVID positive homeless. In terms of the $119 million, the relief funds of the 16.3 million that go to community programs, you can see $10 million has been allocated to rental assistance. And so across the board between these funding sources, we're allocating $11.5 million towards rental assistance. And that is a reflection of the need and the community input that we have received in terms of how important that is. I do want to note, just as an example, the city of Houston deployed $15 million in rental assistance a week or so ago. It was oversubscribed in 90 minutes. We anticipate that rental assistance will be fully subscribed in very, very short order. We are also proposing $1 million in utility assistance. This may seem like it is a much smaller amount, but one of the things that we have also done is we've done an assessment of what other funding sources and support is available in this community. And we've been working with entities like Project Bravo, who also or typically provide utility assistance, and they have some significant funding coming in from the CARES Act to provide utility assistance for both electric and gas. It does not include water, and so water is one of the categories that we are looking at in terms of utility assistance. I do also just want to mention that we've had a tremendous partnership with Texas Gas. They have really assisted us in understanding what the need is, and we continue to work with them to see how we can assist their customers as much as is possible. Mortgage assistance, $1 million. Rapid rehousing, as I mentioned, as a primary tool to address homelessness in our community, just over $1 million, $1.1 million. This is probably more than double what we would typically allocate to rapid rehousing in under normal conditions. Independent contractors, as I mentioned, we're working with economic development, and we've allocated the $1 million to support independent contractors who fell out of other assistance programs. I will say, though, here that we're working very closely with economic development, as it's likely they will be deploying the independent contractor portion. It makes sense as their stakeholder partners are deeply embedded in the business community, and they're going to assist in getting those dollars out. Digital access expansion, as I mentioned before, we've allocated $150,000. That number actually comes from a lot of conversations with IT. We think that we can double the capacity of the MiFi program with that $150,000. And in working with service providers, we've been able to identify an opportunity to expand the MiFi to unlimited data, which any of you all that use a digital device understand the importance of unlimited data and not having to stick to a certain limit. And so we're continuing to work with IT to make sure that those dollars can get deployed to expand that access. And then finally, an additional $500,000 towards food security. Total, we are proposing $1.2 million be allocated to food security. And next slide, please. So in terms of the funding timeline, we've gotten a lot of questions about how fast can we get this money out and how can we get this on the ground? People need it right now. This is the timeline that we anticipate for deploying this. Based on comments we received from council today and any final comments from our stakeholders, we plan to release the notice of funding availability, which will include all the categories and the dollar amounts I just mentioned, by this Friday, May 29th. We ask that providers submit their applications for that funding in those categories by Friday, June 5th. We recognize that this is a very quick turnaround, but we have talked with our stakeholders. And in order to get these dollars on the ground as quickly as possible, we have to press for a quick turnaround. We will also be reviewing those applications in very, very short order. We're pulling together an internal community development cross-functional team to be able to review the volume of applications that we anticipate in short order so that we can then bring back a recommendation to council and request authorization to enter into those agreements no later than June 23rd. And with that, I'll close my portion of the presentation. Thank you all for indulging me and letting me talk so long.
Good morning, it's Dion Mack. I'll be covering logistics and education. For this section, I will be joined by Ms. Emma Swart, the president of the MCA Foundation, as well as Dr. Nicole Brennan from the Battelle Memorial Institute. I want to begin with just a brief overview of our logistics section and the work that they have been doing in terms of ensuring that we have proper supplies within our community. Next slide, please. No, thank you. So as you heard Chief Daniel speak about earlier in the presentation, one of the things that we have been focusing on is ensuring that we have appropriate PPE, other resources and supplies to ensure that we can continue to address the needs of all of our stakeholders throughout the city. Next slide, please. So for the EOC, one of the things that they've been focusing on in partnership with Border Rack is ensuring that we have PPE supplies throughout our community. You heard Nicole Farini talk about social service agencies. You may recall back in March, there was a severe disruption of our PPE supply chain. There was rising demand. We saw panic buying. We saw hoarding happening. And so it was really important for us to make sure that we were keeping track of what we had available within our community, not only for our essential workers, but also looking at how we were shifting our need for these amenities for our essential services throughout. Some of the requests that come in are not only from social services agencies, but from dentist offices, small providers. They can utilize these resources to make sure they can continue to operate and do so safely. Next slide, please. So you heard the chief talk about Border Rack and what a wonderful partner they have been and along with us. He mentioned that they were one of the key partners in helping us to stand up our federal testing line. If you're not familiar with Border Rack, they're a healthcare coalition. It was set up back in the 90s by the Texas Board of Health and actually serves over 40,000 square miles, 2 million people. They are housed at the EOC, and they are primarily focused on trauma and emergency healthcare systems and have a variety of partners that they work with to ensure that we can continue to have the type of responsiveness we need in the area of healthcare provisions. They have over 1 million N95 masks. And one of the things I'll talk about a little bit later in the presentation is the importance of education and the distribution of these working hand in hand. One of the things that the education unit did along with Border Rack is ensure that people knew the types of supplies they should be using to help us to be able to extend our supplies on hand. Another thing that was important was for people to understand their burn rate for these supplies so we wouldn't be in a situation where we're running out of the supplies. Next slide, please. So this is a combination of EOC and Border Rack's distribution. As you can see, there's quite a few items that have been distributed. Later in the presentation, Sam Rodriguez will be telling you a little bit about the need for storage. As you can see, we will be dealing with this pandemic for quite some time. Our PPE are no longer just focused on healthcare providers. And so making sure as we're beginning to reactivate our city and our city facilities, as Colonel Weston will talk about, we want to ensure that we have the supplies that are needed to be able to continue and to keep each other safe. Next slide, please. I'm going to hand it over to Ms. Emma Swartz, who will tell you a bit about our logistics and education partnership.
Good morning. Can you hear me?
Yes, ma'am.
Great. Thank you. Good morning, Mr. Mayor, City Council, and City staff. My name is Emma Schwartz. I'm president of the MCA Foundation, and our mission at the MCA is to enhance our region's life sciences ecosystem to become globally competitive. I want to begin my statement this morning by sharing an excerpt from a keynote speech that I gave at the UT Houston School of Public Health hooding ceremony in 2018, which embodies what the COVID-19 Enhanced Regional Public Health Partnership is all about. The concepts of convergence, innovation, and implementation are not easy to achieve, but when used collectively, they can transform our world to help solve some of the greatest public health challenges and paradoxes of our time. Today, this challenge is COVID-19. As public health professionals, we have a better chance to achieve our goals by focusing on the convergence of multiple priorities, from what we traditionally think of as public health, to the environment, to public infrastructure, to preventative care, to food security, to mental health, to homelessness, to affordable health care, and to biomedical innovation. Our world has gotten so complex due to technology and globalization that working in our silos is no longer an option. Convening multidisciplinary teams is necessary to develop the innovative solutions that are required for advancement and impact in public health. Although the issues facing public health have not changed substantially over time, pollution continues to rise, people are still hungry, and disease outbreaks continue to have decimating rolls around the globe. But we find ourselves in the midst of an intense social and public health transformation, and that is why innovation is in public health matters. And innovation happens most when we step outside of our comfort zones by opening our minds to discovery, by convening people and ideas. So how do we capture the value made possible from convening, which leads to innovation? Through implementation, through taking action and doing. But believe it or not, implementation is difficult, and this is why our global public health perplexities persist. Research practice gaps often exist. Funding and talent may not be readily available to start something new. Change management is incredibly difficult, all presenting implementation challenges. Yet implementation is a choice that we must all make. So that is what the COVID-19 Enhanced Regional Public Health Partnership is all about. It's about making a choice to converge, innovate, and implement. The MCA Foundation worked with the City of El Paso, the Paso del Norte Health Foundation, UT Houston School of Public Health, and a coalition comprised of over 36 businesses and private funders to create this public-private partnership to help our community respond to the pandemic through convergence. This public-private partnership is guided by the expertise of the Battelle Memorial Institute, one of the most innovative research and science organizations in the world. And we have worked tirelessly since March to implement a series of actions that would improve our community's response to the pandemic. As you heard many times earlier today, we have a highly vulnerable population in El Paso and Juarez, and our enhanced response must convene the right people to take innovative actions to best serve our community. The partnership has the following goals: to provide critical resources to protect the public and our essential workers on the front lines, work with the city and regional officials to coordinate care and enhance communication, tackle this pandemic as a region, creating a coordinated and seamless response between El Paso, Ciudad Juarez, and Las Cruces. To implement these goals, we have focused on the following. To begin with, we have a PPE committee that we organize weekly over Zoom with over 60 people invited and regularly over 30 to 40 people attending. We discuss the EOC, border rack, and PPE supply and demand, non-medical community PPE needs, PPE training, and communication with employers on reopening needs. An MCA board director, Holly Trubovich, has voluntarily led a needs assessment and purchasing effort to supplement the work of border rack, requiring over 30 hours of her work each week. She has obtained email data from over 80 different industries, including home health, retail, construction, etc., and sent out over 1,600 emails with a link to the PPE order form that she created. And she's coordinating these efforts with the border rack. Secondly, she found and validated vendors with an emphasis on local vendors and determined a group purchasing strategy and obtained quotes, including item price, packaging, minimum order quantity, availability, etc. She assembled a PPE source list that is frequently updated and available on the Paso del Norte Health Foundation's website, the COVID-19 Hub. She is working on still obtaining all the N95 masks needed, but she has procured over 6,000 of those to date. Similar to the PPE committee, we launched a private sector testing committee, which again is a weekly meeting organized with over 70 people invited and over 40 people attending to develop a collaborative plan with the city and county for reopening safely. This plan must include, among other things, COVID-19 testing. The MCA and UT Houston School of Public Health have conducted a focus group of employers in El Paso to determine their strategies for COVID-19 testing upon reopening and thereafter. The MCA conducted market research on regional testing capacity relative to the regional demand for testing required for return to work following COVID-19. The MCA requested information from various different laboratories and interviewed several of them, and is in the process of developing a white paper for private sector testing. Another initiative is through Bio El Paso Juarez, our binational medical device cluster group supporting the PPE efforts. It quickly developed and disseminated a survey to assess the impact of COVID-19 on the medical device manufacturers in the region and created a report summarizing these results that was distributed to the community and elected officials. They created an online hub for manufacturing community to share resources and developed a COVID-19 response task force that has met twice weekly since April 3rd. They've developed and disseminated a follow-up survey to determine the types and levels of production of PPE in this region and available for local use. They've created multiple resources for medical device manufacturers in Juarez to anticipate and respond to Mexico and state federal audits and inspections in order to continue operations and productions. We've coordinated a coalition with our coalition webinars on our PPE work and soon on supply chain and sourcing. We're also leading efforts to provide and help Ciudad Juarez medical providers access essential PPE that they need. In addition, we are working with the Tech Labs and El Paso County Medical Society to 3D print over 250 face shields for distribution to El Paso physicians and community-based clinics. We expanded access to the Mayo Clinic COVID-19 convalescent protocol opportunities by informing our regional healthcare institutions about this opportunity and how to become a registered site. We introduced local virtual care providers, including electronic caregiver and VemiDoc, to our region's healthcare systems and outpatient clinics that will enhance patient safety by providing medical care virtually, remotely, and in the patient's home. We convened a COVID-19 clinical trials task force to drive innovative COVID-19 vaccine device and diagnostic trials here in our region. And lastly, but not least, certainly, we are leading several efforts to assist Ciudad Juarez's response to COVID-19. MCA expanded its contract with Battelle to include Juarez, and Battelle is doing data modeling for Juarez. It is getting the permissions needed to import contaminated N95 masks from Juarez into El Paso for decontamination. They are working on COVID-19 testing research, sourcing, and practices, including contact tracing best practices. We are sharing best practices for employers and industries for workplace modification for the manufacturing industry in Juarez in partnership with the U.S. Consulate. And we are working on medical practice sharing through the COVID-19 El Paso Juarez Medical Community Exchange. This is a webinar series that we launched to discuss predetermined topics with robust Q&A opportunities. The speakers and participants are Spanish-speaking El Paso and Juarez medical professionals who want to share ideas about how to combat this virus. We are also creating a web-based Spanish language forum to ask questions and get feedback between El Paso and Juarez medical peers. As you can see, our public-private partnership is working hard to convene the great talent of our region under a common work plan to develop innovative solutions to this complex pandemic that are making an important difference to both the El Paso and Juarez community. In closing, I want to thank our partners and coalition members for their work and support, and I must acknowledge our generous and thoughtful donors without whom this partnership would not be possible, including the Paso del Norte Health Foundation, the Hunt Family Foundation, the Foster Family Foundation, El Paso Electric, the Public Service Board, One Gas Foundation, West Star, Trans Telco, and Larry Wolschlager. And finally, I want to thank the city staff from whom you have heard so much great work and effort and dedication today. It has been a great pleasure to work with them on all of this. I also want to thank the Mayor and City Council for their leadership and guidance during this difficult time. Thank you.
Okay, I want to introduce Dr. Nicole Brennan, who will take us through some of the work that Battelle has been doing with us.
Thank you, Mr. Mayor, City Council members, and Dion for your introduction. I think Dr. Ocaranza did a tremendous job earlier describing really the science behind this epidemic and this disease. And Battelle considers our role to support the dissemination of that science and the science behind public health preparedness. So the staff that are working on this project along with me have state, local, and national experience with pandemic response, including H1N1 and Ebola. And we've been working to really help connect the dots, if you will. We've worked at the state level during pandemics. We understand the trials and tribulations of what it means to really respond to a disease this complex and what it takes to really engage stakeholders while also meeting all the various needs of supplying PPE and talking with, your congressional members, as well as providing testing or later on vaccination. So we're trying to help bridge that communication between the stakeholders and the EOC as part of our EOC support. Also trying to make sure that the EOC is aware of some of the communications with the stakeholders are also trying to pass their way. As Emma mentioned, we're also supporting testing and tracing, some of that being tracing that businesses could potentially do for themselves to help let employees know if they have come in contact with another individual who tested positive for COVID. What does that mean? How can the businesses themselves be supportive of public health by doing that level of tracing and notification amongst their own employees? Testing, looking at ways to implement point of care plus the PCR testing and how and where those might be most appropriate if you have limited resources, as we've been experiencing throughout this response. For surge capacity, we have been working with the hospitals pretty closely to look at various models. As I'm sure you're all aware, there are hundreds of models out there right now related to this pandemic. And one of the challenges with those models are when you go to validate them. And the best way to validate them would be to, let's say, take New York, enter in information that you had, let's say day one, and then see if your model projected out what actually happened. Now, there just hasn't been a ton of time to actually validate a lot of these models. And so we are trying to use them as tools, not as rules, if you will, that they're just trying to guide us in our preparation and make decisions. So we have worked with the Fort Bliss staff to look at their models and compare those with the data that the hospitals have to make those decisions on, should we be spending our energy to open up a surge hospital, or should we be doing something else? Part of that might be just looking one day at your census in a hospital and saying, okay, if we opened up a surge hospital, how many people who are currently in our hospital would we be able to send there? And that would tell you really if it was going to open up beds for you. That has been one of the primary focuses for me over the past couple of weeks, and trying to help guide that understanding. And then now considering as we go into the summer, and then as Dr. Ocaranza mentioned, if there's a second wave, what does it mean if we have COVID on top of flu cases? What does that mean for the hospital capacity at that point? For PPE, we have been, as Emma mentioned, working a lot with Juarez around what kind of PPE they have, what kind they don't have, how can we assist them with identifying additional PPE, how can we assist Juarez with identifying testing options. So there are a lot of people out there who are trying to sell tests to cities and countries that have been underserved. And one of the things that my staff has been doing is really researching some of those companies, even having conversations with third-party distributors to try and assess whether or not this is a legitimate test, or if this seems like there are too many red flags to move forward. And I really think it's very apt that this is falling under the logistics and education slide deck, because that really is what we have been trying to do, is get out that education piece and provide any presentations that we can give to the general public or to the partners that help to put this into the language that they would most respond to. And for example, as part of our outreach, we've been working with the Medical Society to sort of revamp their newsletter so that it spoke more directly to the clinicians. What were they asking for? What could we provide them? And we had gotten pretty good feedback on that. Next slide. As I'm sure most of you are aware, there is a Battelle decontamination unit in El Paso. And if you can go to the next slide, that would be great. So the point of the decontamination unit has always been to fill the stopgap between a lack of PPE and trying to make sure that our health professionals were covered in their protection. And so we designed these systems a couple of years ago, actually, when the FDA was preparing for pandemic response, and worked with them to identify ways that we could clean N95s, and did a lot of research several years ago on that. And when this pandemic came back around, we engaged with the FDA to say, you know, we did this research previously, would you like us to ramp that up and to distribute out these decontamination systems? So we were contracted to deploy 60 of those, one that is in El Paso, and make sure that healthcare professionals are well aware that they are there and that they can be used in times when they have a lower supply of N95s than they might feel confident that they could meet the need of their patients. So some of you may have heard or read stories recently that question the science of the decontamination units. And what I can say is Battelle very much prides ourselves in being an independent science and research organization. We worked very hard to develop the science and submit the science behind the decontamination units. And we have the data to support them. And we would certainly never put something out in the field that we didn't feel had that level of backup, and also didn't have the reviews it needed from the FDA. So if there are any additional questions around those systems, I am more than happy to answer that. Next slide.
Okay.
Yeah.
Thank you, Nicole.
Thank you, Dion. Yep.
So, Council, we've done presentations for you before talking about the Education Task Force, but I think that you can see through the various presentations, it is very much about the entire organization and all of our community partners working together to make sure that we're doing the outreach and getting critical, reliable information out there to people in the way that they need it. Our Communications Task Force, that's led by Ms. Laura Cruz Acosta, has been doing an incredible job with social media. You've heard from our community partners in terms of the work that they're doing, from Nicole Farini in terms of their engagement with our retirees, as well as our neighborhood coalitions. We continue to have our Education Task Force for us be boots on the ground and a complementary piece to our compliance folks that you'll be hearing from a little bit later to ensure that we're getting the information out there to providers as we're changing our orders and helping them to understand what's expected, but also using the opportunity to provide education on how to best use the limited resources we have with PPEs and others, as I've discussed previously. Next slide, please. And so you've seen some of this information before, and as you can see, we're continuing to shift our focus and efforts based on what we're seeing happening within the community. You heard Chief D'Agostino talk about cluster management and the work that we're doing around nursing homes. That was phase 2 of the work that the teams focused on. We started to hear a lot from the community in terms of grocery stores and other small markets as we were starting to implement mask requirements. And so the team shifted to make sure that we were out there having those conversations with grocery stores and small supermarkets. They visited over 677 of those within a roughly 2 or 3 week period. And now they're still continuing to focus on restaurants. As the questions regarding our new orders were asked earlier on, it's going to be important for us to make sure that we're actually out there having the conversation with those who are going to be opening up so that they understand what's needed, what's required. And it is very much a partnership in terms of how we do that. You've heard Emma talk about the partnerships and the work that they've been doing around helping private entities and businesses stand back up. They've been working with the Better Business Bureau to make sure that information is available to those businesses in terms of PPE, how do they get cleaning supplies, really making sure that as much as we can do to help our community understand what the next steps are, but also to make sure that they can be safe in terms of how they execute those as we continue to see our numbers climb. Next slide, please. And just again, you've seen this information before, but just as a reminder that not only are we going out having conversations regarding, the virus and information that's going to be important, but we're also asking nursing homes and others, as we're doing this cluster management, to share with us their improvement plan. And so we have an idea of how they're planning to address this issue and making sure they have those in writing for everybody within their facilities. And they're continuing to gather those plans from our cluster group. Next slide, please. You continue to see in our EOC daily sit rep the improvements and the increases that we have to these numbers. And we will continue to shift to ensure that our resources that we have with the Education Task Force works very closely with a variety of partners to make sure that we're focusing our effort and energy where it can be best deployed throughout the city. I am so grateful to all the teams that are working on the task force. As you saw in the previous slide, we have the Department of Health, we have aquatics, we have museums, we have parks, we have libraries, our fire department have really stepped up to make sure that we have the resources to get out there every day to the community in the way that they need to have this information deployed. So I just want to thank all the team members and all of our partners that we continue to work with to ensure that we can do the best we can for our community. And with that, I'm going to hand it over to Ms. Ellen Smythe, who will talk about compliance and service delivery. Thank you.
Good afternoon, Ellen Smythe, Environmental Services. This afternoon, I'd like to cover what we've been doing with the compliance and service delivery. Next slide. So the week of March 9th is essentially when the city of El Paso began making preparations for the onset of the coronavirus. And during that time, an email was established that was named covidcompliance@elpasotexas.gov. And that email went directly into the boxes of personnel at the fire department and the health department. Once the email started rolling in after Friday the 13th, the week of March 15th, there were so many that rather than have it dump into individual mailboxes, we linked it to the epstrong.org website. And so the website was modified to be able to offer various options to intake the email into different categories. And you'll see on one of the next slides what those categories are. Over the next 6 weeks, all the emails that were received were screened and sorted into 4 areas, either for fire PD for the immediate needs and responses, the Parks Department for any park-related complaint, the Health Department for any of the restaurants, and the ESD code compliance for all of the other complaints. We received 5,682 complaints during that 6-week period, and they were all addressed appropriately. During the week of April 27th, about that time is when most of the residents had been educated, and I'd like to thank the efforts of all the task force members that were involved in the outreach and education, because without their help, I believe that the emails and the complaints would have continued to be going on an upward trend. But because the residents understood what the rulings were from both the governor and the mayor and the judge, they dropped to less than 20 per day. In order to address those few in a more expedient manner, it was decided to route them, rather than through an email system on the epstrong.org website, route them directly to the PD non-emergency phone number. So that's what we did the first week of May. Next slide. And you can see here from this slide, this is the epstrong.org picture of the web page. And so when residents logged into this site, they could go into 9 different categories and get information concerning travel, closures, hours. And you can see right there the area for the compliant complaints. Next slide. So, of course, all of the officers that were out in the field were focused on the voluntary compliance, basically education and outreach. The ability to issue citations still remain with the police and fire officers. And so the Parks Department, the Health Department, and the ESD code officers were all working on compliance efforts to adhere to the state directives. And as you there at the beginning, so that from one day to the next, it was required to have masks or not required to have masks, and whether you could be open or not open. We continue to educate all of the residents, and we were able to achieve voluntary compliance with most of the complaints that we got. Once people understood they were in violation, 95 to 96% of the people were happy to comply. We did have those house parties that were a real problem at the beginning. The parks officers continue to assist with enforcement at the parks. Next. So as of this last weekend, we have data here from the Fire Marshal and the Health Department, El Paso Police Department, 211, 311, epidemiology calls and the hotline, as well as the sheriff's calls. So you can see that all the officers have been very busy over the last 2 months responding to these phone calls and emails. Next slide. And that same information, of course, is on the email update that you receive each evening. In terms of some Metro service delivery, passengers that are displaying symptoms or who were COVID-19 positive should not ride. That placard was put in the windows of every single bus. Some Metro also contracted with Project Amistad to be able to transport COVID individuals who otherwise do not have any other means to get to a test site. Some Metro routes are still running today on the Sunday schedule, and we've had just a few complaints about the reduced routes, especially now that more businesses are starting to open. More and more people are going to be needing rides to work. Next slide. Our next area that we're going to cover is by Jessica Herrera, and she's going to cover the economic recovery.
Good afternoon, Mayor and Council. Jessica Herrera with Economic Development. If IT can go ahead and go to the next slide, please. I think you've really heard from everyone with regards to just the priority that we've placed on the health and safety and just well-being of our community and how we're coordinating. And I think, you know, talking a little bit more about what Dion mentioned with regards to the Education Task Force and with the compliance that Alan just talked about, it's really important that we add this additional approach with regards to just the economic recovery. As we start moving into phases of reopening, it's really important that we continually engage with our businesses and really provide that assistance that they need on all these fronts, whether it's with the health and safety of their employees and the public they serve, as well as the community that they're involved with and they're also very much engaged with on a day-to-day basis. As you can see from this timeline, we've been very proactive and we've worked very closely with a number of departments across the city, the county, number of our partners and service providers. We immediately deployed a $2 million small business loan and grant program that was exhausted very quickly. And that just really shows to you that there was a huge need, a very significant need from our businesses that really, I think, can outline what we're going to have to be providing in terms of assistance as we continue to move forward. Really providing the business resource guides and what we've been able to deploy. We've done it on various platforms. We've done it both online. We've done it digitally. We've really provided that information as well to a number of our partners and service providers. We've done it in both English and Spanish. And I think a lot of it is just to really make sure that our businesses are aware of the number of resources that are available from a federal, state, and local standpoint. It was important that we would also coordinate efforts and do these educational site visits, engage on these calls to understand just the various WorkSafe guidelines that were going to be needed to start implementing into each of their facilities. Irrespective of the industry sector, I think it was really important that businesses understand that. So there's significant outreach that's ongoing, that's in progress. And I think Nicole mentioned, you know, the stakeholder outreach is not really going to conclude at a certain phase. It's ongoing. It's something that we've done from the very beginning. And I think it really shows how much we're really trying to leverage the support that's very much needed now. Really addressing many of these barriers to workforce. I think this child care grant was also very essential from both the city and county being able to come together and deploy that, work in conjunction with Workforce Solutions. These are all measures that are important to address as we continue to reopen our economy. Once again, We're continuing to work with the UT School of Public Health and with various other service providers, as well as the industry, to provide us with guidance on what type of work-safe protocols are going to be needed to be implemented across the board with regards to just these businesses. And as we continue to move forward with the June timeframe, it's really important that we start addressing how we're going to allocate these federal funds, as well as how we're going to organize ourselves and really address and coordinate with our service providers and our partner organizations to assist our businesses as we continue to reopen our economy. Next slide. I'd like to have IT just go ahead and play this video just to give you a sense of what companies that are here in El Paso are doing to really ensure that the health and safety of their employees is taken care of, as well as the public that they serve.
My name is Ever Moya, and I'm the Director of Operations for the Southwest for Technomark. We're a manufacturer of medical devices, medical parts for the medical industry, as well as for the packaging and consumer goods industry. We were very fortunate that our leadership team and our executive team, our corporate headquarters, was ahead of everything. They put together what's called the Coronavirus Leadership Team, the CLT as we call it, and they provided us a lot of input, a lot of training. We developed a lot of tools to help our employees when they arrive at work in the morning.
Yes, sir. We're trying to address that here with IT, but I understand there's no sound, but just to give you a perspective there, Carter. Yes, we're trying to fix it. Give me 1 second, please.
Well, my name is Ever Moya, and I'm the Director of Operations for the Southwest for Technomark. We're a manufacturer of medical devices, medical parts for the medical industry, as well as for the packaging and consumer goods industry. We were very fortunate that our leadership team and our executive team, our corporate headquarters, was ahead of everything. They put together what's called the Coronavirus Leadership Team, the CLT as we call it, and they provided us a lot of input, a lot of training. We developed a lot of tools to help our employees. When they arrive at work in the mornings, we do a temperature test.
96.6.
As well as some questions. Every time a visitor comes in, we ask them questions, and we also take their temperature.
All right, if you don't mind, I'm gonna take your temperature right here.
In our break room, we had tables that we separated, and we actually went out and bought individual tables where one person sits at a time, so it's not a group of people that sit together. We also marked off 6-foot spaces where employees, when they come in, when they walk in, when they have to clock in, they wait till the next person gets clocked in before they can go in there. Our engineering team here developed and they put together plastic shields for the workstations that separate all of the operators so that they're not standing close to each other. We gave all of our employees additional masks so that they can clean them and make sure as they wash one, they wear the clean ones. And it's recommended that they wear them throughout the facility here. We ship most of our stuff out, and what we've done in our shipping is we've developed procedures where we don't have any interactions with the truckers. It's all done virtually. They back up their trucks, they get loaded, and they go away. At this time, we need to support each other. We need to support our biggest asset, our employees, making sure that they're providing for their families and also that they have a safe and a healthy work environment for them.
So as you can see, Mayor and Council, this is I think there's an echo. Okay, can everyone hear me okay?
Yes, ma'am.
Yes.
Yes, we got you.
Okay, perfect. Okay, so as you can see, that's just an example of the types of protocols and measures that businesses are taking and they're integrating into their facility. Really, that will be an adjustment for many of them. And keep in mind, for many of our small businesses, not only is this an adjustment, but this is also a burden, a financial burden that they're going to need to be able to accommodate for. And this is why we have been working very closely. Dr. Mena with the UT School of Public Health has been instrumental in working alongside our team. And we've got a series of webinars that have been very, very well, attended. We just had our first one last week with retailers. It's my understanding there were about 200 attendees. There's one that will be happening today, and these are taking place every Wednesday, and they're done specific to each industry. And keep in mind, this is also protocols and guidelines that we're also coordinating with the state and making sure that they're aligned and that we're all following the proper directives, as well as coordinating with our Office of Emergency Management here and our chief as well. Next slide. Now, keep in mind, in terms of just the stakeholder outreach, I think Nicole just did a real great job outlining for you the stakeholder outreach that we've done and how we've really coordinated alongside community development, alongside other partner organizations across our region to really understand just the needs and understand areas that we can all come together on and assist. We've deployed those $1 million plus, right, when you include all these other efforts that we've done to date since the onset of this crisis, as well as engaged with over 40 community partners. And all of this is done, Council, to make sure that we're listening to our industry, listening to our businesses, and then understanding how we're going to be able to put measures, programs, initiatives in place that will help to address those needs that we're seeing. We're also reaching out to other communities across the state and to our counterparts in Ciudad Juarez to really make sure that we're engaged and that we're sharing our information with them. When you talk about WorkSafe guidelines, that's definitely an area that's very important to them, to the industry as well. So we're doing that in a binational form. Next slide. Now, when you take a look at just the stakeholder outreach and the feedback that we've gotten in a number of surveys that we've done from the onset in working with our chambers of commerce and others, we've really understood that the number one needed improvement to just strengthen just, the economic prosperity of our region is to improve the cash flow, to ensure that these businesses have that access to capital to be able to allocate those dollars to their immediate needs, whether that is their rent, their payroll, any of those needs that they have in terms of paying down that burden that they're facing right now that's immediate. Keep in mind that many of these businesses don't have cash on hand to last them through much more than 6 months. So it's very important, and we're seeing this come across in every survey that we've done. Restarting and continuing operations, that's really a matter of really understanding, what guidelines, protocols they need to make sure that they integrate into their facility, into their business environment. And then when you talk about invigorating demand, you're talking about many businesses that don't have an e-commerce platform, that are not well suited to provide a different type of delivery mechanism, especially understanding that we're all needing to isolate. And as we start reopening, there's a number of just different areas that we need to help and assist. This digital transformation has definitely taken on an acceleration, and it's actually forced many of these businesses to partner, to learn, to integrate. And many of our providers are working with them one-on-one to get this done. Next slide. And so as you can see, when you're looking at just our economy and the fact that approximately 80% of all business establishments in El Paso are considered a small business, And that's very important, Mayor and Council, to understand that, you know, many of the jobs that are created, that are retained, are coming from these small business establishments. And there's still a significant percentage that are not able to access the traditional lending. And then many of them are still excluded from these federal financial assistance programs. And so programs that we institute, such as the one that we did with Lift Fund and a number of other nonprofits and other organizations that have stood up to assist these businesses. This is all very important just in terms of resources that they can continue to leverage. One thing that we've been doing is that we've been working closely with our workforce board and understanding exactly, you know, those number of unemployment insurance claims. When you look at where we are to date, there's nearly in excess of 60,000 people that have filed unemployment since March. But there's also an opportunity here, and approximately 80% have a high school diploma, GED, associate's degree, or just some level of college. And we've been coordinating with not only Workforce Board, but El Paso Community College, UTEP, and others to figure out if there's going to be an opportunity to upskill and reskill, be able to come up with customized training programs that are quick, that are going to be very targeted, not so much on the industry, but targeted on the occupations. Because keep in mind, there is a significant amount of need with regards to IT, for example, that many of these businesses are going to need to integrate. Nicole mentioned about, you know, facilitating maybe temporary employment from our workforce board, and we are in communication with them because our workforce board understands that many of these businesses are going to need these types of skill sets to be able to be sustainable and to continue to grow and expand. Next slide. And so when we talk about the CARES allocation, keep in mind that everything that we're doing right now, we need to make sure that it's going to be deployed in a manner that is consistent with the CARES Act. So we're going to need to ensure that we're in alignment with the federal funds, and that what we've allocated in the bucket towards improving liquidity and cash flow, of those 18.4 million, we've allocated a little over 10 million. When you look at that, we're outlining it in different areas. The first and foremost that's very important is to address how we're going to expand the Lift Fund Small Business Recovery program. If you remember, we entered into an agreement with them, and one of the first areas that we want to address immediately is to make sure that those applicants that were in the queue to secure those grant applications can first be the first ones to get in line to be able to secure those dollars that they had applied for, but unfortunately the funds were exhausted. So that's item number one that we're really working in conjunction with our legal and with our finance team to make sure that we provide that first opportunity. As Nicole mentioned, we're going to be working very closely with her and her team to put out that notice of funding availability, because there are other areas, this financial literacy training, business continuity planning, a lot of the legal assistance, financial assistance is very important for these businesses to have much more of a chance to be able to be eligible, especially when they're going to put together their programs, their documents, and be able to secure additional funds, either from a traditional lender or from other service providers that we may be engaged with. And finally, the Business Resource Clearinghouse, what that means is that there's so many resources out there that many of our service providers, partners, organizations are working on and that are deployed at a federal, state, and local level. But with that, there's not one point of contact, one area where they can go to. And we've been really working alongside our public information office to really utilize epstrong.org to house a lot of that information. So as we're working on programs, as we're working on the number of resources that we need to put into place, at least that website will be able to house that information in both English and Spanish. And then working with our partners across just the number of programs that they're going to coordinate with, we're going to need to create a really strong communications plan so that our businesses are aware of the process and then who to go to for what specific type of assistance. Next slide. And then when we talk about restarting and continuing operations, we've been in conversation with a number of these service providers. One example is our downtown management district, for example. When you look at a program that could facilitate, whether it's a downtown sanitation program, whether it's facilitating access to starter kits that can help provide these businesses the ability to open and open safely and make sure that they are addressing those concerns, not only from the public, but also from the employees, as well as guidance with these types of work safe guidelines that many of them still need. When you look at that total, that's close to 7.8 million. But keep in mind that as we're allocating the notice of funding availability, as we're entering into agreements with each of these service providers, it's really important that we do that in a manner that is consistent with the CARES Act. Next slide. And this is also tremendously important because this is one area that many of our service providers, if not all of them, touched on, and they really understood that this is an area that we all need to be very, very closely in tune with. If you could go to that next slide, the slide before, please. Those programs in terms of deploying that digital transformation and being able to provide support, guidance, and training for these businesses are very important. That e-commerce platform that now is very important, and being able to facilitate that guidance to that business owner is a model that we're looking to put in terms of deploying funds and then making sure that service provider or partner organization has the ability to work through and provide that assistance to those businesses, irrespective of the industry sector that they sit in. And we are allocating $600,000 to that. And the next slide. So just to conclude, when you look at the timeline, there is a sense of urgency. Our businesses really need the economic relief. They need that access to capital. They need to be able to understand the types of protocols and guidelines that they're going to have to start implementing as we start reopening this economy. And with the understanding that these are federal funds, we are going to work closely with community development to issue that notice of funding availability. And we have that scheduled for this Friday. Again, keep in mind that we're asking our service providers to really provide their applications no later than June 5th. And by mid-June, and no later than June 23rd, we really want to come back with these agreements so that we can start allocating those dollars to our businesses and really collaborate closely and figure out a way to start addressing the need and also providing a number of these resources now versus later. Thank you.
Good afternoon, Mayor and Council. Tracy Jerome, Deputy City Manager, Quality of Life. I'm going to be speaking with you today about our testing, where we've been, where we are, and where we're going. A recap and an update on our testing capabilities and efforts across the community. First and foremost, I'd like to point out that the public health staff has been incredibly responsive to community needs, while also always following best practices as defined by the CDC. The guidelines and the recommendations are coming, or have been coming since the beginning of the crisis, quite fast and furious from the CDC. And I'd like to commend the staff there in their response levels, regardless of what the challenges have been. Quite frankly, with the way that the guidance has changed over time, oftentimes public staff has been challenged as to the way that they need to be responsive to the community, but they have met all of those needs, and it's been quite remarkable to see. As you're all aware, we were not the only ones. El Paso was not unique in the fact that the availability of testing materials in the beginning was very limited. It was a nationwide challenge, and so we worked very, very hard and very, very diligently to ensure that our voices were heard, and that the demand that we had here and the needs were going to be met. All of the testing supplies that were coming in, especially in the beginning, were provided to the FDA and the CDC. And all of those supplies that came and continue to come are subject to federal guidelines and regulations, and communities are required to follow those. So again, in the beginning, there were very, very stringent requirements for testing, and it wasn't a matter of not wanting to provide equity of access. It was a matter of, again, being compliant and making sure that we were following the guidelines that were put forth by the federal government. Again, public health staff has been required to be incredibly flexible, but they have been as the regulations and the requirements have evolved. And they have put the community in the forefront to make sure that regardless of what the requirements were, they complied, but also provided great health care. It's exciting to be able to share with you now, however, that our testing has expanded exponentially across our community. Next slide. And the numbers, as was some of these were touched on by the city manager in his overview. But for example, from early April to early May, our testing increased at approximately a rate of approximately 32%. Since May 1st, our testing has increased 98%. And what that means is since the middle of May, for example, our daily average testing is at just under 1,300 tests a day. The average number is 1,294 tests. We have not, since the middle of May, maxed out or exceeded demand on any day for testing, and everyone who has wanted or needed to be tested has been, and that's really, really incredibly important. As of the middle of May, we had tested 2.4% of residents, and that's not just city residents, that's across the city and the county of El Paso. And why this is important is that the Surgeon General actually made the recommendation that all communities should be tested at 2% of their population by the end of May. So we met and exceeded that number ahead of time, which means that we continue to pursue our testing and our goals to provide what we need to the community. Almost on a daily basis, testing sites and options continue to expand across the community. And not only are we offering now permanent sites and standalone sites, but also mobile sites that are traveling to make sure that we're getting that penetration in the community, not only in neighborhoods, but also through the rural communities as well. Again, as I said, we are optimistic that we are now on target not only to meet, but to exceed our testing goals, which are 3% of our population by June, and then 5% by the end of July. Again, according to the Surgeon General, areas that are considered hardest hit by the COVID-19 infection rates, the recommendation from him is to meet 6%. So if we're at 5% by July, and given where we are compared nationally, we are again ahead of the game in so much as we are making sure that we are getting everyone tested. Next slide, please. Again, we continue to expand the number of testing sites through partnerships, both in the public and the private sector. All our efforts are led by our public health staff and the heroes that are there working every day. But it is important to note again that the collaborative efforts that we're pursuing have been incredible, and the list of our partners, both from the public and private sectors, is incredibly diverse. Next slide. Some of our current partnerships that I have listed here include the federal government, Quest Lab, UTEP, Walmart. Then we go to the state level with the Texas Department of Emergency Management for rural testing, then the Texas Department of Emergency Management, and this is the Texas Military Department of Mobile Testing. So we have we've got two different attacks that are being supported by the state. We also have a collaboration that's been recently established with CVS. We're working in collaboration with our nine area ISDs, as well as urgent care for kids. Next slide. Two of those that I think are exciting to mention are a collaboration with Project Vita, as well as a collaboration with UMC. And these types of testings that we're looking at developing with them will include both, again, static sites, as well as getting into areas across the county and city to make sure that we're reaching as many people as possible and providing the most equitable of access to anyone and everyone who wants and needs to be tested. Next slide. So since April 20th, the federally sponsored drive-through site has been available free of charge for anyone who's experiencing symptoms. And I want to point that out because I don't know if people are as aware as they should be of how quickly, again, we were able to navigate those requirements. In the very beginning, when that site was first set up, again, very, very limited access. But since the middle of April, available free of charge for anyone. And I will point out as well, I'm going to be giving you a lot of very specific details today, but I encourage you to visit epstrong.org/testing for up-to-date information and any specifics that you might want to know about with testing. It's exciting as well because the website has been redesigned recently to really make sure that it is as user-friendly as possible. It is updated continuously, so the information that's there is continuously refreshed and freshened. Again, anyone can go to the federally sponsored drive-through, for example, Mondays through Saturdays, 7 to 5, no charge. And bookings can be made by telephone. And I do know of a number of people that have utilized the site, and they have been able to get same-day testing, which is really fantastic. Next slide. At that same location, there is a second drive-through location that is set up for Quest Lab clients. And what happens is if you're a physician, if you see a private physician and they provide you with an order, then you can go to the Quest Lab lane as opposed to the federally sponsored lane. In addition, we also offer focused first responder rapid testing at that site. It's another drive-through opportunity, and this is for our public safety and first responder personnel. We want to make sure that we are being as responsive to the needs of this group who are on the front lines every day, making sure that we are kept safe, to ensure that they can gain immediate results if they either are symptomatic or concerned that they have been exposed at any given time. They can go in, they get rapid testing, and they can get an immediate result so they know that they are safe to return to work. And this is incredibly important to not only make sure that they're cared for, but to make sure that they're able to continue to care for us. Next slide. This was discussed a little bit earlier today, our expanded lab capability that's been developed with UTEP. This is incredibly important because with more testing and expedited results, we can actually make sure that we can get our workforce back in place and make sure that families are protected. If someone is infected, we can make sure that they are aware of it quickly and that people can be responsive as quickly as they need to be. This is an incredible model of collaboration, really connecting the public university capacity that's there for research to help with the emergent public health need that we're currently facing here in El Paso. What the lab will do is, and again, Chief D'Agostino touched on this earlier, the lab will actually be supporting our Department of Public Health-led testing. And so therefore, there will be a lot more tests that can be processed on a daily basis. We're looking at an addition of about 500 samples a day that can be processed, and the turnaround time is at about 24 hours. And again, what this means is, not only will people have a reduction in their anxiety if they're concerned about being sick, but it will feed into the increased productivity so that we can really, get the engine going again as we're looking to reopen, restart, and recover from a point of view of the economy. So again, really meeting the healthcare needs, but also looking at what this is going to mean to bringing us back. Next slide. As you're all, I believe, aware, Walmart also began offering testing at 3 various locations at various parts of the city, and that collaboration began on May 8th. Again, you can go as long as you are either symptomatic or asymptomatic, but feel that you're in a risk in a high risk situation. So whether you feel like you've been, one has been exposed or one has underlying healthcare concerns. Mondays, Wednesdays, and Fridays, they began expanding their hours as well. So from 19th of May, they're now open until 10 a.m. every day. And it's a very easy process and free of charge for anyone who wants to visit the Walmart drive-through. Next slide. Our rural testing is something that we continue to do. When these slides were prepared, this week's schedule wasn't available, but I'll be able to share that with you today. The rural testing began on the 10th of May. And again, this is the idea behind this is to make sure that we are that personnel is going out into the more remote rural areas of our community to ensure that everyone, regardless of where they may live, gets access to testing. Again, this is for all members of the community with or without symptoms, 9 to 6, free of charge. The request is that people make appointments ahead of time, and it's very easy. It can either be booked online or on the phone. And next slide, please. This will show you some of the locations that when we started earlier in the month, how far the reach was. So we're looking at locations including Fort Davis, the city of Presidio, Del City, Sierra Blanca, Fabens, Monte Vista. Next slide, please. San Elizario, Horizon, Venton, again, Socorro. Next slide. Anthony, and some of the other locations. Next slide. And I think it's important to note that this type of testing continues. If you, again, go to epstrong.org, you can see the testing schedule for this week, but I can just highlight it for you. It began again yesterday and running through next week, 9 to 5. They're going to be all over the county again, a variety of locations, including Trinillo, again, back out to San Elizario, and a number of the various county locations as well to make sure that we're reaching everyone. In response to outreach that the mayor led with the state, with the governor, on the 11th of May, we had additional mobile testing that came in supported by the state, again, to ensure that we were reaching into our neighborhoods and making sure that if someone didn't have transport necessarily, that they could still go to a location very close to them. This mobile team came in and they remain in the community, and because the testing and the demand has been at a level that they continue to stay with us. They offer free of charge, again, testing every day, Monday through Friday, 9 to 5, for any member of the community with or without symptoms. Next slide. They have 4 main sites. These are the 4 sites where they set up. They have set up at the Armijo Recreation Center, Nations Tobin Park, Esperanza Costa Moreno Library, and then the Memorial Swimming Pool. Next slide. They began again the week of May 11th, and they continue on, continuing. If you could, next slide, please. Next slide. This was the schedule for last week. Next slide. And this week, they are at all 4 sites, and they are available each day of the week, and they will be there through, they're scheduled right now through next Tuesday. We also have, with another private partner, a partnership that started on the 22nd of May with CVS. Again, 3 locations. Anyone experiencing symptoms or that are considered in a more high-risk group. This testing is done through their pharmacy drive-up windows. Again, at these 3 locations. And so, incredibly convenient. All you have to do is book your appointment online. Most appointments, they're offered during regular pharmacy hours, and you don't get out of your car like you do with the rest of the drive-throughs. You drive up, there's a self-swab process, and you're ready to go. Next slide. We've also entered into a relationship with 9 of our area ISDs. Really important because, again, getting testing into neighborhoods, getting testing available all across the county is incredibly important. They're all taking some different approaches in the way in which they want to offer the service. For example, EPISD has started offering a service, and you book through. They have an online booking service for online medication or medical provision for their students. And then you can go in and you can have your test done at the Burnett site, which is on Thomason, from 8 to 11. That started last Friday. YISD has set up, beginning from yesterday. There was a press release that went out. They now have 3 sites available. Their central office, their pre-K center, and North Star Elementary. And again, they're doing symptomatic and asymptomatic testing from 8 to noon. They're set up right now. They're going to be doing a test run to see what the demand looks like. And the other ESDs are all in various levels of their process and their planning to see what the requirements look like and how they can best serve their areas. But this is really important because, again, the ISDs, are there and integrated into their part of the community to make sure that they serve everyone. Next slide. Urgent Care for Kids began on the 20th of May. This was, again, another drive-up service that was offered 9 to 5 free of charge. We were notified yesterday, however, that this service is going to be discontinued because they don't have a demand. They saw 30 patients last week, and they had no demand and no reservations this week. So this particular site will not continue and not move forward, but we, again, have other partnerships that will. Interestingly, to think that, not long ago, I think people were clamoring and wondering if we had enough people and enough sites set up. But we now, this is the first one that has come forward that the demand has not been high enough to keep them open. And there was a press release yesterday on that. Next slide. We began antibody testing for our workforce through focus on our first responders in early May. This was, again, this effort has been led through the Office of Emergency Management, working with health. And what they have done is they've taken sample groups, core groups of individuals from our frontline first responders, our public safety workers, our healthcare workers, to do testing. They've done 2 different groups, the week of May 4th and the week of May 11th. They're in the process now of doing data analysis to kind of understand, but to understand where we are as a community with the antibody testing, where we are, how many people does it look like, whether they realized it or not, actually have the antibodies to COVID-19. It's an interesting test group. Again, being first responders and frontline workers, there were approximately 800 tests that were performed. And we anticipate, again, depending on how quickly the analysis they're able to do on this data, we're anticipating expanding this as part of our phased back to work plan that Colonel Weston will be speaking with you a little bit in more detail, a little bit further along in the presentation. But we're looking at expanding this in the month of June, July timeframe, depending for our workforce and a larger sample group. But 800, like I said, 800 tests were initially done, and it will give us some interesting, I think, data about our community and where we are with the antibody testing, as opposed to the active viral testing that's happening at all the other test sites. Next slide. So you may be aware that the governor actually sent down directives regarding testing in a variety of different sites and how that should happen. The program here, nursing homes are meant to have everyone tested. This, again, under the direction of the governor. The program began the week of 18 May. There were approximately there were over 2,300 tests that were performed, and 15 sites were visited by staff. And so, again, that gives us a very, very good coverage and a very, very good testing to make sure that in some of the higher risk locations that the testing is being done, staff is being tested as well as the residents to ensure that we're providing that testing and we can garner that information. So far, if you look at the state statistics with cases and sites, as of the middle of the month, we were at only 36% of the state average for the overall sites that were affected, and at only 20% of the state average for cases among residents. And so it's important that we take aggressive steps and we continue to protect those who are most vulnerable. And when there are issues, that we do exactly what we've done, which is taking a very aggressive approach to taking care of the situation and not allowing flare-ups and hotspots to become worse. I would like to point out, though, that when the state reports this type of data, that it's done by health service region, and our health service region includes Odessa and San Angelo. So the numbers are not pulled out specifically at the state level for this reporting. So I just wanted to point that out, that we do have other communities that are in our health service region for this type of reporting. Next slide. Some other data points that I think are interesting to consider as well is that if you're looking at our numbers again from the middle of May, who has been tested as opposed to those who test positive, our positive testing rate is still well below the U.S. national average. We were at a little over mid-May when this data was pulled together. El Paso was at about 10%, whereas the U.S. average for those who were tested was at about 15%. Our recovery rate has continued to improve. When this data was crunched, we were at 49%, whereas the U.S. Recovery rate for those who tested positive was at only 18%. As of today, if you look at our numbers today and you look at the trends, we're now at about 56% recovery. And then if you look at the death rates, percentage of those who tested positive who have died in El Paso, the death rate is actually declining somewhat. It was at 2.9%. We're currently at about 2.7%, and the U.S. average is 6%. Now, that's not to say that any death is okay. That's not to say that it's okay that we're having more positives. None of that is what this is about. But to put in perspective where we are, I think that this is heartening to know that the efforts that we're making, both from a preventative standpoint with encouraging the fact that we need to cover our faces and wear masks. There are studies that have been done in other parts of the world, and the figures differ depending on what country you're looking at and where the study was done. But up to 75%, they believe, is the impact that it can have. You can reduce your chances of spreading the disease by up to 75% if you wear a mask. And you wear the mask not to protect yourself, but you're protecting others. So if you ever wonder if you should put it on, if you care about your loved ones and you care about your friends and you care about your community, be selfless and put a mask on. The same with social distancing. And some of the other issues that have been discussed earlier today about taking care of your health, your general health now. Because the healthier that you can be now, the better off you'll be if you are exposed. And if, God forbid, you contract COVID-19. I want to also point out, before we move forward into the next section of the presentation, some of the other efforts that staff have undertaken that's really important about getting our community back on its feet. We've been working very closely with several, again, of the ISDs, not just on the expansion of testing, but trying to provide some normality to their graduating seniors. And I'm very happy to share some positive news that we've actually been able to approve a number of outdoor graduation proposals. And it's exciting to know EPISD, all 12 of their high schools will be having a ceremony coming up, or they'll be coming in June per the governor's approval. CISD has also received approval, and we're working with a number of other ISDs and a number of other schools And I think it's important that we celebrate these new normals when we can, and to know that, we are going to be living with and dealing with this for the foreseeable future. But it doesn't mean that we can't have some moments of joy. And so I'm happy to share that with you as well. And that concludes my portion of the presentation at this time. Next slide. And we're going to be moving on now. David Coronado is going to be discussing data analysis with you. Thank you.
Hi, thank you, Tracy. Good afternoon, Mayor and Council. My name is David Coronado, and I'll be talking about our data analysis and contact tracing efforts. So our team is going to support ongoing COVID-19 related efforts with data analysis and dashboards to timely inform decision makers and the public about the current pandemic conditions and data trends of the overall regional economy. We'll be looking at data trends, dashboards, heat maps, and also working on a contact tracing program. And I'll talk about that in a few minutes here. So this is all information that we can use in the coming weeks and months as the economy slowly reopens in the state of Texas and we transition from phase to phase locally. So here I'm just giving you a quick review of the team members that are on this group. We have economists, a planner, GIS analyst, and also fire and health department staff, and a data scientist. So it's a pretty diverse group of folks. Here I'm also showing you the main tasks that we've already started working on, and also an example of a heat map that we created to look at mobility patterns in El Paso as new health orders are issued or amended over time. And finally, like I said, we are collaborating with the health department and fire departments on some of the work they have done with dashboards. And you saw Dr. Carranza this morning, today, showing you some of those figures and images. So really good information that we now have at our disposal for you all to see and monitor this pandemic. We're also working on contact tracing and a staffing plan that has been developed and is being implemented over the next few weeks as they continue to improve their operations and ability to respond to this pandemic. Next slide, please. In terms of data analysis, we are tracking and using these data sets from both inside and outside the city. We've already set up a schedule with multiple departments within the city to do regular data downloads and update our information, so we always have the latest data available. We're also collecting data from secondary data sources from other agencies to monitor the impact that COVID-19 is having in our region and in other parts of the country. So like the city manager said this morning, we are looking at our own data to see how we can adjust our operations and make decisions locally here in El Paso. We're tracking also bridge crossings, airport activities, metro ridership, building permits, sales, hotel taxes, home sales, the El Paso business cycle, the exchange rate, among others. So there's quite a bit of information that we're tracking right now, monitoring every single week as data is being released, and we keep track of that as well. Next slide, please. So this is another example of data dashboards or analysis that we have on bridges. So here, this is the business cycle in El Paso. And in March, already in March, even though the effects of the pandemic were late in March in El Paso, at least here locally, we saw the economy contract at an annualized rate of 0.48%. And so the new numbers should be released this week for the month of April. So we expect that number to increase in the next couple of days. At the bottom here, we're showing the home sales decrease of 13% in April, again, a sharp decline just in one month. Again, as the economy in El Paso is impacted with this pandemic and the economy begins to take a dive. Next slide, please. We're tracking also the exchange rate. It's one of these metrics that we track at Bridges for sure, because we do offer our customers the ability to pay in pesos. So we track that as well. This not only impacts operations within the city, but also sales taxes. Once the economy fully reopens and the restrictions being placed by the feds at the bridges, this exchange rate, since it's so high now, it is going to impact the ability of Mexicans to come to El Paso and purchase goods here. So it'll drive our sales taxes down as well. So it's a double impact here locally with this exchange rate being so volatile that it has been in the last few weeks. Next slide. We're tracking also county mobility patterns here in El Paso. You see here visits to each of these sectors: retail, grocery, pharmacies, parks, transit stations, workplaces, residential areas. And you see that over time, as those orders are amended and the Open Texas Plan is implemented, we see those start to spike and go back to pre-COVID-19 levels slowly but surely. As we have gone from 25%, we'll be going to 50%, 75%. You'll see these metrics, and so we're tracking these as well. Next slide, please. So in terms of dashboards, we are working with Chief Red and his team over at the fire department, as well as the GIS division, on tools they have developed to track the current pandemic, case activity, contact tracing, and also current PPE levels. The GIS division dashboard is based on an ArcGIS platform and is tailored for public information, whereas the fire department dashboard is based on a Power BI platform and it uses detailed case level information with COVID-19 cases, and it's tailored for OEM staff to track the current pandemic. And they also developed their own dashboard to track PPE equipment, face shield, N95 masks, gloves, gowns, and others. So again, these are really unique tools that they have developed. And I have to say, I've been really impressed with the work that they have done in such a limited amount of time during these difficult times. So really kudos to the fire department and GIS team with these dashboards. Next slide. More examples of the dashboards. So you saw some of this information with Dr. Ocana's presentation this morning. Next slide. So now onto contact tracing. Next slide, please. So contact tracing is conducted as an effort to determine possible spread of the infection and to implement measures to stop the spread of COVID-19. So here on the right, I'm showing you a very simplistic view of the complex contact tracing process that is being followed with each person that is interviewed. We'll be working with the fire department and health department on a process mapping exercise to expand on this, and then also find areas of opportunity. So throughout this process, the level of risk is assigned to each individual, and guidance is given to them on what steps they need to take, whether it is to just monitor their health if they're low risk, or if they have to quarantine or even isolate themselves in their homes to a confined bedroom if they test positive. Next slide. So I mentioned a staffing plan. Before I get into that, right now, as it stands today, the contact tracing team is 154 strong. Now, not all these folks are active today. So as of today, there are 88 active contact tracers. These are EPIs, investigators, monitors, follow-up, and triage groups. And the other 66 are in reserves. And these are folks that are with the fire department. They're nurses, medical students, and others. So right now, we are not working at full capacity. So that's on the good news, right? We're not working at full capacity. There's capacity to expand if needed as the caseload expands. But also keep in mind that these folks also track other communicable diseases year-round in the county. So COVID-19 is not their only priority. They have others, other spread or other diseases that they track. So we have to take that into account as well as we monitor their caseload and we work with them on their staffing plan. Next slide. So as I said, the staffing plan has been developed and implemented to increase the staffing levels and to prepare in the event of the caseload continues to grow. The plan right now to recruit is to recruit an additional 150 contact tracers to assist in the future and in anticipation of any future waves of cases. Right now in the US, the recommended ratio of contact tracers per 100,000 people ranges between 11 and 30. The middle range is about 15 during normal times, but during times of a pandemic like today, that doubles to 30 contact tracers per 100,000 people. And so currently our ratio right now is 10.3, only taking into account those 88 that are active. But if we increase that to the ones that are also in reserves, that number can go up to 18. So we're well within that range that is recommended in the US with the reserves. So the staffing plan that is being implemented now calls for the recruitment of more full-time contact tracers to increase our ratio up to 28 folks. 28 folks per 100,000 people within the next 6 to 8 weeks. So it's just shy of that cap of the ideal range during a pandemic. So as you can tell right now from just these few slides, there's a lot of planning taking place to improve the readiness of our staff and our workforce, and in anticipation of any future waves we might see in El Paso. And with that, that concludes my presentation. I'll pass it over to Sam in a second here. Thank you.
Good afternoon, Mayor and Council. Sam with the U.S. Transportation and Chief Operations Officer. Our team is focused, next slide please, focus on the physical infrastructure to allow our response teams to address the space requirements to provide a response to our community, as well as look at the infrastructure moving forward as we see waves 2, 3, and 4 coming later this season, as has been specified, and subsequently if a vaccine is developed to allow the capability for having mobile clinics out in our community to allow for mass vaccinations throughout. So our focus is looking at physical spaces that will address logistics. You heard Dion Mack talk about how much PPE, all the material and equipment that's being stored in various locations throughout the community. We want to centralize that and have good control of those logistics or material for the OEM to be able to respond efficiently, as well as expand our lab capability as well at a single location. We're also looking for space for epidemiology and contact tracing. I just heard a very detailed explanation from David about the staffing levels. So we're making sure that we have the space to allocate to revamp or increase labor force related to epidemiology and contact tracing is going to be important, especially as we get into the colder months this coming season. In addition to that, we're also looking at drive-through testing and mobile clinics throughout our community. We're looking at 5 regionalized locations that will allow, again, our staff and our teams to be able to be out there in conjunction with our partners. You heard a lot of partnerships with the school districts, as well as our UMC and the county, to be able to utilize as many of these facilities as we can to be able to have that service out in front to the communities. Next slide. The drive-through clinics in testing facilities, we've established some evaluation criteria that we've tasked our real estate consultant to evaluate as they sift through available properties throughout. We're looking specifically at locations, again, looking at the proximity and spacing to other health facilities, as well as some of our partners to try to maximize the availability to our community. We're also looking at the space to make sure that we have ample acreage and building facility and the parking availability, as well as anticipating queue lines as well. So making sure that we take that into account. We want to also have turnkey facilities. There's quite an inventory in our community of available space, specifically medical type facilities that may be available for us to jump on and allow our teams to be able to move in readily at these locations. Of course, cost will be an issue as well. We'll make sure we want to stay fiscally responsible as we make recommendations to council on these. And then the connectivity, both for transportation on the vehicle side, but also making sure that we have back to public transportation and allowing all members of our community to be able to access it effectively and efficiently. The move-in time, as I stated, again, being able to move in quickly as a turnkey facility will be critical moving forward. Next slide. I'm going to turn the presentation over to Kerry now to speak about the operational focus.
Good afternoon, Mayor and Council. Kerry Weston, Senior Deputy City Manager. In my portion of the presentation, I'm going to cover our city government back to work planning efforts. If you could go to the next slide, please. As the city manager mentioned in his overview this morning, from the moment that we had the stay-at-home order and that was implemented, we've had 42% of our workforce remain on site delivering services to our community. So this plan primarily addresses how we phase back our workforce that's telecommuting, which is largely our administrative personnel. As we've gone through this effort, really there are 3 planning imperatives or guidelines that underpin how we're looking at transitioning back to normal operations. And certainly our number 1 priority is protecting the health and safety of our employees. But just as important is their confidence that they're returning to a safe and secure environment. And as we transition back, we'll need to closely monitor any potential resurgence or secondary outbreak of the virus, and we got to have a plan for that, and we do. And so I'll talk about that in a little bit. Rather than establishing an arbitrary return date, the decision to begin phasing our employees back to work is condition-based. And so what we're going to want to see is 7 consecutive days of declining positive cases. And if you look at where we are at this point, we as a community have not seen that. So we think that will start establishing that downward trend. We'll also need to see that both the hospital bed and ICU bed capacity is stable. And so if we meet both of those conditions and they're both satisfied, the numbers are acceptable by our health authority, then we'll make a recommendation for a phase 1 return date. If you could go to the next slide, please. So this is a 3-phase return plan. As I mentioned on the previous slide, we'll enter into phase 1 when we satisfy the conditions. And then we'll return in phase 1 with a 25% return to work of those currently that are telecommuting. And in this particular phase, in phase 1, we'll keep city common areas, break rooms, conference rooms, any of the meeting and gathering areas closed, and we'll continue to follow strict social distancing and worksite protocols. Phase 2 then would commence after we satisfy that criteria or that gating again a second time. So 7 more consecutive days of declining positive cases with the same evaluation that we'll do in looking at our community's hospital and ICU bed capacity. This would be a 50% return to work, and we'll continue to maintain the same worksite safety protocols as we did in Phase 1. And then finally in Phase 3, a third consecutive gating of those days of declining positive cases. We commence 100% return to work and then evaluate the current CDC guidelines at that time as it relates to worksite protocols and PPE. Now, one of the things that I mentioned on the earlier slide that we have to pay attention to is a resurgence of the virus. And so the way we'll look at that, because we've got the infrastructure in place now and how we are telecommuting, how we're conducting the city's business virtually, if we see 7 days of climbing numbers of positive cases, we'll evaluate that with the health authority and then potentially make a recommendation to revert back to the previous phase of staffing. Next chart. Next, please. So back in mid-April, when the CDC and the White House published their back to work guidelines, what we did as a city is we developed return phase plans for every single department in the city. So this matrix from the International Bridges Department is just a representative example of the planning work that has been completed for every city department. And so depending on the department, there's a mix of telecommuting, staggered shifts, and then specific department requirements or consistent guidelines regarding worksite protocols. And so as we continue to receive updated guidance at the federal, state, and local level, we'll continue to modify our department and city planning matrices so that we remain current with those standards. Next chart. So a lot of work still to be done. Here's the ongoing tasks that are currently in progress. We're continuing to refine our worksite protocols. We're examining things like safe queuing areas, protective barriers, those types of things where we have point-to-point customer contact, how we procedurally maintain social distancing in our workspaces, and then closing off gathering areas to limit exposure. Dion talked about the logistics and the logistics that's flowing through the EOC. So we're currently evaluating a sustainment supply of PPE at the department level and centralizing the procurement of those supplies through our EOC logistics. Streets and Maintenance is conducting a city facilities assessment. What we want to do is we want to look at each of our buildings now, each of our facilities, because now when we come back, we're going to have to operate in a new normal, a new set of guidelines and protocols. So up front, we want to identify any of those safety related concerns, things like any areas where we might have bullpen seating, where social distancing may be problematic. You know, CID did a lot of work prior to us leaving to go on the stay-at-home directive on installing things like hand sanitation receptacles. And so we want to look across our city facilities to see where we might need to do a little bit more to make the environment safer for our employees. Tracy Jerome mentioned the employee testing. Well, a big part of that, of what we want to do is we want to make swab testing available for our employees as we transition back to work. This goes back to the planning imperative I talked about, about wanting our employees to be confident that they're going back to a safe work environment. One of the ways to do that is to make this testing largely available for our employees as we transition back. We're also evaluating our custodial disinfecting and sanitation plan, looking at what our requirements are and what our requirements are going to be for routine deep cleaning of high-use areas. And then finally, HR is working on a number of employee-related guidelines as we return to work. There are a lot of things that we've learned as we've gone into this that now we have to really specify and spell out in guidelines. Things like what our procedures are for self-quarantine of employees, time away for required testing, and those kinds of things. And so as we make progress in all these areas, we'll come back and we'll let the full council know how we're doing in getting all these things done. And that completes an overview of our planning as we look at returning back to work. And I'll turn it over to Julie Baldwin for the next section of the presentation.
Thank you, Carrie. So for our last team report out, we want to ensure that we really close out with a workforce focus and just provide some key information that really stems from our leadership culture. And so I'll be covering some information on that, and then I'll go ahead and hand it over to Ben 5, which will also ensure that we touch on focus on fitness, which is a key element of what we want to cover today. Next slide, please. So I want to start first and foremost, as we've reported out information today, a key element of our leadership system is really how we organize through cross-functional teams. So you've heard today 10 separate report outs from teams that are very much focused on not just operational actions that are required in terms of what we need today, but also ensuring that our organizational planning is aligned for what's to come for continuous recovery. So you heard from 10 today, but then also in terms of our ongoing strategic planning and other efforts, you heard yesterday from the Goal 4 team as an example, and that wrapped up our Goal Team reporting cycle for this fiscal year. So it's critical that throughout the continuity of what's being provided, we're focused throughout this presentation in terms of COVID-19 response and recovery, but also organizational planning on a continuous basis, because that helps ensure that we also connect process improvement in how we approach our work. So as we began this conversation and this report out today and information that was provided, we have an overview from our city manager, but also Chief D'Agostino, that is providing oversight of all the different 10 teams that you've heard from today to ensure that there's that continuity in terms of process improvement. And he also has that background in terms of being a green belt and being able to apply that lens in how we think about processes moving forward. In terms of, I want to spotlight quickly as well, when we talk about leadership development as well as culture, I wanted to provide a snapshot and spotlight one program in particular, that is our tuition assistance program. The reason why that's relevant is that's something that's been in place for some time, but it also is a key tool that's been put in place to ensure that we provide specific upskilling and reskilling opportunities for our workforce. And so ensuring that there's continuity with that and being able to provide that has been critical in terms of workforce development. A quick spotlight that I'll mention on that, as well as while it's been in place for some time in FY16, additional enhancements were added to that to ensure that we continue to provide that opportunity for our workforce. And then lastly, from a communication standpoint, because that's absolutely a critical component of our leadership culture, is ensuring that there's continuous opportunities for two-way communication. So organizationally, what's put in place to ensure that there's that clear line of sight for not only actions that need to be taken, but what's coming next. Weekly strategic briefing reviews are conducted. And then we also have the 500 group, which comprises our leadership within the organization to have touch points on key information that needs to be provided. So formats and different ways that information is being provided consist of town halls, which is pictured on this slide, and which we'll also be providing virtually. Next slide, please. So I mentioned the tuition assistance program. So here pictured is the most recent 2019 recognition ceremony. And then just to spotlight utilization, this, as I mentioned previously, it's been put in place for several years now, but we're continuing to find ways to really enhance and refine those opportunities so that there's a consistent program that our workforce has available for skill development. Next slide, please. And this just provides a brief snapshot of succession implementation. So it's one thing to put plans in place and provide different types of options to assist with career progression, but wanted just to provide a quick snapshot of what that looks like in terms of recent years and recent activity. So when we look at internal promotions and growing leaders within the organization, there's been 560 over the last 2.5 years alone, and that's across all job types as pictured in the chart on the right. But then there's also been 158 provisional assignments since 2015. So an example, we had 16 in FY15 to 43 this last fiscal year. So those assignments also provide the opportunity to continue to provide career progression and to step into roles as our organization is ready to lead through normal circumstances as well as emergency preparedness, response, and recovery, which is what we've been covering today. Next slide, please. Now, in kind of going back to the previous slide, and we can stay on the slide, but one point that I did want to make in connecting back to something that Dr. Carranza mentioned earlier today, in the context of developing local talent and also reaching out to stakeholders within the community. So in this section, it really connects back to that local talent that we also have internal that's leading these initiatives and that's really ensuring that our services and our service delivery continues to be exceptional with the challenges that we're facing. And so I wanted to reemphasize the commitment of our workforce. And so during our last employee engagement survey cycle, we had 98% of respondents indicate that they understand their contribution on a day-to-day. So it's one thing to reference the 98%, but it's also another to really look at the high response rate that we have in terms of engagement within that survey. So we're at 87%, which reflects close to 5,200 of our workforce. So if you have that 98% indicating that they understand their contribution, that becomes very evident when we're faced with working through our day-to-day operations and ensuring that we continue with that continuity. I mentioned a bit earlier about process improvement and how that's a key component of how we look at our day-to-day operations, but also what does the future look like in terms of our service delivery. So we have over 500 of our workforce that have engaged in process improvement efforts. And then lastly, we do have 100% departmental reach and continuous improvement training. And that's going to be critical so that as we look to identify opportunities and really look at our existing processes, we're ensuring that that's connected, that there's a clear line of sight, and that we have that basis connected back to our mission, vision, and values that really support not just our leadership culture, but our overall organizational culture and the type of service that we want to deliver to our community. Next slide, please. And then lastly, I want to take a minute to spotlight the continuous efforts of our workforce that's been working through COVID-19. Here pictured as a spotlight, we have our street and maintenance different areas. And so a shout out to Mary Gomez. And so she has pictured here both those folks that are working on site, the 42% that were referenced by Carrie Weston previously, as well as others that have reported out today, but then also those that are working remotely to ensure that those services are being supported and provided from home. And so this just provides you a snapshot of our diverse workforce that's continuing to serve our community, striving to deliver those exceptional services as we look at what's next. And so with that, I'm going to go ahead and turn it over to Ben Fife that's going to share some information in terms of our focus on fitness. Ben?
Thank you, Julie. I want to take the time to highlight this chart again, which Council saw earlier in the presentation, just to underscore that health issues prevalent in our community, namely high blood pressure, diabetes, and obesity, not only increase the risk of contacting COVID-19, but also increase the risk of complications regardless of age. Those factors also put our workforce at risk. 42% of whom you've heard are still working on site, are front-facing, and working selflessly to make sure that operations are continuing and that we're continuing to deliver exceptional service. And in particular, I would like to thank and acknowledge the scores of employees who have willingly taken temporary reassignments with OEM and the health department to step up and work towards enforcement, educating our community, and actively addressing critical needs for emergency operations. I believe that they represent the best of what makes this a strong, collaborative organization working towards common goals and service to our community. Next slide, please. So we'd like to take the opportunity to discuss the importance of the Shape It Up program. As a reminder, it is the city's comprehensive wellness program that can mitigate COVID complicating risk factors, put money in employees' pockets, and also save the city money in insurance costs. Again, by incentivizing wellness, we are ensuring city employees are decreasing risk factors for COVID-19. Next slide. There are 3 incentive levels ranging from $50 to $150 based on 6 fitness tests you see here, administered by Parks and Rec staff. Next slide. For those employees who are unable to potentially complete some of those fitness measures, we also have a biometric option for employees with the same incentive levels and extra points for employees who take part in structured fitness activities like gym visits, yoga classes, and avoiding the use of tobacco. Next slide, please. Beyond the financial benefits, this program directly augments the quality of life of our workforce, ensuring employees who are healthier, stronger, and in the case of our current state of emergency, less vulnerable to factors that can lead to fatality if COVID-19 is contracted. Next slide. There have been a number of success stories related to this program from the over 600 employees who are participating, and we've listed 2 testimonials here. I won't read them to you, but they are from employees at Sun Metro and the airport. And if you think about that, these are two very front-facing departments with high levels of public interaction. And so these employees, by taking part in this program, have, again, mitigated some of their risk factors for that. Next slide. As part of the strategy to promote exercise and activity that can reduce those risk factors, Parks and Rec, in coordination with partners, go to the next slide, please. We just covered this. Sorry. So as part of our strategy to promote exercise and activity to reduce the risk factors, we coordinated with partners at the state park, city leadership, and Office of Emergency Management to reopen all trails this past weekend with tremendous success. We worked with Streets and Maintenance to install special signage to remind users to maintain social distance and to avoid more difficult terrain that has in the past led to search and rescue operations that divert first responders at a time when we want to reserve resources for pandemic responses. Next slide. So thank you, and now I would like to pass it back to the city manager to wrap up this detailed and comprehensive report for you.
So I want to thank the mayor and council for your patience and giving us the time to present all this information to you. As you can see, this is a very comprehensive report. As we pointed out, we have been working from the very beginning to update you and give you the latest information so that it can be helpful in the decisions that you make as we continue to respond to this pandemic. We stood this cross-functional team to lead and address all aspects of what we need now, what we need as we go into the future. I think it's important to mention that several people in this presentation, some people from outside organizations, mentioned that multidisciplinary teams are very important in terms of change management. This is something that the city of El Paso has been doing for over 5 years. We did that as a result of the strategic plan. I think Emma Schwartz talked about change management, and we've had cross-functional teams in place for over 5 years. And we really feel that that breaks down silos and really helps attack different problems so that we can come up with solutions. We used a cross-functional team on the electric utility issue. We use cross-functional teams for the Shape It Up program. We use cross-functional teams to set up the strategic planning process that Julie Baldwin headed up, if you recall. All of that organically utilized the talent within our organization to not only show you the talent that we have in the city of El Paso, but really talk about the importance of developing our leadership team, and not only developing them, but then showing them really flourish and really lead our organization and our community to the success that we've enjoyed. We've covered an update on a stay-at-home order directive with Carla Neiman, the update on the eviction orders, again by Carla Neiman, the cross-functional teams that we covered with the fire chief, the report outs that included the health department, financial focus. Again, want to underscore Dr. Orcaranza's vast experience in the health field and what he's meant to this region. I think very few people really knew who he was till this started. I think that one of the things, and having grown up in the culture that I'm very proud to be a part of, a lot of people that speak with beautiful accents, a lot of folks don't think or know what they bring to the table. I think Dr. O is an excellent example of someone who brings an incredible amount of talent to the table and one that represents this region admirably. Again, the financial focus by Robert Cortinas that got into the detail with the CARES Act. And we also included other areas like federal transit and federal aviation, and those dollars that were associated with those acts in terms of what was passed by the federal government. We also talked about the stakeholder input and the community vulnerabilities and how we're addressing that with Nicole Farini, which did an excellent job of pointing out all the things that her team and other teams throughout the organization have done to support that effort. The logistics and education at Dion Mac showed a tremendous amount of partnering with the Patel Group and also with the MCA. Compliance and service delivery. Ellen did a masterful job of kind of going over the voluntary compliance and how that's important. I know that we got a lot of calls early on by some of you about compliance, and we've got still some inalienable rights that are put in place by our Constitution, and we have to be very careful in terms of how those are carried out. And we've pointed those things out to y'all, and we've shared how we've executed on council direction, but at the same time been very delicate and been very much involved in following the law as well. So that was very, very important. The compliance and service delivery that Ellen covered, I think, was a good overview of that area. The economic recovery, not only did we provide those funds, but I think that and partnered with the county to do so. But what we also did in that area is we also worked on providing best protocols to help those businesses open up with that creativity and that innovation. The testing recap that Jerome covered, I think that was a very good indicator that we are listening and that we know that that's important to the council. We showed in great detail how that's grown and the work that's been done there. So I want to thank Jerome for doing that. And the data analysis with David Coronado, we put that in place, those economists over at the bridges, because as I mentioned before, there had been very little or no investment in the bridges over the course of half a century. And the fact that we had not invested in the bridges, and not only from a capital improvement standpoint, but from an intellectual infrastructure standpoint, is a shame. And as you know now, we're able to present any kinds of data that are needed along the bridges and the work that's being done with the cross-border traffic that takes place. It's very, very important to our region. But they also have a lot of capacity, in my opinion. And I challenge them all the time that we use them for other cross-functional teams, whether it's Sun Metro and now in this case, contact tracing. I think you can see the talent that's there and how we're able to utilize that talent. The planning and implementing and going into the future, we're not just looking at today, but we're looking at what are we going to do in the near term in terms of the future and then the long term. And Sam Rodriguez did a good job of pointing out how we're looking at new buildings with some of that CARES Act money in order to sustain this effort in the long haul. Because as I said, from a financial standpoint, this is going to be a 30-month process, but I think living with the disease is probably going to be from here on out, in terms of how we do that, whether it's identifying and utilizing a vaccine or how we throw this into the ball of wax of all the other diseases that we have to contend with as human beings. So that was very important. Kerry Weston did a great job as usual on talking about the operational focus and how we get the workforce back in place in full force, but doing it responsibly and also delicately. Other key focus areas that Julie Baldwin did a great job of presenting, and then Ben Fife and what he pointed out, our commitment to fitness. We've been committed to that as an organization for quite some time. We talked about the underlying health conditions and how those underlying health conditions have exacerbated the problems with COVID-19. So it's something that we're very committed towards doing and something that we'll continue to do, and it's been helpful to us in taking care of our workforce during this pandemic. So as we mentioned before, we were going to give you a very detailed, a very comprehensive report. Believe it or not, this is just a sampling of the work that's been done. I know we took a tremendous amount of time, but this is a very important issue that's affecting our economy, that's affecting our operations, that's affecting our community's health. So I think you see and you've heard that not only do we have folks in our organization that are extremely talented, and a lot of people in my position say that about folks in the organization, but as you can see, I was absolutely on point with that. We have an incredible staff that with given direction and given the right processes and systems, like a cross-functional team and the resources in order to go do their work, do amazing work. And they're doing that on behalf of the work with the mayor and the county judge, the council, and the direction that they've provided. But there's been a lot of effort that's been put into it on a daily basis by folks like yourselves, by folks like the mayor and the judge who do this every day, these updates. And so they see the work that's being done, and we wanted to make sure that we shared it and gave you a good understanding of what all is taking place with respect to how our city is responding to the pandemic.
Thank you, Tommy. And again, well said and very thorough and comprehensive, and I compliment your team. We have 3 members of council who've requested to speak, and there probably may be more. First will be our Mayor Pro Tem, then Representative Vanello, and then Representative Lizarraga.
Yeah, I'll wait. I'm actually wondering if there's anybody signed up to speak in public comment. Maybe we can.
We're going to hold this. Peter, we're going to hold them until after council goes for their questions, and then we'll have public comment.
All right, then I'll let the rest of council speak before asking questions. I don't want to take up too much time.
Representative Manella?
Yeah, I'll start with these brief questions and then come back. First question is for Mrs. Neiman. Carly, you talked a lot about evictions, and our order ends June 9th, I believe, June 10th. Is there the ability for us to extend our emergency order to be able to extend the moratorium on evictions and utility shutoffs?
Yes, so as usual, we have been placing that item on every other agenda so that you all are allowed to extend the moratorium. We will continue to do that. So the next time you see it will be on the June 9th agenda. I believe that's and then it'll be extended for another 30 days. So that will continue to happen as long as we're under the emergency directive.
Okay, and just because I know we've heard a lot from staff, and thank you to staff for all of the information on where it comes to getting the CARES dollars out on there, but we just want to make sure that we have people covered until they get their money and they're able to pay those. So that's my concern. And then focusing on that, Nicole, and again, I want to thank you all. We did pass a resolution last council meeting, and this update really did address a lot of the things in the resolution. So I want to thank you for that. It was a short period of time and you really hit all of it. But Nicole, I am wondering about the policies for the release of dollars. That was also a part of our resolution, and just wanted to see when we can expect those policies to come to council. Or Jessica, whoever wants to address that.
So thank you, Representative Anello. Nicole Farini, Chief Resilience Officer. So we have been working on the notice of funding availability in partnership with our stakeholders. We have that draft ready now. We hope to release it this Friday. Once we receive those applications, when we move into the contracting process, that's what actually will come back to council for approval, authorization for us to enter into those agreements under the conditions set forward in the notice of funding availability. But at this time, in order to get the NOFA out and get the dollars on the ground, we had planned to release that Friday. So you would not see that before we release it the way we have it scheduled now.
Okay, but it will come to us before the release of the dollars.
Before the actual contracts are executed, yes, ma'am.
Okay, is there a way that you can send us the language for NOFA? Just because, I mean, right, when we look at the lift fund, shift fund that we did, we as council members got a lot of questions. So if possible, not for action, but if you could just send us the language of the notice so we can be fully educated in case we get those questions, I would appreciate that.
Yes, ma'am, we can share that.
Okay, and again, sorry, go ahead, Nicole.
Representative, this is Jessica. I just wanted to let you know we're working closely with community development. So as Nicole said, we're going to be issuing that out on Friday, but we're happy to provide you with that information.
Okay, I really appreciate that. And Mayor, I will yield my time for the time being. Thank you all.
Representative Lizarga.
Yes, thank you so much, Mayor. And I too want to echo the sentiments of my colleagues, and thank you so much, Tommy, and all your team for the tremendous presentations. I have a question for Dr. O. Is he still available?
Yes,
Dr. O, thank you so much for your hard work for our beautiful community. I was just wondering if you could comment on how effective is that or accurate is the antibody testing?
Well, the antibody testing is not very accurate to detect the disease, the actual disease at the present time. What it tells us is that you probably were exposed and you develop antibodies against the disease. But if you have a positive antibody test with IgM, then what needs to be done is that you need to go and get a PCR test done to see if you're actively infected with the virus at this particular time. So when we do antibody testing around the community, what we're trying to do is see how many of the people in the community have been exposed without developing much of the symptoms, so we can see the prevalence of the disease at the moment that we take the samples. So if we see that there is a high prevalence or there's a high number of people that already develop immunity, that means that the virus has been around the community for quite some time, And then definitely the strategy to do other interventions is going to change compared to when we have sampling and see that there's not that many people with antibodies. Then that means that there's still plenty of people that are susceptible to catch the virus, develop the disease, and still be subject to the complications.
Okay, thank you. And then my next question for you, Dr. O, is that the Public Health Department reported that there were clusters at 120 of the facilities. I'm just wondering if you could comment for the benefit of the public about those clusters.
Well, yes, we wanted to inform the public about the clusters, and the clusters are when we have more than 2 cases in a single place. The clusters is not to alarm the public, but also to let them know how we're finding a lot of the cases, so that can also bring some information to the people as how people are getting infected. So if we know that people are getting infected at places of work, then they need to take very good preventive measures and be very, very cautious as how often they're washing their hands, how they're wearing their face mask. And those interventions are going to be the ones that are going to help in those settings stop the spread of the virus, so they can be better informed. As I mentioned before, it's not to alarm the people, is to make a better interventions.
Okay, thank you. Thank you, Dr. O, so much for all your hard work. We really appreciate your service to the city of El Paso, the county. My next question is for Nicole. Thank you. Nicole. Hi, Nicole. Thanks so much for all your hard work. I wanted to ask you about the MiFi. You said you were going to be doubling the capacity about that. And then as part of the relief funds, right, you're going to be getting $150,000 for the digital access expansion. So I'm just wondering, because I have a lot of poor neighborhoods in my district, how you're going to get those to that MiFi to those poor neighborhoods. You have a plan yet?
So we're working through that plan right now, Representative, with IT, and I don't know if Araceli is on the call and she can maybe help me. We've had a little bit of conversation to date. What we've been able to identify is the amount of money that we have and the fact that we can, in fact, not only expand the number of MiFi units that are available, but also expand to include the unlimited data plan, which is something that we did not have before. And Araceli, I don't know if you want to add to that.
Sure. So good afternoon. This is Araceli with the IT department. So we have been working alongside Nicole's team and also our library team. We are expecting to be able to get funding through the work that we've been doing with Nicole and ensure that we're able to start receiving more MiFis. We have an estimate total around 600 plus that we're looking at getting with this funding that she's obtaining. And once we do have it, we do have to follow some regulations, ensure that we track how we're handing those out, but we would follow the same protocol that we're doing alongside the library. So it would be a checkout program, and we just need to work out the details of how we're checking those out.
Okay. Thank you so much for all your hard work. And then my next question, thanks, Nicole. Thank you, Araceli. My next question is just for Colonel Weston, real quickly. Thank you, Colonel, for all your hard work and everyone else. I know that Camilo sent us a template about the return to work for, the mayor and city council. So is that template still in effect? It was updated.
It is.
Okay, April 23rd.
The only adjustment to that template is the percentage in the phasing from when it originally was sent out in mid-April. But again, if you look at it from the standpoint of 25% return, and if you look at it from the council's perspective in terms of how your offices are situated with good social distancing and your staff, you really could look at that in terms of a return in phase 1 or phase 2.
Okay, thank you.
So it's the same template.
Okay, thanks. And then my next question or my next challenge is just for my colleagues on the Shape It Up. Tommy, Mr. Gonzalez, I wanted to thank you for that program. I think it's a very vital program for the city of El Paso. And for any of my colleagues who haven't participated in the Shape It Up, I really encourage you to take part in that. Thank you. And that's it, Mayor.
Okay, thank you, sis. Representative Hernandez and then Representative Rivera.
Thank you, Representative Lizardo.
Thank you. Thank you to all of the speakers. You all did a wonderful job. My question is for Dr. Ocaranza. Going back to your data, I'm very happy to see that we are indicating additional variables in the way that we're reporting deaths and positive cases. My question is, on slide 21, you indicate the race of positive COVID-19. Can we see the statistics on the deaths based on race as well? Do you have those numbers now to share?
Yes, if we can put the presentation, please.
On slide 41, it shows the death by mortality, gender, conditions, but I don't see the race.
Yeah, definitely. I don't think we have that graph, but I can provide that to you. And as we mentioned before, the demographics of El Paso, since we have over 80% of Hispanics, the vast majority of the people that have died because of COVID has been Hispanic, but there's other races, ethnicities. So, but I can definitely provide that to you.
Are you pulling that up now? I'm sorry, I just wanted to.
By age group. Yeah, the death by, I don't think we have one death by ethnicity.
No, there's not. That's why I'm asking if you have those numbers to share now.
I don't have them to share right now, but I can definitely forward them to you. I just need to pull the data.
Okay, and I think it's just important that we report those as well on the website. I know if there's any criticism that I'm hearing from the community, mostly great things, especially to you, Dr. Ocaranza. And I think we learned from listening to the voices of the public is that we have more data that we can share. If we can't share more data, that's fine. I think it'll only help answer more questions to those who are doing analysis and to the public and media. So I would urge you to post that online so that we can track on our own, especially to ensure that there's no spike in certain ethnicities and track whether or not it's disproportionately affecting any races in our community. So I know that's something important to the public. So that was my only question. Thank you, Dr. Carranza. And you can send that to my email as well.
Thank you very much for your comment. Thank you.
Representative Rivera.
Thank you, Mayor. This question is for Dr. Carranza also, please. Everybody did a great job.
Mayor, this is Laura Cruz Acosta.
How you doing, Dr. O? Great job, great presentation. And as my previous colleague said, everything was done, providing us more information than expected, but that's great. That way we can relay it to our constituents as well, or those who ask. My question to you comes in the form of, you had the same slide regarding the death rates. And all the death rates so far have been, so to speak, by underlying conditions, as you stated. With the percentage of people being hospitalized, there must be others with underlying conditions that survived the COVID illness. Do you have that stat, or can you provide something like information on if that has occurred?
Yeah, definitely, I will look into that so I can send information to all of you. And definitely, as we have some people that passed away that has underlying medical conditions, we have people that have recovered that has underlying health conditions as well. And I want to make the remark that our medical community has done a wonderful job in keeping our community healthy and doing all their effort in providing the care that all the patients need. And definitely I will follow up on your request, sir.
Thank you, sir. And in your expert opinion, do you feel that, I know we've started to promote the fitness. In your expert opinion, do you feel that those that might have had or that had the COVID illness and had underlying conditions, were they, so to speak, had that advantage over the ones that passed away because they were in fit, they were doing something to occupy or to say something to do to keep healthy?
Well, definitely, if we control those chronic conditions, we are going to be in better position to fight any kind of infection, not just COVID-19, but many of the other infectious diseases. So, unfortunately, there are plenty of social determinants of health that play a big role in our community. One of those, and we see it in this graph, that we have a big proportion of people with no health insurance. What does that mean? Well, usually these people don't have the means to go to the physician or healthcare provider to be able to control their chronic conditions. Many people have they need to take trips to Mexico, to Juarez in particular, buy their medication, so they will be able to access healthcare, access medications, and be able to control those chronic conditions. And that is a common practice that we see here in our region. So as you see, the social determinants of health is also has an impact in the way that we observe health in the vast majority of our population.
Okay, thank you. And finally, either you or Mr. Rowan can answer this. Do you find that all these new sites that are opening and all the conditions that are been taken down and allowed for people to go to have these testing done, do you find that people are taking advantage of this? If I can ask both of you to answer, or one of the two.
Well, I'll answer part of that question, and I think people are getting tested, and the fact that we've been very successful in increasing very drastically the amount of testing that we have done in the county is because we're bringing the testing to their neighborhoods. As we know, many of our people don't have the means to transport and go and get tested because it is a hardship. So we found it very useful when we had those mobile testing sites. By bringing the testing to the people had a wonderful response and have been able to get that testing done as they need to do it.
Well, fine, and thank you for that answer. And I knew that was several of my colleagues' concerns as well as mine, that the testing be taken to them. And I was just hoping that we could have a number as to how much that has helped increase the testing in a percentage sort of way. But you've answered my questions well. Thank you so much. I appreciate the answers you provided to me and the public as well. And this presentation again. Thank you, everyone. Thanks, Mayor.
You bet. Representative Rivera, I want to add that the governor's strike force, when they came out, and then their epidemiology surge team, when they set up their 4 test site facilities, they based it on the location for hotspots. So that's how that was set up to begin with.
Do you know how much longer they're going to be here, sir?
Well, we asked for another week or two, and if we need to do more, then I'll make that request as well.
Okay. Thank you.
Right now, they're scheduled right now through the 6th of June. And again, Mayor Margo, thank you so much for that support. And it has been incredibly successful. We are not, again, we haven't maxed out or exceeded demand, but we're averaging right now almost 1,300 tests a day. So that will tell you that what we have, we need, and that people are taking advantage of those opportunities to go out and get tested.
And that's great. Thank you, Ms. Rome, on that. And also, with that said, I know I had asked in a previous council meeting on this, if they didn't have any means, are we providing them with a free public transportation or something like that?
Yeah, so there are a variety of transportation options that are available depending on what the need is. And all that information, again, we have on our website, epstrong.org. So depending on what people need, we are there to help. They can also always call in to our helpline, our 211 line, if they need additional assistance. And we have a variety of opportunities for them to make sure that, again, transportation should not be a barrier. Again, almost every bit of the testing that's available is offered free of charge. There are a variety of sites throughout the entire county. There are drive-ups. There are lots of different opportunities for people. So depending on what people need, we can meet those needs. And if there's something else that comes up that looks like we need to address, we will. I think we've demonstrated today how flexible we are, and that we want to meet the needs for the community, where they are and what they need. We want to be there for them. So, yes, sir.
Again, thank you, Mr. Ullman, and you too, Mayor. Thank you for making that call and helping our community even more. Thank you so much.
Thank you.
Laura, let's go to public comment.
Yes, Mayor. This afternoon we have 3 members of the public that signed up to speak. The first person is Ms. Marisa Limon Garza. Ms. Garza, *6, ma'am, to unmute your telephone, and you'll have 3 minutes. Good afternoon.
Thank you. Good afternoon, Mayor and Council. My name is Marisa Limon Garza. I am the Deputy Director of the Hope Border Institute, a local social justice nonprofit organization here in El Paso, and we are humbly part of a larger coalition that includes the El Paso Community Foundation, the Paso del Norte Community Foundation, the Diocese of El Paso, and various other nonprofit and social service providers. And this whole coalition is really dedicated to meeting the needs of the poor and vulnerable during this public health and economic crisis. We greatly appreciate the time and dedication the Community and Human Development team has put into stewarding the precious resource that is federal aid. We support their proposal today and stand ready to make sure this aid goes to those in most need efficiently and effectively. We know that our friends and neighbors are suffering and they need assistance now. We're talking about 1,500 families getting assistance when tens of thousands need the same support that we all received. We appreciate action by the city. It's an important start, but we really have to fast track things. The county is also in final stages of discerning their fund allocations. From our count, 30 days have passed since CARES dollars hit the city coffers to provide emergency assistance. We're talking about a delay of another 2 weeks before taking action, and for the community that we all serve, that's just not really acceptable. Our coalition has been working around the clock to make this a reality, to do the due diligence. Not many folks can take a whole day out of their work to be online watching and monitoring the council's meetings, so it's important that we take the leadership and we take the responsibility to meet their needs. Every day we wait is another day that our friends and neighbors continue to struggle unnecessarily. We invite you to support the plan presented by the Community and Human Development team, and we ask that a special meeting be called to take action specifically for these dollars so that this community doesn't have to wait again another 2 weeks for any kind of assistance to even begin to be available. Time is of the essence. Thank you very much.
Thank you. The next speaker is Ms. Melissa Lopez. Ms. Lopez, *6. Good afternoon.
Good afternoon. Can you hear me?
Yes, ma'am.
Thank you so much. Mayor, Council, thank you again for taking the time to hear from us. My name is Melissa Lopez. I am the Executive Director of Diocesan Migrant and Refugee Services. We are a legal service provider that serves over 29,000 people in an average year. And I want to echo the comments from my colleague, Ms. Limon. We are part of the same coalition that is trying to ensure that those in most need of this assistance receive it as soon as possible. We want to make sure that people are not going to receive eviction notices. We want to make sure that people have the assistance that they need to be able to obtain their medical care. I do want to take a minute to thank Nicole Farini and her entire team and the rest of the city departments that have worked with her develop this plan. But I think what is urgently needed is for council to approve this process as quickly as possible and deploy those funds as quickly as possible. Based on Ms. Farini's presentation, it seems that she is ready to deploy those funds, and I would just encourage you to take a vote on that particular issue, the deployment of the funds for the various types of assistance for the community as quickly as possible. Thank you so much.
Thank you. The final speaker is Ms. Linda Rivera, or I'm sorry, Linda Rivas. Ms. Rivas, star 6, please. Good afternoon.
Hello, can you hear me?
Yes, ma'am.
Thank you so much. My name is Linda Rivas. I am the Executive Director of Las Americas Immigrant Advocacy Center. We are also part of the coalition with the foundation and with fellow nonprofits, also including the Diocese of El Paso. So I'm very honored to be a part of this, and I would like to urge what my colleagues urged earlier. We would like for the city to take action as soon as possible. We are urging for a special session so that this decision can be made. And we thank so much the work of your staff. We've been honored to work together. And I believe that this is a strong coalition that is absolutely going to do the right thing. And we need action from the council as soon as possible. So that's what I would be echoing the comments of my colleagues and also urging a special session. People cannot wait. Every day we receive phone calls every single day with more people stating that they are out of work, that they are desperate, that they need to pay their rent, that they need to pay medication, that they don't know what to do being out of work for so long and facing hunger and facing all sorts of difficulties. In particular, they are incredibly vulnerable when they don't have access to the same monies as other folks because of their status. So this is something that we want to reiterate for the city to do the right thing, and also just a special session. Thank you so much.
Thank you. And finally, I'll read a statement submitted by Mr. Keith Pennell, which says, "My name is Keith Pennell and I live in Kern Place. I am uncertain at this moment as to any new directives from the governor of the state of Texas with respect to his goal of further opening of the state, and in particular the El Paso region. However, I want to strongly request the mayor and council to further contact the governor with a clear message that we are in this region are completely in the strong growth phase of the pandemic and nowhere close to flattening of the curve, let alone reducing the incidence of new cases and the resulting deaths in our community. Today, I see 8 more deaths, a very high percentage of all those across all our state. In my opinion, it would be criminal for the governor to further continue in our region with the enhanced opening. Texas is too large to be amenable to one policy for all in this dangerous time. I am particularly concerned about the opening of bars and their less restricted patios, often adjoining public pathways. It is imperative that you, as a united governing body in El Paso, along with the city, county medical staff, counter effectively any suggestions as to the continued and further opening of our region. Thank you very much, Keith Pennell." Mayor, that concludes public comment.
Okay, thank you, Laura. Mayor Pro Tem, you want to speak?
Yeah, I had a couple questions that weren't addressed. So one of the stories, I guess I'll just start with some questions relating to testing. One of the stories that was reported this week was that antibody testing was included in the official count by the state of Texas about testing overall. What is the testing that we have from the public health department and from private labs that's being counted with part of our daily count? I don't know if
This is Dr. O, do you want to start? And I'm happy to chime in, but Dr. O is the medical expert on the line.
Yes, I'll start answering that question. And many of the numbers that we put out as far as the testing refers to PCR testing. We're starting to roll out antibody testing, and we've been doing some targeted testing to determine point prevalence of IgG in the community. Although that proportion of antibody testing is very small compared to the one that we're doing as far as PCR testing, and most of the numbers that we're reporting are related to PCR. And Ms. Jerome has a little more information on that.
Yes, sir. So just to confirm, Mayor Pro Tem, the testing that's offered to the public across all of the sites that were discussed today, that's all to test, that's the swab testing, and that's testing for the active virus. So antibody testing is not offered openly to the public in that way. So all the numbers that are being reported are actually the viral testing, not antibody testing. We're not mixing those testing numbers at this time locally.
Okay. Currently we have the state that's providing the testing, I guess you said till June 6th, was it, or June 2nd? So we're going to be losing capacity. What is the plan that we have in
Not
place?
necessarily. We
Okay.
First of all, we're not losing capacity because we only are publishing those test dates on a weekly basis right now because it has to do with demand and location. As Mayor Margot stated earlier, if we need to keep that testing group here from the state, Mayor Margot will reach out to the governor and speak to the governor about that. Because again, they want to make sure that we have the testing capacity that we need. At this time, we don't exceed on a daily basis or max out our capacity that we have right now. And we will continue to stay committed to that. We have other sites that are coming online, other relationships that are coming online. But again, interestingly, I did mention that the test site that was set up by the Urgent Care for Kids at Wallenberg will not continue because again, they had very little interest in testing there. So we are very sensitive to the dynamic nature of the demand, and we will not go backwards. We will continue to make sure that people have the access. But whether or not we need to keep the state mobile unit here, we'll be monitoring that and we'll be working very closely with the state on that so that it does not have an adverse effect on the testing that we're the equity of testing that we're offering right now.
So I'll just emphasize what Jerome already said so that you and the rest of the council can hear this again. We included this in part of the presentation, but we talked about the UTEP relationship and the 500 testing opportunity on a daily basis that could have. So we did address that question. And so we're not looking at it from the standpoint of when the strike team leaves in June 6th. If it does leave in June 6th, we could ask them to extend, or the mayor could rather, and that could help us augment what we're doing. But we're already working on other relationships, as Jerome already has pointed out, and as we reported during this presentation, in particular the one with UTEP, but there's other relationships as well that were reported in the presentation.
So if the mayor does not ask for it, then what is our strategy then? To work with UTEP?
I didn't say that the mayor wasn't going to ask for it. What I said was that if that doesn't happen for whatever reason, then that could mean that the numbers aren't qualifying us to seek that additional time. But I've already mentioned that these other relationships that are coming online, they're going to exponentially increase the amount of tests that we did. And that was addressed in the presentation.
Mayor, are you planning on asking the state for additional dates for testing?
Peter, if Mayor Pro Tem, there is a requirement for us to continue with that, yes. Mayor Nuremberg told me last week on our conference call that they were having a problem with, similar to what Mrs. Jerome said about Wallenberg, that they're having a problem with people, they're not getting them tested. The governor told me on my last call with him that Dallas was having some of the same things. It depends on what our needs factor is. And I rely on Chief D'Agostino and Dr. Ocarranza to tell us what we need. If we need more, we'll keep more. But I'm allowing them to do it, not just whether or not it's a lever or not. It's a matter of the capacity and where we are. We remember we still have all of the National Guard test sites are still out there, and they will continue. And we just set up 4 temporary ones as a strike force, and then some related to the surge issues for hotspots.
Yeah.
Mark, you want to add something?
So if I could, this is Chief DeAugust. We are in constant communications with Texas Division of Emergency Management. They understand that we need to keep those military task force on the ground until we get all of our others that are working at opening up and running. We have complete cooperation with them on that. The federal drive-through lane, I believe, where this started, that one is fully operational at least through the month of June at this point in time, but we have no intentions of stopping that. That's where the UTEP partnership and the partnership with the local laboratories, that's what's going to allow us to continue doing this testing at those locations. So the state's backing us up until we make sure we have everything in motion, but there's no definite timeline on when we lose them. We talk to them almost daily, and they're in complete agreement that we'll keep them as long as we need them.
What is UTEP's capacity to collect samples?
UTEP has the capacity to collect samples, so we'll be utilizing all of our sample collection sites, and we'll be testing them through the Department of Public Health at the UTEP location. What UTEP brings to the table is the capacity to do more tests on a daily basis here locally through the Department of Public Health. So it's an extension of our laboratory. And so that's how it's going to help the picture. As far as collecting samples, they're not collecting samples. It's just a test. It's a laboratory location.
Yeah.
What's beautiful about the, if I may, Mayor Pro Tem, what's beautiful about this lab expansion is we're looking at adding up to 500 more tests that can be processed in an 8-hour period, which means that a turnaround time, we'll be looking at a turnaround time of 24 hours of that testing. So it's not a matter of necessarily sometimes for people not being able to get the testing, but what we want to do is make sure that we're expanding. We're attacking this on a lot of levels. So we want people to be able to get in and get tested, but we also want to be able to turn those tests around. You know, if people think that if they think that they've been infected, they need to behave as though they are infected, which means they go and they can be assessed, they can be tested, but they need to self-quarantine and until they get those test results back. Being able to turn those test results around in a 24-hour time period will greatly enhance not only our sense of security and reduce the anxiety that people are experiencing while they're waiting for those test results. We've all been there when we're waiting to find out if we have, you know, if it's strep throat or whatever else. You don't want to be waiting. So that's going to help.
Yeah. Tracy,
I guess for me, sorry.
Let me just interject one thing on what Tracy said. One of the issues is we've been doing so much testing in the last several weeks that the private labs are backed up. What was initially a 3 to 5 day turnaround is now over a week to 10 days. I'm getting calls, I'm sure you are, and others are saying, I can't get my test results back. So that's the enhancement of having UTEP, which is at 500 a day, we know. And frankly, they have said that they could ramp up to 1,000 a day if they had to. So we're doing what we need to do based on the needs factor and the response, but the private labs are backed up.
Yeah, like I was saying before, you know, I'm not really convinced, and I'm concerned again that whatever we have for adequate testing, we should have more than an abundance of it. You know, it strikes me as odd that the private labs are backed up because of the high rate of testing, but then we have other facilities that are said that they're going to be closing down in our community because there isn't enough testing going on there. And so again, I hope that you reach out to the state because we're nowhere close towards a plateau. We're nowhere close towards a leveling off or a lowering of our numbers. And the only thing one of the things that's going to help is for us to identify people who are COVID-19 plus, whether they're symptomatic or asymptomatic. And so it's great to see the increase that we've had. And it's great to see the increase that we've had across the state, across the city, across with the help that has been going on from the private sector, from the public sector, and from the state. But this is, you know, we're really not at a time to let go of the pedal when it comes towards trying to get folks tested. And that kind of brings me to my second part about that is
Mayor Pro Tem, before you go
Mayor Pro Tem, if you would allow us.
Go ahead.
First of all, the testing, what I would like to remind everyone, I know that's been a lot of data and a lot of information shared today, but from April to May, we increased our testing capacity by 32%. From early May to mid-May, we increased our capacity 98%. There's no one that's involved in this that's taking their foot off the gas. We are moving forward. We are adding new sites every single day. We're adding more capacity. We're adding testing capacity, and we're adding results capacity to make sure we get the results back on the testing. No one is looking at this as though we have gotten to where we need to be yet. There's absolutely no question about that. But finding that right balance and finding what the community needs, I think there's going to be a little bit of that that's going to happen. But please rest assured, and please help us to push the message out to your constituents and to this community that there is equity of accessibility. There is no charge. We will test anyone and everyone that is requesting testing. No one has been denied that. No one will be denied that. But we need to make sure that we are offering testing where it needs to be and how it needs to be available. And that's why we've got a very big mix of where you can go, how you can go, whether it's symptomatic, asymptomatic testing. Again, we're all in the same position in so much as we're still learning as we go what this community needs. It's the same thing across the country, but we are there, and we're not going to compromise on what we're doing for the community.
Yeah, so I guess it concerned me that the Wallenberg site is going to be closed down, and I wonder what is it that we can do more to advertise these places that are there, to go and, I guess for me, with the concern that's there in the community, to say that there's, that we would consider allowing a place to close down that's offering free testing. I guess I would want to know what are things that we can do more. I'm not talking staff can do more, but individually or whatever, to get the word out about these testing locations. I don't know if that's radio spots, if it's robocalls. I don't know if there's, paid ads on Facebook. I don't know what it is more, but to me, it seems that there's a breakdown of getting the message out, that when we're hearing that a site would be closing because of only 30 tests being done on a Tuesday, or maybe it's the time, if there's an ability for these places to stay open later in the evening after work hours. I guess.
So what I would say first of all is it wasn't 30 tests, sir. It wasn't 30 tests done in one day. They were open last week. It was a partnership with a private group. We don't have control necessarily over a private group if they make a determination that they don't want to continue with that. They had 30 tests in an entire week, and no test requests at all for this week at all. So they made the determination that this was not a need for them, and that they didn't need to fill that niche. That being said, all of the other the sites, we've added additional sites. With that one closing, we've added additional sites. So we're still up with what we're providing to the community. And all of this information is available to the community. It's available on site. It's being pushed out. There are press releases that happen every single day. We are looking at other ways in which to communicate with the public, but we are not receiving from the public a demand for more test sites in so much as we're not receiving. Are you receiving feedback that people don't have access to testing, sir? Because if you are, we need to know about that so that we can get to those people.
Do you know what the state cites, if they're allowing, how many tests per household?
Are you receiving that feedback, Mayor Pro Tem?
I'm asking you, have you received feedback that people are being denied access? Because we need to know about that.
I have not received emails that people have been denied access. I've received emails and messages that people's treatment at testing sites, bedside manners, if you will, has been very short. People, rude is the term that I've been described, that somebody's described. But the larger point I have is that with the amount of spread that is occurring in our community, we need to be doing a better job in getting the word out about the testing facilities that are there, because it doesn't seem, it strikes, I guess I'm at a loss as to, during the middle of this pandemic, that people are not showing up to get tested, or there's not the turnaround there, that there's not the turnout of people.
So let me speak, Jerome, just for a sec, okay?
Yes, sir.
Because you seem very focused on the fact that you're not, you still have questions. So we want to make sure we answer these questions. But when we answer the question, and then it's not the question that you really had, you had a different question. We just want to make sure we know exactly what your questions are. Now, with respect to the robocalls or what are we doing extra, we talked about the fact that we meet with the CEOs of the hospitals on a regular basis when we need to. We also meet with the superintendents, again, when we need to. What we've reached out to superintendents about is the graduations and how those have to be approved by the health authority. What we also talk to them about is that they've got a robocall system. And that's the reason why we reached out and wanted them to have test sites as well. And they want information, and they are on our email distribution, and they do get these different information pieces that we send. And we've encouraged them to send that out through their robocalls as well. So we will show more examples of that. Like I said, today was a sampling, simply a sampling of the work that's been done. And you said that we hadn't covered it, but we had covered the parts that you asked about. You know, if people are being rude at the different sites, we need to know that. And then you didn't say that in the beginning. So if you've got emails, forward all those emails to us. We want to make sure are there any concern or issues that we address. And you keep talking about how there's going to be things closing down, and no one said anything's going to close down. No one said that the state, the strike team was going to close down. We indicated that if the numbers show what they show, if the statistics are what they are, we're going to go based on the data. I think everything we presented today, we talked about how the data has been driving our decisions, and that we've included every aspect of the community that we can in order to address all the concerns.
Okay. I had a question. The CVS testing mentioned that it's a self-swab system. I guess the question is the CVS testing, which is new. I guess we've been talking about for the last week. Who is covering the cost for the CVS testing, and what is the self-swab process? Is that the same as the other swab process, or is that different?
Yes, except for the fact that you don't have it for the CVS and for other locations across the country. There are videos available, and I would encourage you to have a look so that there was a still image today that was shown with a tester that was going in and actually inserting the swab. So with a self-test, what happens is, like at the CVS, you pull into the drive-through for the pharmacy. You make your appointment and you pull in. It is offered free of charge if you do not have if you don't have a method of paying. So it is free of charge for people. It's covered through funding that comes from the federal government. The swab there are instructions given, but the person that's sending it out is not coming into direct contact with the testee. They're told what to do, and then the person will actually do their own. They will do their self-testing.
Does the swab go up as deep or no?
They're told where they need to put it. Okay, they're told where to put it, sir. They put it in, and then that's sent back out for testing.
Let Dr. Ocaranzo respond.
And,
I think they observe it.
If I may
Well, they do observe it.
a little bit more. The self-swab, they try to do on the anterior part of the nasal cavity, because when you go too deep without having a professional doing it, then you can cause more harm than good, and it's not going to be a good sample. So the self-swab, they're going to give you instructions how you're going to be collecting that, doing the anterior part of the nose without going deep in like the picture that I showed. In the picture that I showed, it was more of a healthcare professional doing that swab collection.
Okay. And so the CVS testing then is done for symptomatic and asymptomatic. It's done for symptomatic and also high risk.
It's open to anybody.
Yes, sir.
Is that okay?
Yes, sir.
Yeah. Again, I guess I know that we're doing a lot. I just, when it comes towards communicating it again, I hope that we can do it. I know we're doing as much as we can. I hope we could do more. I had a question concerning the daily updates. I know that we've been listing age and gender and underlying conditions. Recently, there was a text that was sent out. There was a press release sent out last weekend concerning settings as well, whether the spread was congregate, community, or jail. Is there an ability to have that setting location be reported daily as well on the press releases for consistency? Is that something, Dr. O, that can be done as well?
Well, the way that we can report, if we report daily, is not going to give that much value, because as we target any particular places or we focus in any particular congregate setting, it might not give you any results until probably a week, couple of weeks. As we gather more information, we can definitely communicate to the public so they can see a trend, so they can see any kind of new changes on the information, and they can see the significance of that. That might be my recommendation, to do it periodically. Maybe daily might not be feasible, the same way that we report any deaths or report the daily increase in the cases. And as you saw in the presentation, many of the statistics that we present are based on a weekly average or by CDC weeks. And that's how we continue presenting some of that information as it becomes available and as relevant as possible.
Why is it not feasible to provide where the new cases are coming from on a daily basis if we're working with contact tracers and interviewing the people that are testing positive?
Well, the people that test positive are reported to the Department of Public Health, and we see that they'll increase. As we work with every single case that is positive, it might lag several days before we get more of the information with the contact tracing. So that's why it's going to be a disproportionate or defacing of that kind of information, where you might see the increase in daily cases is number X, and then you're going to see a Y increase on certain features or characteristics of the positive cases, and that is one of the reasons.
How do we confirm that folks are recovered?
The way that we consider patients that are recovered are based on the CDC guideline, which is having more than 72 hours without fever and the use of any antipyretics, having almost resolved all the symptoms, and having to pass 14 days in isolation from the initial date of the symptoms. There's several ways to do that, and we choose to do the symptom-based approach.
Okay. So basically, if they're 2 weeks without symptoms, we're counting them as recovered?
Yes, sir.
Okay. This is probably not a question for you, Dr. Ocaranza. It's probably more for Mario, for staff. I appreciate everything you're doing, Dr. Ocaranza. So thank you for all the work. I guess bars are opening up on Friday. We heard from one gentleman who's expressed a lot of concern about it. I've heard from a lot of constituents with the fact that our numbers are spiking and rising day after day. Really a lot of concern about the possible spread from opening up of bars. So what is our plan and strategy for inspecting and enforcing bars staying open at a 25% occupancy?
It's going to go back to the way we've handled everything since the onset of the COVID. How we receive calls, we receive emails. Yes, sir.
Mario, before you keep going, I'm concerned about something that was said before. Can you address the issue about people that say that the folks have been rude to them at the testing sites? Because I don't want the community to hear that and be discouraged from going out to the testing sites. And I'm concerned that a comment like that will discourage the community from going out and being tested because they don't want to have folks be rude to them. Can you address that, please?
Yes, sir. Yes, sir. And that's an excellent point. You know, the comment earlier on the bedside manner, I think is how it was put. These test sites, if we look at the federal lane, a lot of those are volunteers. These are volunteers, the staff from hospitals, border RAC, teams from the fire department itself. These are people who serve the public on a daily basis as their profession. And I've gotten nothing but high remarks from them. I haven't seen the complaints. I know, Mayor, you've been down to this test site yourself, and you gave us extremely high compliments on their professionalism and the care they're providing. And when we look at the Texas military sites, those are military. They've been put out here. I'm getting nothing but positive reviews as people are going through. We've received numerous texts and emails stating how helpful they were and how polite they were. Now, sometimes the times get a little bit long, but we haven't even received complaints on that. Everyone was happy once they got up there on the professionalism they received and the timeliness of going through. Now, the timeliness of receiving results, that's based on demand. So that's a completely separate comment. But comments on bedside manner, I've not heard anything. Now, if it's specific to a private company or one of the Walmarts or CVS, that's something different, but I would hope you'd pass those on to us so we can investigate. Because like I said, those are volunteers we have out there at our sites, and I think they're doing a stand-up job.
Okay.
You want to address the bars, Mario?
So getting into the bars, as we've done from the beginning, and it's our compliance task force, I think Dion covered a lot of that earlier. We got numerous ways to get the information in through the PD non-emergency number. And so they're actually getting dispatched to go out to certain locations. We also have the task force who's going out and doing site visits. So more on a preventive basis rather than just waiting for the complaint. That's how it's going to be handled. I mean, can we be at all the facilities at one time? No. But it's a community effort. And it's going to self-responsibility by the business owners, by the patrons, and by our community at large. If we want to have an effect on this virus, the virus that's having an effect on our community, we all have to do our part. And that's maintaining the social distancing, wearing the face mask. Like I said, it's a community-wide effort. We'll continue to enforce as we receive complaints, and we'll continue to educate as we go out and do site visits.
So we're planning on doing site visits and in the evenings when they're open. I mean, I understand the need for people to take responsibility, but people are going to be going out drinking, losing their inhibition, and probably some of that need. So I'm just trying to understand what we're doing proactively there. I mean, everybody saw the images of 6th Street, or a lot of people saw the images of 6th Street in Austin over Memorial Day weekend, at the Ozarks in Missouri over Memorial Day weekend. So I know, Mayor, that you're concerned about it. I know that everybody on the staff is concerned about it. So I'm trying to understand what we're going to do to try to get these places, which are going to be opening up cautiously, to maintain it. Because I would like to think that everybody's responsible, but we know that people are also excited about being open. So you're talking about the task force are going to be going and reviewing these places?
That's correct, and that's part of the plan going forward, and it's part of everything we've been doing, where we have the teams working with the business community and how to prepare them for reopening and how do we get back and what are the best practices. So as they discussed in various parts of the presentation today, that's part of how we get it done, by working together with our partners, the business community, as well as the general public at large. Do we have enough staff to be at every facility at all times? No, we don't.
Are we working with the sheriff's department in terms of some of this enforcement when the bars open up?
I am not aware that we've had those conversations with them. I think they're handling their jurisdiction and we're handling ours. I don't know if there's anything else going on behind the scenes on that one.
Okay. And I guess this last question, I know that Tommy, you started off talking about the need for mental health and some of the opening up as well. And I'm just wondering, in terms of this phased reopening and working collaboratively, if we're reaching out to any of the other ISDs about partnerships for any of their sports facilities, outdoor sports facilities, or use of their libraries for some of those services as well.
Well, I subscribe to the philosophy of under promise and over deliver. And I know that you had asked me some questions, and I shared with you that we had talked to the team about reaching out to the school districts with respect to how to best utilize all the different facilities that they have, that we have. They have staffing Their staffing gets paid by the state. They're not being as impacted as we are. We rely heavily on revenues associated with other than property taxes or state funding. They get a lot of state funding, and they get their other part of funding from the property tax. So it's pretty steady revenue that they receive. So because they may be more fully staffed, they just gave a raise for this next year, the school district did. And so we think that they're pretty solid financially. And when we want to reach out and see if there's partnerships that can be created, we already have several interlocal agreements that we've taken to the city council on multiple fronts already and have a tremendous partnership with them. So we feel like there might be some fertile ground there that we could take advantage of.
Okay, great. One of the questions was relating towards some of the cross-functional teams, and I commend you, city manager and staff, for the work that y'all are doing. I'm just kind of curious, when we have these cross-functional teams and others, are we involving folks from the county or the Congresswoman's office as well in terms of some of this COVID response?
Well, I can respond to one portion of it. You know, we've had direct conversations. Going to today, I was corresponding with the county administrator that wants to adopt our back to work plan and how we're proceeding and looking at that with the county. So that's just on one front. There are several fronts where we're aligning with the partnership with the county on our efforts. And so as an example of that, yes, we are.
Nicole Farini, Chief Resilience Officer. I would just add that I have been in constant contact with the county regarding relief programs and support for El Pasoans. There's been a lot of concern regarding how we're deploying programs both in the city and outside our geographic boundary. And so I have been participating and giving feedback to the Commissioner's Court. The city manager asked if I would function as a liaison with the county on those efforts, and I've been doing that. And so what you're going to see, or what you saw today in terms of our presentation and the funding that's going out, you'll see a mirror of that with the work that the county is doing, and that's a result of the collaboration and the constant communication that we're in. So the answer to your question, sir, is absolutely yes.
We're also working with our federal or local representatives as well.
I'm sorry, let me add to that, because I don't think I want to add some more things with regard to your question. The council is very fully aware of the partnership on the LIFT funds, very aware on the food bank dollars that we partnered with them on as well. I don't know that they gave funding for the Borderplex workforce solutions like we did for daycare, but I think they did. Nicole's nodding yes, but those are examples of macro partnerships and working with each other. Nicole, I think, already alluded to it. She's worked closely with Joel over at the county with respect to the stakeholder issues and the CDBG things and the resilience work that I've assigned her to do. That she's doing a great job in. So those are other partnerships. In addition to that, to Carrie's point, I just emailed Betsy today 3 or 4 times on 4 or 5 things that she talked about where we're partnering on already. So those are other examples. Another macro example, we were on the phone with the county, the judge, and one of the commissioners for, I don't know, 2 hours, Nicole and Carrie. I think it was about 2 hours, and it was about this community task force that's later on in today's presentation. We have multiple examples of those partnerships. With respect to Congresswoman Escobar, I know I've attended the meeting she's asked me to attend. I've kept her informed when she's reached out to me. I've reached out to her on certain issues, especially as related to the funding, on the CARES funding and loosening up those restrictions. And I know she's doing everything she can to help in that regard. So I don't know that if you recall that we've already presented all those things before, and we reiterated some of those things today as well.
Okay.
How much more?
And then just 2 other questions, Mayor. So, Nicole, since I'm looking at you in the virtual box, hello from your inner space over there. One of the speakers, or a couple of the speakers, talked about the disbursement of funds being accelerated. What are the possibilities of that as well?
I think that what I can speak to is our readiness. We've done the stakeholder outreach and we've assessed the capacity of our service provider partners to be able to apply to the notice of funding availability we're pushing out. As I mentioned earlier in the presentation, Friday is our anticipated release date of the notice of funding availability. That is for the majority of the programs that I discussed today. The timeline that I presented to you is based on existing council sessions and our need to be able to bring back the recommendations to you all and receive authority to enter into those agreements. I will say that as a call out, the Community Assistance Fund is not part of the Notice of Funding Availability. That's something that we're working on directly with the El Paso Community Foundation. And so that could be ready earlier than the recommendations, but currently we are basing our schedule on existing council meetings so that we can bring those back for your approval, sir.
So do we need to call an emergency meeting to have it accelerated, to have it brought back before the 2 weeks? Because I'm very concerned that time is really of the essence for a lot of families right now. And I understand that we need to make sure that it's all tied up and ready to go, but to wait 2 weeks at a time of crisis for so many families in our community, I'm wondering if you think it's appropriate or you have the abilities that we can do this sooner than June 9th or June 8th if it's a Monday.
Well, part of this delay, let me just add, part of this delay was council's direction that it be required to come back for approval, as opposed to the original presentation, which was to delegate it and then allow staff to distribute it. So just be mindful.
I mean, no, it's a nice talking point, Dee. It's a nice talking point, but it's not really accurate.
It
and
is.
I've heard it at other presentations you've given, sir. So,
Mayor Pro Tem, please continue. There are other people who want to speak as well.
So then, yeah. So the other question I had was,
Mayor Pro Tem, to your question, and you know this deal with you and what y'all were just going back and forth with. We have demonstrated, I think, a commitment to this community through this presentation to show the entire council and the community all the work that's being done. And there's a lot of stakeholder input that needs to be obtained. I have made it very clear to Nicole and to the rest of the teams that all reported. If they need anything, that we will be there to provide that support if necessary. They need the time to make sure that all the questions like you're asking today are being answered and then we're prepared, because we don't want to hear, because we don't wake up every day thinking we're going to do mediocre work. That's not how we wake up. We wake up saying we're going to do exceptional work. And I know that that's what the staff provided today. Okay. And so
I don't think anybody's suggesting otherwise.
Let me finish my point. Let me finish my point. So that when we come back, we want to be ready. And the reason why we were ready today is because it takes time to prepare. And so in order to be prepared and make sure that the people who are most vulnerable are receiving the funds that we take very seriously, we do. The people that need it the most, we want to make sure they get the dollars. I mean, right now, the food bank's running out of food. Right now. And I understand that another entity did not re-up the funding for them. And Ms. Goodell is very concerned. I'm not saying that because I'm just plucking out one of the nonprofits. They're doing, quite frankly, God's work in giving people food when they don't have food. I mean, that's biblical. And so we have serious needs in our community, and we're very serious about it. If there's a need for a special meeting, we will ask the mayor, we'll ask the council to call that meeting. And we're the ones that asked for this meeting today on Wednesday because it was Memorial Day. I mean, we have never been held back by asking for any process or system or any tool that we need in order to get our work done. But we're not going to come unprepared to a meeting. We absolutely are not. Just because whoever wants to just say we want to have a meeting and we're not prepared for it, that's not productive. It's not a good use of your time or our time, and it's certainly not sending the right message to the community.
So I don't think anybody was questioning that this wasn't a thorough and well executed presentation whatsoever. So again, I think that staff more than adequately covered everything that was there. And I would hope that we as elected officials are allowed to ask questions. You know, I don't think that that is an issue. I think that getting clarification should be part of this process. And moving forward, Mayor, I really think, and I only speak for myself, but I'm sure that other colleagues agree as well, there needs to be a break either at some of these updates to allow for questioning so that there's more of a dialogue. Because 5 hours nonstop of presentations with us asking questions really throws off, I think, the ability to do so. The last question that I had, I wanted to reiterate again, Tommy, so is there going to be police force at entertainment districts and other areas of high volumes of bars this weekend with the openings?
So the first point that you addressed to the mayor that really you could have addressed me, because in my experience, in 30 years of doing this and 18 years in the city manager seat, and being a retired colonel for the military and giving briefings to all kinds of people, generals in different countries, and that is that we always say, leave your questions to the end. And that's because during our presentation, we probably will answer those questions. And if we don't, then absolutely we want to answer questions. We have not, and if we've given that impression that we don't want anybody to ask questions, that's certainly not our intent. Our thing is that we present, when you ask something, we present it. I'm just simply pointing it out that we presented it. Or if you make a comment about something that I think is going to cause concern in the community, I want to make sure the community does not get impacted by feeling like they're going to get treated a certain way whenever we want to make sure that all of these sites, they get the right message that they are not to treat anybody in any kind of fashion like you described that happened in that one incident, unless there's more incidents than the one you just sent me via text. But I just want to make that clear that that's just simply an administrative procedure that helps the flow of information and shows that we make every effort to answer the questions. That's it. In terms of after we're finished, we're happy to answer any of it. If the council wants to ask questions throughout the process, y'all can vote on it, and that's your prerogative. I don't think it's very effective, very efficient. Having done this for this long and having done it in the military, I don't think that's an effective process to do it that way. But if that's what the council wants to do, you're more than welcome to do that. Obviously, you get to decide what you want to if you have the right number of votes. And we've been very accommodating when it comes to any questions that you have. Now, back to your question about, is there going to be a police force at the entertainment districts? The police will respond to the high priority calls that they have to respond to, because the council said they wanted to make sure that we improve our response times. And so if you remember, they gave multiple presentations to the city council on how they've changed up their process, that their priority calls are lowered in the number of them so that there's more of a faster response because of the number of personnel that they have, or the lack of number of personnel that the police force has, because they haven't been to the same numbers they were since 2008, if you recall, in terms of the number of police officers on the police force, even though we've grown during that same time frame. So with respect to your question, is there going to be officers at these entertainment districts? They will be monitoring those areas, but that will not take priority over if they get a call over a priority one call. That could mean a lot of things. It could mean somebody's being robbed. It could mean other bad things that are going on. But they absolutely are aware that the bar is opening up. Ellen Smythe gave a presentation during her section of it in terms of getting information out there. Jessica, gave a presentation and has given one before on protocols, and she could be one that gets information out to the bars as well, so that we try to hit it off at the pass and not try to turn off the faucet. Maybe we prevent the water from getting to the faucet and not have those kind of problems.
Yeah, I guess in terms of being proactive, I don't see how having a presence in these places wouldn't be a deterrence for violation. And these bars have been closed for months with folks that are ready to go and party. And so I question why not having folks there would not be considered a deterrence to violation. So, and then the last point I had was relating towards outdoor spaces. It's great to see about the Shape It Up for employees, but we found out that unfortunately we only have 18 miles of bike lanes. I can send you an article into staff that we're currently going through what they're calling a third wave of biking in America, with the amount of bikes. Some bike shops have seen an increase of 300% of how many bikes are there. And so again, I want to stress that, as we know, our health indicators show that we're a city with a high percentage of diabetes, high blood pressure, and a sedentary lifestyle. And we really need to be more aggressive looking for outdoor spaces for exercising and walking. And I think it's great to see what we're doing for staff. I just wonder what we can do to provide for our community as a whole during this pandemic.
Well, I couldn't agree with you more about bike lanes. I would tell you that before we put the strategic plan in place, there was a lot less than 18 miles that were done. And all of it just cost money. The council hears an earful all the time about taxes. And so it's just a matter of how much money you're willing to put in for something like that whenever your priorities are police, fire, streets, and then the quality of life amenities as per the resident surveys and pursuant to the chime-in surveys as well, and also to the majority of the calls we get from the council through the CR process. So we are absolutely agreeing with you that more bike lanes we absolutely want to do. But as you know, Representative Sourcebine, that those are, my apologies, Mayor Pro Tem, you are absolutely aware that it's nothing that money couldn't fix. And over the course of the last 5 years, this council and the strategic plan and our staff have, and I've already alluded to this in lots of other responses, that we've come a long way in police and fire. With the 300 police cars, with the bond election that was done for police and fire, come a long way with streets. We didn't used to have over $30 million in annual pay-as-you-go dollars for the streets that we now do have those kind of dollars for those kinds of things. And we didn't have that before. We talked about $190 million over the next 3 years, and the 10 years before that there was only $62 million done.
Okay.
The bike lanes is another area, but let me finish. The bike lanes is another area that is sorely needed. And that we're vastly behind. We were vastly behind on a lot of fronts. But to come across as if you haven't acted, this council hasn't acted, and that we've only done 18 miles. Well, there was a lot less done the 5 years prior to the strategic plan. But the council only has so much money, and there's only so much that can be funded in terms of priorities. And as Sam Rodriguez alluded to yesterday, we've integrated it everywhere it makes sense. Where we don't close lanes inadvertently, and we have to have input from the public. And when we do that process
here, we really need to move on.
I appreciate that. My larger point is that there's cost-effective things that we can do to encourage and increase outdoor spaces for exercising and walking in our community. That was just his statement, and I appreciate again all the work that staff has done for every one of these sections for this presentation. These months have been tiring and trying for everybody. And I know that you guys are working as hard as you can with a lot of heart, because that's what makes this city so great. So thank you, Tommy, and to staff for everything you guys have been doing.
Representative Anello has another question. And before she does, I want to clarify one thing related to my request to the governor of testing and why we need it and how we get there. My call to the governor 2 weeks ago was based on information given by Dr. Ocaranza, Mario D'Agostino, and Jorge Rodriguez as to where we were from hospitalization and an ICU usage. And that's why we got the Rapid Response Task Force out here and for the epidemiology surge team out here. If we will base our decisions related to requests on more testing or where we are or status quo or whatever, based on the information that we get or that I receive from public health and Mario D'Agostino and Jorge Rodriguez. So that, I want to make that clarification. It's not just a numbers issue. It's going to be based on the scientific data that they give us based on hospitalizations and ICU usage. Excuse me, Representative Anello. I know you've been waiting. Thank you.
I just have a question for Dr. Ocaranza about his last slide. or anyone else I think could answer this. He's not on the call still, but on slide 37, it talked about hospital admissions per week as of May 9th. And so I just wanted to make sure, I don't know if that was just put in there for filler or if that's kind of where we are data-wise, if we're 3 weeks behind when it comes to data.
Let me get to that slide.
You're fine, sorry.
That's a slide that you're referring to, right?
I thought I have 37 down.
37.
And it was a few hours ago, so.
Yes.
Yeah, sorry.
That
This
one?
is the one. Yeah, and so you had said that this was as of May 9th, correct?
Yes. We have, we need to update this information and we go by weeks. We had that information up to that date. And as we gather more information, we will continue updating the graphs.
So, but just data-wise, where we are with COVID information, is the data we have right now as of May 9th?
No, we have some other information that are a little bit further. Every CDC weeks ends on a Saturday. So we finished last Saturday with another CDC week and we continue gathering information.
So the data that's coming out to us daily for hospitalizations is different than this, and we are more up to date.
Yeah, because these are new admissions, and the information that you get every day is how many patients are actually in a hospital and in an ICU.
So every Saturday, so the Saturday that we received, what was last Saturday, was the 23rd. We have the data for the 23rd already, or no? What was the last data we got? What Saturday? What date?
Not yet. We will continue working on gathering by weeks.
Okay.
So, but every day that you get information from the press releases, it's just the actual number of people in the hospital, and this is new admissions.
Okay, and you're just gathering this weekly. Okay, that makes sense. Thank you very much.
Thank you.
One thing that we need to clarify is that the hospitalizations, the hospitals are required to report to the state every day. I'm asking you, Dr. Mario, the hospitals are required to report to the state every day their capacity. Is that not correct? Dr. O, Mario?
I'm sorry, sir. Can you repeat the question? I'm sorry.
Aren't the hospitals in El Paso required to report to the state every day their capacity?
Yes, sir.
Okay.
The hospitals are required to report to the state their capacity and how many beds are occupied. And that goes actually in a total number of beds for every condition.
Right. So that's every day that's reported. Okay. Representative Rodriguez has a question.
Thank you. So my question is for whoever is making these graphs, is there any way we can have, because I feel like these graphs can be very manipulated to look whatever we want them to look like. So right now we just see the slopes continuing to increase. Is there any way we can have a graph with just basic percentages in comparison to our population in El Paso? Or if there's already one like that?
Do you want to see anything in particular, any of the health indicators?
Just the percentage. So, you know, if we have over 1 million people with county, what is that actual percentage of people that are being infected, and then the actual percentage of people that have recovered, and then the actual percentage of deaths that we've had, I'm sorry.
We will work on that so it can be very easy to understand, definitely.
Yes. So just something very basic like that, please.
I think, Dr. O, that's the per 100,000 stats we talk about.
Okay.
Okay. All right. Thank you.
Mayor, this
Laura,
is...
let's move on to number 2.
Mayor, I just had a question for Dr. Alcaranza before we go to number 2. And the question is that it's been reported that there's a lower number of positive tests usually at the beginning of the week Is that in fact true? And if so, why? Why do we see a smaller number of tests, say like on Mondays and Tuesdays, and then they increase towards the end of the week? Is that true? And if so, can you talk a little bit more about that?
Definitely. And the way that we receive the test results from positive test results are from a lot of the private providers, a lot of the private labs, and some of these don't report over the weekend or don't work over the weekend. So you're going to see an increase, and that was the reason also why we compile some of the results and we put them by weeks, so we don't see that variation that you have for the weekend or the middle of the week. So, and also in the testing, if you saw, we try to put numbers that are meaningful. And right now we're testing a lot more than 100 people per day average per 100,000 population. So we try to standardize those numbers so it will not compensate, but it will cover for all those fluctuations that we have in the part of reporting.
Again, thank you and thank you.
Okay, let's go, Laura.
Yes, sir. Item number 2 is discussion. Item number 2 is discussion and action that the mayor or city manager is authorized to execute an interlocal agreement for laboratory testing facility for local state of emergency assistance between the City of El Paso, the University of Texas at El Paso, and Texas Tech University Health Science Centers at El Paso for the use of a UTIP facility for the detection and mitigation of COVID-19 cases.
Is there a motion to approve?
Motion to approve.
Second.
Okay, we've already covered what this is doing, so I'm hopeful there's no need for discussion. Let's go ahead and vote.
Okay. There is a motion and a second to approve the resolution. Mayor Pro Tem Schwartzbein.
Aye.
Representative Anello.
Aye.
Hernandez. Representative Hernandez. Representative Morgan.
Yes.
Representative Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
Lizárraga.
Aye.
Hernandez. I don't believe Representative Hernandez is in the queue, so that motion does pass with 7 affirmative votes. The next item is number 3. This is discussion and action that the mayor be authorized to appoint representatives to the El Paso United COVID-19 Community Transition Task Force.
Motion to approve.
Second.
Okay, Nicole.
I have a question for this.
Nicole's got a little comment on this.
Sir, would you like me to go through the presentation?
Can we do it quickly? Yeah.
Yes, sir, I absolutely can.
Thanks, Nicole.
Sure. I believe they're pulling that up now. This is a great example of the collaboration, Mayor Pro Tem, that you were asking about earlier. Next slide, please. So when this crisis hit us, COVID-19 in resilience terms would really be classified as a sudden shock to our system. We moved into crisis management mode. We obviously stood up the Emergency Operations Center and started to move forward in terms of addressing the emergency need in our community. The first COVID case was diagnosed on March 13th, 2020. The emergency declaration was issued on March 13th, and we have continued to see many lives lost and greater numbers of families that have been impacted by COVID over the course of responding to this sudden shock. Next slide, please. But now that we are entering several months of this crisis management mode, we see that the impacts are in fact growing daily, and there is a concern not only for what's going on right now and what has passed, but also what is coming. We've had many conversations about what potentially a second wave of the pandemic will look like, and how that will impact not only the opening of our economy, but also our public health infrastructure, as well as our ability to address the needs of the most vulnerable El Pasoans. Again, in resilience terms, this is where the sudden shock becomes an acute stress. This is something that we are seeing continue to place an ongoing pressure on city systems, city and county systems, as I've mentioned before. It's important that as we look towards the future, we need to look towards a transition policy and a transition plan from emergency response to a state of preparedness. And as I mentioned earlier, even in terms of the vulnerable population, this is about coming out stronger than we went in. And so in order to do that, we need to follow an evidence-based planning process. We need to make sure that we are focused on the data and the analytics. And I think to a point that Representative Rodriguez brought up in her question a moment ago, it's not simply about looking at the numbers and seeing the data. Rather, it's about being able to analyze that data and understand what it means so that it can inform pragmatic and effective policy decisions. Next slide, please. In order to do that, there is a need to establish a united task force. The County of El Paso last week adopted and formalized a resolution that created the El Paso United COVID-19 Transition Task Force. This task force is needed, and as was presented to Commissioners Court, to research, create, advance, and present a comprehensive plan that's based, again, on that data, on medical research and other plans that we've seen best practice across the country compared with the situation here on the ground in El Paso. The task force should be comprised of health experts that include infectious disease specialists, hospital leaders, epidemiologists, and other medical professionals. It also needs to include our emergency management team and public health professionals. This idea actually emerged as part of a conversation that we had with the county a few weeks ago, or I guess it was last week, that the city manager mentioned earlier. And so to be inclusive of all of our community partners as well as elected officials, the way that the resolution was passed at the County Commissioners Court last week is that elected officials, one from the city of El Paso and one from El Paso County, would also participate. It should be clear that this task force is intended to, again, analyze the data from a expert medical perspective, as well as an emergency management perspective, so that they can offer the data and the information in a consistent way, both to the County Commissioners Court as well as the City Councils, so that you all can make well-informed policy decisions. It should be clear that the task force will not be making policy decisions. Rather, they will be offering the information and the guidance that you all need to be able to take our community forward. Next slide, please. In building a transition plan, we will be tasking this group of medical professionals and emergency responders to inform, as I mentioned, public policy as we try to figure out how do we transition from crisis management mode into a semi-permanent state of preparedness. The plan should address areas that you heard talked extensively about today: testing capacity, contact tracing, important data, and other triggers that, again, guide our public policy steps, guide our decision-making process in terms of how to best take our community back to some level of normal. It will also address things like supply chain monitoring, hospital capacity, public education, and outreach. Messaging has been so important, and our team in the Public Affairs Office has done such a phenomenal job in partnership with everyone across the organization. But it's also important that we have a consistency of information across all of the folks that have interaction with the public. And so again, leveraging this task force and the many stakeholders that will be a part of it to try to align and create a consistency amongst our education and outreach efforts. They will also be looking at risk assessment and overall public health preparedness as we move through and out of this crisis. The plan will help guide the leadership of the City of El Paso and El Paso County as we allocate resources and formulate plans to take us back forward out of this crisis. Next slide, please. So the request for action today is that the mayor be authorized to appoint representatives to the task force to represent the City of El Paso. As I mentioned, the county commissioners have already established the task force. The action today is to codify our participation and, again, allow the mayor to appoint representatives from the city council, or a representative, excuse me, from the City Council to be on the task force. And further, that myself, the Chief Resilience Officer, be directed to work with the task force and provide input on behalf of the city and report back the findings of the task force to City Council.
So two things. What I wanted to mention is, number one, this is a good example of the cross-pollination and collaboration with the county. This I think personifies that. And then secondly, when we met with them, I assigned Nicole to be the liaison to this committee because of her work in the chief resiliency space. And she's done a very good job with that. And this just made all the sense in the world. So that's the reason why it's written that way, for the action to formally have her be the point of contact for this particular effort. And that's why she's presenting this.
Thank you, sir. Next slide. And that's the end of my presentation. I'm happy to take any questions.
I understand Mayor Pro Tem wants to speak.
So our action today is to authorize the mayor to appoint somebody. It's not to necessarily offer suggestions to change the composition of the task force.
No, sir. Today is only to appoint our representation.
Okay, because I had because I was looking at it, I was just wondering why there was not representation from our state delegation or our federal officials on this. And so, but I understand now that that's not within our wheelbarrow. So I'm curious, Mayor, who do you intend on appointing onto this task force?
I haven't decided. Hadn't been discussed. We got to pass this first and then we'll look at it.
Do we know how the county appointed their representation?
Yes, sir. The County of El Paso on yesterday, appointed Commissioner Vince Bettis to represent them on the task force.
So the county, the commission, the court as a whole appointed it, wasn't just the county judge?
The court did vote on it. It was proposed by the county judge.
So would this have to go back to the council for approval?
Not necessarily, sir. Not in the way we've written this. We're just asking that the mayor be authorized to make that appointment.
Okay.
Is there a motion to approve?
Yes, Mayor, we do have a motion and a second to approve the requested action.
All right, let's vote.
Okay, on that motion, Mayor Pro Tem Schwartzbein. Mayor Pro Tem?
Yeah, no, I'm thinking. I mean, I guess the other option would be the council as a whole would appoint somebody if the mayor was not authorized to do so.
Mayor Pro Tem, why don't we vote for this and then you can see who I would select and then you can decide on that.
But,
you have a problem.
It,
If you have a real problem, then you can bring it back up, okay?
way that it's written wouldn't do so. Okay, yes.
Thank you. Representative Anello?
Aye.
Hernandez?
Yes.
Morgan?
Yes.
Salcido?
Aye.
Rodriguez?
Yes.
Rivera?
Great presentation, Ms. Farini. Yes.
And Lizarraga.
Aye.
The motion passes unanimously. The next item is number 4. This is discussion and action on a resolution authorizing the Community Development Department to enter loan modifications or loan amendments to the following programs: First-Time Homebuyer Loan Program, the Single Family Loan Program, the Multi-Family Loan Program, and the Empowerment Zone Loan Program.
Motion to approve.
Second.
Any need for further discussion?
No.
Let's vote.
There is a motion and a second to approve item number 4. Mayor Pro Tem Schwartzwein.
Aye.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
And Lizarraga.
Aye.
The motion passes unanimously. The next item is number 5. This is discussion and action on a resolution to approve an amendment to the city's 2019-2020 annual action plan to add $1.9 million in emergency solutions grant CB funded projects and services.
Is there a motion?
Motion to approve.
Move to second.
Kit.
Let's vote.
There is a motion and a second to approve item number 5. Mayor Pro Tem Schwartzbein.
Aye.
Representative Anello.
Aye.
Hernandez.
Yes.
Morgan.
Yes.
Salcido.
Aye.
Rodriguez.
Yes.
Rivera.
Aye.
And Lizarraga.
Aye.
That motion passes unanimously. The final item is number 6. This is a presentation regarding COVID-19 effects on cross-border traffic and other data trends.
Hi, Laura. Can I share my screen real quick?
Yes.
I want to be able to control the slides, if you don't mind.
Okay, yes. Go ahead, sir.
Give me 1 second. Trying to find the... Okay. Perfect. So thank you, Mayor and City Council, for giving us a chance to give you all an update on what is happening at Bridges. My name is David Coronado. I work for Bridges with the City of El Paso. Before I go into the slides that we have here for you all today, I just wanted to give you some background on what you'll see right now. It'll help you give us some context and just a quick review of the information. So as you know, the City of El Paso owns 3 bridges within the El Paso city limits. We own PDN, Paso del Norte, and Stanton Downtown, and then Isleta on the east side. We do not own BOTA, and so the data that you will see here today does not include BOTA crossings. The data that we have here today for you all to see is southbound data from El Paso to Juarez between folks using our city-owned bridges, PDN, Stanton, and Zaragoza for all 3 modes. So again, people are used to looking at data from Juarez to El Paso from CBP, but in this case, we're using City of El Paso data because it's the data that we have most current and to date. Our team actually updated the data last night at midnight, and so we have the latest information available for you all to see on what's happening at the bridges. So having said that, again, you wanted to give you also a brief review of summary of what you'll see right now. So there is no question that, with the travel restrictions that the federal government put in place along the U.S.-Mexico border, crossings have decreased substantially between both countries and here locally as well. So we've seen that decline on pedestrian crossings and also personal vehicle crossings the day after the restrictions were put in place. And there was a delay in the impact on commercial traffic after non-essential businesses were closed with other state and federal government, orders throughout the country and also in Mexico. So talking to Index, the Maquiladora Association in Juarez, which is largest in Mexico, they tell us a few weeks ago, I want to say 2 or 3 weeks ago, that 30% of the members remain open today. The rest, the other 70% are closed because of non-essential businesses being closed. Now, this number might be a little bit higher now. The 30% might be a little bit higher now because the government in Mexico has added automotive, construction, and mining as an essential business. And so now those maquiladoras can reopen, in phases as well as they reopen their doors to the workforce. So we'll see a spike in crossings on the cargo side, which will help the economy as well. So most economists in the U.S. and in Europe agree that we believe we are already in a recession today. And we don't expect to see growth until the later portion of the second half of this year, going into next year. So again, it's going to be a really slow recovery, a really sharp decline in the first second quarter of this year, and then a slow recovery in the second half. We believe that to go back to pre-COVID-19 levels in employment, it'll take us 3, 4, 5, maybe even 7 years to recover back. So again, it'll be a really slow recovery. So here on the graph, I'm showing you percentage drop in crossings by day. So the way we're looking at this data that we have at Bridges is we are looking to as 2018 as our baseline year. We cannot use last year, 2019 numbers, because last year we had the migrant crisis. It was a really abnormal year for us. We had that huge decline in crossings during the spring. We recovered back in September. So again, 2019 is not a good year for us to use. We're using 2018 here. And so here is essentially a percent decline, percent change in crossings by day from March 1st all the way through, like I said, last night at midnight. So right now on cargo, we are seeing a 29% decline in cargo truck crossings, 31% decline in personal vehicle crossings, and 70% decline in pedestrian crossings. Again, that's as of last night. On the pedestrian side, we bottomed out at about 82% in mid-April. We bottomed out at about 70%, more or less, in late May, or March, I'm sorry, for vehicles. And then we bottomed out at 42% for cargo just a few weeks ago. Again, if you look at the impacts of the orders, as they come into play over time, you see the impact right away of the non-essential travel on the vehicle and pedestrian side, but you don't see that same impact on cargo. We saw that impact as businesses close, maquiladoras close, and so that's when we start to see the impact on the commercial side. We've seen a spike in crossings since then as more essential businesses open, and we have the Open Texas plan. We are starting to see recovery in the numbers. Pretty low on the pedestrian side, pretty slow on the pedestrian side, but much more rapidly on the cargo and on the vehicle side as well. Looking at only personal vehicle crossings alone, again, 31% decline in crossings. Right now, on average, we are seeing about 7,000 vehicles crossing through city-owned bridges, again, Zaragoza and Stanton, going into Juarez. Last year, the number was at about 9,000 trips. So again, we're just shy of 70% capacity of last year. Looking at data by the hour, we see data here by the hour, by the day of the week in crossings for vehicles. The orange line is the average pre-COVID-19 level. The black line is current levels today. So we're seeing the same peaks and valleys throughout the day. You see the afternoon rush, the people go back home after their work and leave El Paso, go to Juarez. But again, we're nowhere near the pre-COVID-19 levels that we saw before on the vehicle side, especially. Pedestrian side, again, really slow recovery. We are at about 3,500 trips a day for pedestrians. We used to have almost 13,000 trips a day in 2019. So you see that spike again in pedestrian crossings in the last year in the spring, and we see the decline of vehicle crossings because wait times were so high back then for vehicles. So you see that shift, right, that dynamic. Again, so declines have been much more drastic this year than compared to last year. Last year was just a really short period. Here we see that long recovery over time. On the cargo side, we have right now, on average, 1,200 trucks crossing a day through Zaragoza. That number used to be about 1,800 trips a day through the Zaragoza port of entry. Again, we see that slow decline. We believe cargo has already bottomed out in early May, and we're starting to see that recovery again. As more businesses reopen, we have more activity, more cargo trucks will cross, so we see that spike. On the cargo side, though, it's a different story at the bottom. So when you look at cargo crossings by hour, by day of the week, we have here the black line following pretty close the orange line, pre and post COVID-19 levels, pretty close. But in the afternoon hours, you see that decline in crossings. So that is due to the fact that many truck drivers are not making that second, third trip in the day because the supply just isn't there. The need just isn't there for that to happen. But again, in the morning hours, pretty consistent. Afternoon, you see that decline. So one of the things that also we track at bridges is wait times, right? Which crossings, wait times, and other data sets. With the wait times that we're seeing now at bridges, we stopped the P3 program on the vehicle side. Right now, the bridges are empty. I'll show a few images right now. On the vehicle side, there is just simply no need for us to invest P3 hours with CP officers to open more lanes. We just don't need it anymore during these times. On cargo, though, we are tracking performance. We are tracking crossings and wait times to see if it is still needed, since we've already bottomed out and we believe we're starting to pick up again. Here I'm showing wait times for the first quarter of 2018, 2019, and 2020. Similar trends, similar patterns for wait times. We do see a decline in wait times in April compared to the last 2 years. So we're tracking this. We've talked to CBP, we've talked to the industry to see whether or not it's needed. And so we're looking at that at the crossings to see if we do need to continue the program. We want to continue to support the industry. We want to continue to support the supply chain, especially during these hard times. But if there's no need for us to provide the relief and those more additional lanes, we'll essentially take the savings and then stop the coverage. So this is what you'll see right now on any given day of the week, pretty much the entire day, with the exception of a few, peak times. You see empty bridges. This is PDN looking south, PDN looking north, Zaragoza looking south, looking north, and Zaragoza looking south. There is no wait time for vehicles, no wait time for pedestrians, but you see the trucks continue to flow throughout the day pretty consistently. Again, we're tracking that as well. One of the things that also helped the city of El Paso with regaining those crossings at city-owned bridges is that on the Mexican side, the state of Chihuahua is doing temperature checks for every passenger, every pedestrian crossing into Juarez. They are being stopped and they are being checked their temperatures as they go into Juarez after aduana inspection. And so this has increased now wait times from El Paso to Juarez, which is the reverse, right? What we used to have before. We have now higher wait times from El Paso to Juarez. So with the higher wait times at Bora, people are starting to use Stanton and Zaragoza to avoid that traffic. Even though there's still temperature checks on those two bridges, the load is being spread across the entire system. They find substitutes. And so we're seeing that spread across traffic, across the bridges. So again, we look at all this data, day in and day out, but without having the input from our committee, the stakeholders, the agencies, the data is meaningless. For us, it's really crucial that we continue working with the committee, and we have during these times. We now have meetings via Teams. We have meetings still every month, tracking projects with every agency, asking them questions, Index, Maquilora, what are they seeing, transportistas. So this has been a really good group to have during these times to be able to bounce ideas off of and get feedback from users about what they're seeing out there. We get updates also from Fideicomiso de Puentes, which is our counterpart in Juarez, and they tell us that they are seeing similar numbers to what we're seeing on the southbound trips. They're seeing the same decline on vehicle, same decline on crossings for pedestrians, same decline on the cargo side. So again, we're essentially working with them throughout these difficult times. Wanted to also give an update on the cross-border project that we briefed you on last year. So the program was started in the last quarter of 2019. We sent out the surveyors with Colegio de la Frontera, our partner in this project. They were doing surveys out there last quarter of 2019, first quarter of 2020. We had to stop and pull the surveyors out from the field for safety concerns. So we did that in mid-March, but we did collect about 14,000 surveys during those 2 quarters. Right now, the team at Bridges is collecting the data, cleaning it up, and then we hope to come back to you all in a couple of months with an update on those results, asking questions about how often they travel, what bridge they use, how much money they spent in Juarez or in El Paso, reason for the visit, all this information that we don't have right now. Again, we hope to restart this survey project within the next few months, as soon as we have a vaccine, a treatment, and then things normalize again. But for the time being, we stopped the survey for safety concerns. So we hope to come back to you all with an update on this project pretty soon here. Before I end the presentation, we wanted to give an update on what's happening out there. We talked about right now data analysis and what we're seeing in the community in El Paso County and other cities in Texas or in the U.S. This is the latest data on unemployment data from the state of Texas and El Paso County specifically. We see that huge spike in unemployment from 3.8% in just 2 months ago to almost 15% this last month. You see the data from the Great Recession, almost shy of just 10%. So already in 2 months, we went up beyond the pre-Great Recession levels. And you see that even back then, it took us 1.5 years, more or less, to go from the bottom, from bottom 5.3 to 9.9. Now it's just surreal numbers we're tracking. The same goes for uninsurance claims. Back then in the peak during mid-March, it increased by 28-fold in insurance claims. We're starting to see the decline in the numbers for claims. Again, as more businesses open again to 25-50% capacity, we'll see those metrics come down. But again, we wouldn't be surprised if this number here continues to be at that level or a little bit higher for the next couple of months. They're saying that in the US, this number might reach 15, 20, 25%. We expect the number to be lower in Texas. And so, we'll have to wait and see what happens with the economy locally and how we react to the new facing plan for businesses and how this number tracks and follows those that transition, those phases. Looking at the numbers by zip code, again, the figures follow the workers where they live. So really high numbers on the east side, high numbers in the northeast, high numbers on the west side as well. As far as production in the U.S., we see the same decline in production in the first 2 months from January to March of this year. We see a 15% drop in production in the U.S. We are tracking employment in Juarez as well, so we expect to see the similar drop in employment in Juarez, same as we see in previous recessions. These two figures go hand in hand, right? As we see production in the U.S. declining, we see production in Juarez also declining, and then also we see trade declining. So this is the latest data from March. We see a pretty steady, consistent pattern. But again, in April, we expect this to dive in also a little bit in reaction to what's happening here locally. And then this is the last slide. So I mentioned we track the exchange rate because we do offer our users the ability to pay the tolls in pesos. So for the last few months, since early March, you see the numbers behaving erratically, really, the exchange rate. This is impacting our way that we conduct business at Bridges because we do have to adjust our Mexican toll rate to reflect these changes. But like I said earlier, as we reopen and the orders are removed from crossing back and forth across the border, this is going to impact the ability for Mexicans to shop and dine and spend money in El Paso because they have less money to spend. They have less pesos to spend in comparison to the dollars that they can spend in El Paso. So again, retail sales taxes will be also impacted as well in the coming months. So again, we're tracking this as well. So with that, that's my presentation. I went kind of quickly, but open to questions if you have any. Thank you.
David, Representative Forsbein has a question.
Yes.
Mayor, before anybody asks questions, let me just add one more thing, Mayor. I want to compliment David Coronado, and he gave this presentation to the MPO, and the MPO was very impressed, and they asked about it and wanted to be a part of the committee meetings that they've been having. And those meetings, by the way, started as a result of us wanting to do a Lean Six Sigma project, of which the Mexican government, the federal government, and we, along with those two groups, brought in black belts. We brought in a master black belt to facilitate the entire process and come up with an identification of what needed to get done on the bridges in order to effectuate the throughput of the traffic through there. In any event, that led to the $32 million we've received. I know that the previous council was involved with that. Mayor, you've been instrumental in that. So has this council. So has our state delegation in getting those dollars for us. That came about as a result of that Lean Six Sigma project. Also want to point out that David didn't used to be over there. We used to have a severe problem at the bridges. We've talked about this project as we have several other things. Like I talked about police, fire, streets, talked about the additional bike lanes, a lot of things that we didn't have in this community that we should have, that are very important and we feel are very important. And we definitely want to make strides in those areas and make improvements in those areas. This was one of those areas that we made tremendous strides in, and that we've totally revamped and changed the way we do business at the bridges, and we've transformed it. And this is what was the genesis behind the whole messaging presentations that we give into the council on the transformation of all these departments. It started with the bridges. They were a problem department, quite frankly. And when we sent David Coronado over there, and we hired economists to go work over there, they've done amazing work. They've really stepped up. They have really shown a tremendous amount of intellectual capacity to do all the things that we need to get done in order to have a better story. What they're doing at the bridges, other border crossings, other bridges want to emulate. They're not doing what we're doing. And as a matter of fact, the NPO talked about that and talked about how a lot of the other bridges have wanted to come see what we're doing, how we're doing it, because they're not reporting like this. So I wanted to just take a moment to thank David, because, it's one thing to put the people in the right places, but then they have to then step up and perform. And he has led this process. I want to thank Kerry Weston as well. And now Sam Rodriguez, who's involved with this also. We've got a great team on the leadership side that's leading a lot of these different issues regarding the bridge crossings and the different issues we're having to contend with. One last point.
He mentioned the part about 3.8% and going all the way to 14% unemployment. And then we have this internal struggle within these conversations we're having with the council. And we say, well, we don't want to open up too fast. But yet we're concerned about the employment rate. And yet we want to open up facilities in the quality of life space. Well, all of that has a consequence. One thing, we open up too fast, we don't want people to die unnecessarily. The other thing is that we want to open up because we want to have the revenues to open up these quality of life amenities that the council asked about. So we're not putting a deaf ear to any of it, but we want to make sure that the community and the council understands the complexities involved in these decisions. So we feel like the best way to come about making any of these recommendations to you is to have the data-driven processes in place so that we can lean on that. Because at the very end of the day, when we get questioned either by you, the community, or if someone actually dies, knock on wood, if someone actually happens to die as a result of any decision we make, we want to make sure that the data supports the decisions that we make. So when we say we want to open up responsibly, and we want to open up delicately, and that we want to open up in a way that we follow the bouncing ball, we follow the data, we mean that. And I want you to hear that, and I want the community to hear that we have our 26 departments fully engaged in really following what our mission says, and that's delivering exceptional services. The bridges are doing that. We had some issues in the past, quite frankly, and now I think they're performing at every level. He indicated they didn't include the BOTA system, but when we submitted that to the state and the request for $32 million, it did include the BOTA system because they treated the bridges as a system. So we really come a long way, and it's large part due to what David has done. And I wanted to thank him publicly and also thank the team and Kerry Weston and Sam Rodriguez.
Okay, Representative Horseman, your question.
I just want to thank David. This is very, very, very informative and interesting data. So thank you for doing this. One sort of question or observation I think would be really interesting to see from a data perspective, looking at these shocks to bridge crossings and going back to at least to 9/11, if not longer, to sort of see how that has changed and been impacted by different global events. It'd be an interesting point to see.
To your point, absolutely. So when you look at the numbers that we have right now, right, for production in the U.S., employment levels, trade, crossings, we've not seen an impact like this before. This is not a recession that is driven by housing bubble crisis, banking crisis. This is just completely driven by the health concerns and the health pandemic. So when you look at the numbers back to 10 years ago, completely different impact. Now, in terms of the budget, when we did the original estimates for budgeting for the next fiscal year, we did look at Great Recession levels to see how we can, sort of estimate performance for the next 16, 18 months, because we've not seen something like this before. It's just completely unique. So right on point. We are tracking those figures. Right now, here we're just showing you essentially the last 2 years for crossings, and then here going back to 10, 13 years.
Yeah, thank you again. This is really great data, and what you did with some of the unemployment figures too is really great. So thank you again for everything that y'all are doing.
Okay, let's move for adjournment.
May we have a motion to adjourn?
Motion to adjourn.
So moved. Second.
There's a motion and a second to adjourn the special city council meeting. All in favor?
Aye.
Anyone opposed? The city council meeting for Wednesday, May 27th, 2020 is adjourned at 3:50 p.m. Thank you.